Yes, good afternoon and welcome for this finally the fourth day of first National Ayurveda Cardiology Symposium powered by Medemy, Knowledge Partners, MUHS and Madhavbaug Institute of Preventive Cardiology. I am Dr. Omkar Chaudhary. I am the host of this event and I have thoroughly enjoyed last 3 days wherein 57 presenters of Madhavbaug, 57 doctors of Madhavbaug have shown their cases with the evidences, pre and post evidences, and have delivered beautiful presentations in front of all the Ayurveda fraternity. Today, we have around 25 presenters, 25 doctors of various regions of Madhavbaug, maybe Vidarbha, Gujarat, MP, UP, Karnataka. And these 25 presenters are absolute gems and they are going to present their fantastically treated patients in front of you. So let's begin our fourth day of this first National Ayurveda Cardiology Symposium. And let me introduce today the chairpersons of today's event, Dr. Ranjit Narang from our MP region and Dr. Rahul Mandole sir, the head of Research and Development Department of Madhavbaug. I will request Dr. Rahul to start with the proceedings. Welcome, Rahul sir. Sir, you need to unmute.
Sorry. Very warm welcome to everyone and very good afternoon, Dr. Omkar. And 58 presenters or the researcher from the Ayurveda clinical cardiology practice. And the last 3 days were like ये ऐसा समुद्र मंथन हुआ है कि इसमें से इतना सारा अमृत बाहर आया है कि आई थिंक इस अमृत की वजह से बहुत सारे पेशेंट में इम्प्रूवमेंट का स्पीड और बढ़ने वाला है. आयुर्वेदा को वी आर गोइंग टू टेक आयुर्वेदा टू द फर्स्ट लाइन ट्रीटमेंट ऑप्शन वेरी सून एंड आई एम सो कॉन्फिडेंट अबाउट इट. द वे आयुर्वेदा practitioners, they are practicing clinical cardiology with all the evidences. You just name the evidence and they will have all the evidence, including CT angiography, NT-proBNP, GLS, 2D echo, cardiac stress testing. So if each and every physician, they are having the bag of evidences that how Ayurveda therapy, which is completely non-invasive, which is completely allopathic or non-chemical entity kind of a therapy, and yet it is effective. And it is not just effective. Yesterday we saw a few cases where not only the quality and quantity of life has improved for maybe a month or 2 months or 3 months or 1 year. The few cases they were showing the patients, they are still living with a HF like condition since last 10 years and they are living happily. And this is what the strength of Ayurveda, this is what the strength of the Ayurvedic physician, and hats off to all the Ayurveda physicians, those who are practicing this clinical cardiology. So I wish best of luck to all the today's presenter. Our expectation is far high because today we are going to touch, I think, Gujarat, Madhya Pradesh, Karnataka, then the Vidarbha region. So the all intellectual states of the India we are going to touch. So definitely this will be the mix and as well as very interesting case studies we are going to study today. So all the best to all the presenters, or jam ke present karo with your own attitude.
Thanks a lot, Rahul sir. And now I'll like to spotlight Dr. Ranjit Narang sir. He is our zonal medical head who is handling our Kolhapur and MP regions. Dr. Ranjit sir, your views on this cardiology symposium. Kindly unmute yourself. Please unmute yourself, sir. Yes, now you're audible.
Yes, thank you, sir. So, good afternoon, everyone. कार्डियोलॉजी सिम्पोजियम में आप सबका एक बार फिर से स्वागत है. हम सब लोग जिस ऐसे सब्जेक्ट के बारे में सोचते थे कभी यूजी पीजी टाइम पे कि कार्डियोलॉजी के ऊपर हम प्रैक्टिस कर सकते हैं क्या, लेकिन ये माधवबाग के साथ देख करके, ये जो आज हमारे साथ इतने सारे प्रैक्टिशनर हैं, पिछले 9 तारीख से इतने सारे जो प्रेजेंटेशंस हो रहे हैं, वो अपने आप में एक बहुत बड़ा अमेजिंग, एक बहुत बड़ा खजाना है, या एक कहे कि जैसे राहुल सर ने भी अभी बताया, समुद्र मंथन से निकले हुए डिफरेंट डिफरेंट रत्न। मतलब एक चीज को लेके इतने सारे एस्पेक्ट्स हैं कि जिसके ऊपर हम कभी सोचते थे कि ये कैसे हो सकता है। तो उन सारे एस्पेक्ट्स को लेकर के, आयुर्वेदिक कॉन्सेप्ट्स को लेके, प्रिंसिपल्स को लेके, मॉडर्न इन्वेस्टिगेशंस को लेके जो आप सब लोगों ने यहाँ पे प्रेजेंट किया है, हेड्स ऑफ टू ऑल ऑफ यू। बट आज की ये कड़ी एक और रूप में, मतलब जहाँ पे एमपी, गुजरात, विदर्भ एंड यहाँ पे जो कर्नाटक का रीजन है, उन सब के प्रेजेंटर्स आज हैं। मैं सबको यही बोलना चाहूंगा कि यस, जिस तरीके से ये कॉन्फिडेंस से आप लोगों ने केस किए हुए हैं, उनको जस्ट आज प्रेजेंट करने की बारी है। सो विश यू ऑल द वेरी वेरी बेस्ट और कीप कंटिन्यू। ये आपका जो सफर है ये ऐसे ही चलते रहे और आप एक नई मंजिल तक पहुंचे। सो विश यू ऑल द वेरी बेस्ट। थैंक यू।
Thanks a lot, Ranjit sir. And now, without wasting any much time, we are going to start with our first presenter. Our first presenter is Dr. Rupali Kavre ma'am, and her topic of presentation is role of Panchakarma on blockage management. She's from Amravati Clinic. So let's all welcome the first presenter of the day 4 of National Ayurveda Cardiology Symposium. Yes, Rupali ma'am, over to you.
Dr. Rupali, I think your audio is not connected. Your mic is not properly connected. Can you hear us? We are not able to hear you. Your mic is unmuted, but I think your headphones are not connected. Can you try removing the headphones and checking once? It could be issue with the system. Okay, you're connected on Bluetooth, right? So in your Zoom, next to the mic button, there will be an up arrow. If you click on that up arrow, there you'll see select microphone option. Can you see the select microphone option? There you will have to select your Bluetooth microphone. So doctors, in the meanwhile, those who have joined us on different platforms, welcome to this session. All those who are seeing on Zoom, of course, and there are people who have joined us on YouTube, LinkedIn, Facebook. Welcome to all of you. I have requested a small request I've shared to all of you. Please. Yes, Dr. Rupali, you are perfectly audible now. Great. So all those who are there in the meanwhile, while Dr. Rupali starts the presentation, request to all of you to please go ahead and quickly type in the chat box and introduce yourself to everyone around here. So Dr. Rupali, you are on screen, on camera, over to you.
So doctors, let me tell the rules of these presentations. All 25, 26 presenters, you will be given 8 minutes of time. If you exceed 6 minutes, I'll be giving a warning bell. Your last 2 minutes left. And in 8 minutes, you need to complete your presentation, because those last 2 minutes will be for the question answers. We'll be taking not more than 2 questions. And whichever doctor receives questions in the chat box, kindly do answer. Even when your presentation is completed, you please be active in the chat box and answer the questions which have been asked by the doctors. So best wishes, Dr. Rupali Kavre ma'am. And now you may start your presentation.
Sir, I am audible?
Yes, ma'am, perfectly audible.
Okay. Good afternoon, respected jury members and all my dear doctor friends. Today, myself, Dr. Rupali Kavre, Clinic Head, Madhavbaug Rajapet Clinic, Amravati. I am presenting a retrospective cohort study, Impact of Ischemia Reversal Process, IRP, and Reverse Diet Box on plaque reduction. The annual number of deaths from CAD is ranging from 22 to 2.26 millions to 4.77 millions. India is currently have highest burden of ACS, and in Madhavbaug we are treating these patients and see the good results in time of ischemia. But when we need to, but the question arises, what happens with the plaque? And in animal style, Madhavbaug had done animal trial research of Garcinia on plaque reduction. So here I am to present the study. To evaluate the efficacy of Ischemia reversal program, that is IRP, and reverse diet kit on plaque reduction. Sample size of 19 patients are studied for this. 17 patients has completed the study. For what we had done before contrast CT angiography was done before treatment, and 3 months after treatment, repeat contrast CT angiography was done to evaluate the volumic analysis of the plaque. The total 19 patients, 6 patients had left main with TVD, a critical CAD. 3 patients are with single vessel disease, 7 patients have double vessel disease, and 11 patient has history of MI. And then after contrast CT angiography, they was advised for PTCA or CABG. The comorbid history is as 11 patient has history of diabetes, 15 are HTN patient, and 1 having thyroid complaint. What we had done for these studies, we had used the combination of reverse diet kit and Panchakarma. Reverse diet kit, which is specially designed for cardiac patients with low calorie diet, having 1000 calories, low carb diet, and high ORAC value, rich in vitamin C. And Panchakarma was done like the Snehan, Swedan, and Basti. Snehan, as you all know, Snehan was done with the til tel oil with lavender flavor. Strokes are given towards heart. What Snehana will do, Snehanam Sneha Vishandam Mardava Kleda Karakam. Kled, we can correlate it with Clipit. Thermal vasodilatation was done. Shita Viparate Stamba Gaurava Nigraha. We can correlate it with the angina, which happens in the early morning, where the Sheet Gun was already present, and this is patient complain of morning angina. Agni Dikto Mardavam Tvakas Prasadam Bhakta Shraddha Strotoso Nirmalatvam. Strotoso Nirmalatvam, we can correlate it with the coronary system, where we Strotas, Raktavah Strotas में हम जहाँ पे we are doing the Nirmalatva यानी plaque reduction. And the main part of the treatment, that is Basti. Here Basti is done with the Gokshur, Amalki, and Haritra. Extract was used for the Basti treatment. What our treatment will do, it will impact on the reverse cholesterol transport system, where according to Ayurveda, we can say we work on the Agni Mandya, we work on the Medagni, that's why we get the result in the plaque reduction actually. The strategy is to increase the HDL level and decrease the triglyceride. As the study is done in Lata Mangeshkar Hospital, Indian has the high, which Indians cholesterol levels are high in the risk, that is high triglyceride level and low HDL level. So my target is to reduce the triglyceride level and increase the HDL level. Of course, reduce the LDL level too, which will give us the fantastic results. Yes, I had shared some PPTs, so first, second, and third. In this study, we are monitoring patient throughout for his first cholesterol report, second cholesterol report, and third cholesterol report. 3-month study, and then after we planned his second angiography. When patient came to me, just one patient's report I had shared with it. The triglyceride level is 566 and HDL is 69. This patient is on high risk of MI. MI has already, patient had already a history of MI, and then he visited to us. Here, how our treatment work? The Snehan, Swedan, and Basti. It decreases the oxidative stress, inflammatory changes which happens to the endothelium is reduced, and thus we improve the endothelium function, promotes the healthy healing, and plaque reduction is the outcome for it. Svedana, which reduces the afterload, decreases the cardiac overload, oxygen demand reduces, which is increased by it reduces the myocardial oxygen demand. As we all know, the endothelium, the internal lining of the coronary, which improves and the basti, which acts on gokshura, the content of basti, which act on the endothelium, it secretes intrinsic and extrinsic NO, which dilate the coronaries, and thus we get the result improvement in treadmill score also. And here are the results. Statins are tapered, nitroglycerin. All the patients are all sorbitrate, nitroglycerin, antiplatelets. Drug tapering was done according to the result which we see on the series. We get the result like this, and the medicine tapering was done. Here I had said we had done contrast CT angiography report before our treatment start, and then after we had done the second contrast CT angiography report. Before patient visited to us, angiography was already done, and here we can clearly see left main 80% plaque, RCA LCX 100% plaque, and LAD 80% plaque. Here is the contrast CT angiography report of this patient, and we can see this pink fibrofatty deposition, which was 85 in the contrast CT angiography, second CTA, 85 reduction in the plaque of LAD. Here I am sharing the another report of RCA, plaque reduction of 480 mm cube to 253 mm cube, 47 reduction of plaque. Here we can see the weight reduction, how it comes. But some patient, we can see here the not remarkable weight loss is there, because these patients are under low BMI. So we can conclude that our treatment work on patient having high BMI, more BMI, or in low BMI. We can give result in both patient, lean patient and obese patient. Improvement in plaque content. Plaque 1, plaque 2, and calcium plaque. That is lipid core reduces from 1470.3 to 1096.6. Plaque 2, 7900.1 to 5514.5. And calcium, here is a slight progression in the calcium plaque. Thus, if we can conclude this, that we can stabilize the plaque, calcium is slightly increased, but the lipid core and fibrofatty plaque, both plaques are reduced. Here the parameter total atheroma volume, which is average volume is 599.54, reduced to 438.84. The change is 160.7 mm cube. P value is 0.00. That is significant. Plaque 2, fibrofatty plaque, which is 464.72, reduces to 324.38. The total atheroma reduced was 140.33 mm cube, and the p value is 0.004. It is also significant. The lipid plaque 1 reduces from 86.55 to 64.2, 22.35 mm cube reduction in the lipid core, and that is p value is also significant. Calcium plaque, it is quietly increased, and it is not significant. So I can here is the result. We can see regression in the total atheroma volume, that is 26.80%. Regression in the high density plaque, that is 30.19%, and low density plaque, that is 25.82%. Thus we can conclude that the mean baseline total atheroma volume before treatment was 599.4 mm cube, And after treatment, total atheroma volume was, average total atheroma volume was 438.7. Total atheroma volume 160.7 mm cube, reduced by mm cube. So we can conclude that p-value is 0.06. Thus, we can conclude that IRP treatment and reverse diet box is effective in plaque reduction.
Awesome
Yes,
results. Awesome results, ma'am.
Thank you. Thank you. I want to thank our research guide, Dr. Rahul Mandole, sir. I want to thank all my team, my compliance doctor, Dr. Sadiq, sir, Vidarbha RIC head. And this is the result we got through your blessings. And I would thank to all my team, all my PKTs, and all my patients who believed on us for choosing the non-invasive method. Thank you so much.
Thank you so much, ma'am. Yes, Rahul sir, your views on this, please.
Actually, this is the first presentation what I am seeing in last 4 days with a proper statistic, because it was a cohort study, right, Dr. Rupali?
Yes, sir.
So I think you are practicing this atherosclerosis reversal program since last 2 years.
Yes,
And I think you are the way you presented your study, it shows that you are purely a researcher with clinical mind and absolute astonishing results. I think the best part what I see in your study is you don't just only focus on the plaque volume. You also you just dig down and you studied the plaque characteristic as well, right?
Yes.
Because what the results they were showing, a low density plaque which is vulnerable, very vulnerable in nature, you have reduced them first and the fibrotic in the later, right? So normally why to treat a blockage is always a question, because there are so many studies published. Regardless of regression in atherosclerosis, there are high mortality rate, because if you are reducing the blockage and you are not stabilizing the plaque, that may lead to the increase in the mortality due to the acute coronary syndrome. But if at all you are reducing the low grade plaque, that means the plaque which are very easily vulnerable, if you are reducing those vulnerable plaque, that will improve the quality and the quantity of life of patient having a coronary artery disease. So as compared to statin, normally the asteroid study which was published, which is showing that the statins on use of statin over 18 months can reduce the plaque by 6%. But here what we are seeing, in just a span of 12 weeks, the plaques are reducing by almost 30%. So superb work, Dr. Rupali and your team, and keep the good work continuing.
Thank you, sir. Thank you. And I want to add one thing. None of my patient has history of MI after treatment. Some patient had completed before 2 years. So I think it's a promisable report.
Superb, excellent.
Thank you. Thank you so much.
So now I'll move on to Dr. Ranjit Narang. Sir, your views on this, please.
Yes, Dr. Rupali ma'am, superb presentation. The best thing is that as you described right now, that no any patient affected with the MI during treatment or after this. So this is the best thing. And the most amazing thing was that you have concluded here the 19 patient data. So it's a huge data, and generally what we see in the published study, they say that the management of plaque or plaque stability is a hard work for them, but you have not only stable but also regress that plaque. So really this is a unique work. So keep it up. That's superb. All the best, man.
Thank you, sir. Thank you so much.
Yes, and a best presentation will not have any questions. So as of now, we don't have any questions. So 100 out of 100 marks to you, ma'am. And now we'll move on to our next presenter, Dr. Pankaj Kavre from Amravati Clinic. And the topic of presentation today is role of Panchakarma on Asterospermia in DM patient, a case study. It's a very unique topic. So let us all welcome Dr. Pankaj Kavre. Can we have the spotlight? Yes, for that, sir, you need to start your ready. Perfect. Yes, welcome, Dr. Pankaj Kavre, sir.
Yes, sir. Thank you. Just screen sharing. I want to start.
Yes, you have 8 minutes of time.
Yes, sir.
Best wishes.
So just
take your time. Relax.
So in the meanwhile, all those who are there present in this Zoom, I can see a lot of faces over here and a lot of cameras which are still switched off. I think makeup nahi hua hai sabka shayad. So what are your learnings from these 3-4 days? I would request each one of you to please go ahead and share what is your learning from these days, these 3 to 4 days of presentation. So kaun share karega? Let's have a quick sharing from each one of you. What is your learning from these 3 to 4 days of presentation? What is your takeaway? I think Dr. Pankaj is ready. Dr. Pankaj, you'll have to resume your slideshow. Resume slideshow. Okay. Click on shift and perfect. Great. All the best.
Yes, Dr. Pankaj, your time starts now. Best wishes.
Good afternoon to all of you, all respected doctors and jury members. Myself, Dr. Pankaj Kavre, compliant doctor, Madhavbaug Cardiac Clinic, Rajapet, Amravati. My case study is effect of Panchakarma on Asterospermia in diabetic patient. Nowadays, diabetes is very quite common as there are lot of causes: obesity, hereditary history, weight, then and lifestyle disorder, improper diet, all these factors, because of which young age we are very commonly seeing young patients in diabetes. And because of diabetes, there are a lot of complications: retinopathy, cardiomyopathy, or nephropathy, all these things. And an important complication of diabetes is the disturbance in the male reproductive system. Glucose metabolism is an important event in spermatogenesis. Many studies in both human and animal have confirmed the deleterious effect of diabetes on sexual functions. We are commonly seeing patients commonly complaining with those who have diabetes mellitus, loss of libido, erectile dysfunction, or early ejaculation. And as there is spermatogenesis hampers, so there is no shukra properly, and the symptoms related with shukra, kamottejana, and these have very major impact on their family life. A lot of patients have infertility is there, and so IVF suggested, and psychological tension is there, and also IVF suggested. Then economical tension is also there, and very commonly these patients are on metformin, and studies shows that metformin significantly reduced the percentage of motile, progressive, and rapid spermatozoa, and significantly decreased sperm velocity. As Med Dhatu and Kapha Dhatu both are improper in this disease, Kapha dosh. So the gun, manda gun. So motility, there decreases the motility also. Viscosity increases. Here is one screen where normal sperm motility, where sperm goes to home, and because of diabetes mellitus, metformin impact may be abnormal sperm motility. It doesn't focus, or it can't goes to he missed the aim, we can say. Here is my case. His age is 27 age, male, history of diabetes mellitus from Amravati. He had diabetes from 2019, and 2019 and taking treatment for diabetes since 3 years, married from 1 year. And after 6 months, he comes to know after marriage that as there is no pregnancy, semen analysis done, and after 6 months, he comes to infertility, knows about the infertility. He had very strong history of diabetes, and also he has frequent kidney stones. When he came to us in 2022 January, he complaining of raised sugar and Asterospermia. He was on treatment: Hoglium before dinner, Almet GM before lunch, Fertilium, HS, Carnivore, LQ, OD. His HbA1c was 8.1. That time, and he was diagnosed as Asterospermia in 2021. Their non-motile spermatozoa 100%. Sperm count was 21 million only, and in 2022 we started his treatment. His weight was he is working as in the MSV. His weight was 90.2 kg. His 92.2 kg. Then his BMI was 30.8. Then at our center, here is his reports. In 2021, poor motility was there. Asterospermia, that time sperm count was also very less. Then in 6/1/2022, his count was 28 million per ml, and non-motile was 100%, means Asterospermia when he comes to us. Then diagnosis, my diagnosis is type 2 diabetes mellitus with Asterospermia. And in Asterospermia or Azoospermia, there are a lot of factors, just like genetic factors, lifestyle factors, infection, drugs, hyperthermia is also one of the cause. Smoking, these are all drugs. We can say drug means metformin, which has, or we have that kind of results also. So I started medicines, oral medicine, Ashwagandha, which is Rasayan, Vajikar, Shukral, and also works on psychological tension also. Punarnava, which is Mutral, works on diabetes. Our aim is to reduce, as he comes to us for diabetes, and at the same time Asterospermia complaint was there. So, and it is diabetes is one of the hetu in his Asterospermia complaint. So Punarnava, which is Mutral, and works as Rasayan and works for reproductive system also. Varun and Gokshura. Varun is Ashmarigna, Gokshura is Mutral, Rasayan, Vajikar also. Meshashungi, it is anti-diabetic quality and increase the insulin secretion. Amalki, it prevents lysis of insulin. Haridra, it clears dosha in Meda, Mansa, and Dhatu. Guduchi, it is Tridoshagna and Kapha quality. We started him diet plan, low carb protein diet, which reduces weight and anti-diabetic qualities the diet has. Then in Panchakarma, Snehan with neem oil, it is the Shakagat dosh comes in Koshtagat, and then detox. We used to detox it. So neem oil use, which is Kapha value mainly. Then content for Basti, Gudmar extract 4%, Daruradra extract 2%, Estimodo extract 4%.
Last 2 minutes.
3 things. Yes, sir. These 3 things, because of this, it works on Kapha quality, and as reproductive system, according to our Ayurveda, Basti works on reproductive system also. So it is also in mind. And in this, we avoid Swedan, as hyperthermia is one of the basic cause in such cases. So we avoid Swedan karma. Then here is the result. So here is after 3 months, his non-motile sperm count is only 18%, which was 100% within 3 months, and normal and count was 38 million per ml. So normospermia. Weight reduces from 92.2 to 89.5, BMI 30.81 to 29.9, HbA1c 8.1 to 70.1, Asterospermia to normospermia. Metformin, glimepiride, these all drugs reduces to only glimepiride. We stop metformin, and here's the result. His wife got pregnant. The happiness on his face is very encouraging, which gives us to work more and more. Conclusion: DM Panchakarma, medicines and diet can effective in male fertility and increase sperm motility. Ayurveda treatments works on supergeneity, tapering of metformin increases sperm motility. My team, Dr. Rupali Kaure, myself, Dr. Pankaj Kaure, Dr. Kirti Deshpande, our all team, Sadiq sir, and all. Thank you. Thanks to everyone. And Madhavbaug.
Fantastic presentation, Dr. Pankaj Kaure sir, and I'll move on to Dr. Ranjit sir. Your views on this, please.
Yes, Dr. Pankaj Kaure sir, awesome presentation. The good thing is that these are some hidden factors where practitioners do not focus. Generally, when the patient comes to us and we focus only on the diabetes and the management of the blood sugar, but very rarely there are some doctors who identify the real problem and the real happiness of the life, because by treating not only diabetes but also his main complaint, you have given his happiness for the life. So this is the awesome thing. So I think by conclusively, your diagnostic purpose and diagnostic approach is very good. Now the thing is that whatever you have given, have you collected some more data on, or only there is a single study? I think if there are the number of patients, so it can be concluded that this is the awesome way by which you are treating.
Yes, sir.
Okay,
But
all
sir,
the best.
Yes, sir.
Yes, Dr. Rahul sir, की तरफ से कुछ suggestions and questions. Over to you.
Yes, sir. I have not few queries, not what I'll say concern. The few queries. The one query is you tapered metformin. Metformin itself causes Asterospermia, Azoospermia, right?
Yes,
So
yes,
the results that we are getting is because of a tapering of metformin, or because the product what we have used is not there is not a single product who is having a property of a Shukraj, right?
Yes, sir.
Because
A lot of products that
Udmar,
all have.
Daru Haridra,
Yes.
Yashtimadu, or
Yes,
the
sir.
Nimba, the Panchakarma that we are, the product that we are used in the Panchakarma, they don't have any property like they are acting on a spermatogenesis,
Shukra.
right? But
Yes, sir.
it's a good thing that with a diet you maintain the patient's HbA1c.
Yes.
With your Panchakarma you maintain your patient's other profile good, but these are the results, specifically how we can constructively and conclusively say that this is only because of this treatment, not because of a tapering of a metformin.
So it is as it is one of the basic metformin, and research says that because of metformin, spermatogenesis hampers. Number one. Number two, sir, because of diabetes, according to Ayurveda, as I said earlier, Medha Dhatu, Kapha Dosh, these are Mandagun, which is Mandagun, Sandragun increases. There is Vikruti. And as we reduces weight, as we reduces HbA1c, as we reduces sugar level, so Mandagun comes down. It is Kapha Dosh comes normal in level. So there is normality in, so it is properness there now, I can say. So, and
I understood your
yes,
concept, sir. I totally agree with your concept. I have no doubt about it. I just have this query that if at all अगर हमने metformin taper नहीं किया होता, और if we continued the metformin, can क्या हमें ऐसे ही result मिल सकते थे क्या?
सर मैं ऐसा नहीं बोल सकता हूँ, क्योंकि मेटफॉर्मिन स्टॉप करना वन ऑफ द थिंग भी थी, क्योंकि वो माइंड में था कि बिकॉज ऑफ मेटफॉर्मिन मोटिलिटी हैम्पर्स.
So maybe what we can do ना, in the future if we do some case control study, अगर जो patient में metformin नहीं stop किया है, if we count their sperm and their characteristic of sperm pre and post, that may give us a good idea regardless of continuation or discontinuation of metformin, this therapy is having some very positive impact on the spermatogenesis process. This is the one thing. And second, I have a good suggestion for you. Whenever we are showing the results or the what say अपने जो ये शो किया था ना पेशेंट का रिपोर्ट. So please hide patient's name. Do not disclose patient's name. It is not in what favor of a good clinical or a good research practice. No? So next time, please take care of that part.
Requesting
and
all the presenters to please follow the same. Please do not disclose your patient's identity.
Sir, I apologize for that. It was in hurry slightly, and it is not good ethics. I can understand, sir. Yes, thank you, sir. I will work on it.
Thank you very much, Dr. Pankaj.
Thank you, sir. Thank you all. Thank you.
Yes, so we don't have any questions. Dr. Pankaj, there is one question which you can answer in the chat box too. It is regarding the Basti which you have used for our treatment. So you can answer that in the chat box. Now we'll move on to a third presenter, Dr. Rakesh Fukure from Bharginagar Square, Nagpur, and his topic of presentation is management of diabetic wound through Ayurveda therapies and lifestyle modification. Dr. Rakesh, I am going to spotlight you now. So be prepared. You have 8 minutes of time. Best wishes. Dr. Rakesh. So then I think there is some technical lag. I'll move on to the next presenter, Dr. Sumaira Imran from Madhavbaug Dhantoli Clinic, and her topic of presentation is study the efficacy of HFRT in patient with reduced EF. Yes, Sumaira ma'am, I am going to spotlight you now. Best wishes, and your 8 minutes will start now. And keep the presentation on slideshow or presentation mode. You need to click the enable editing button.
Hello, good afternoon, everybody. I'm Dr. Sumaira, a consultant of Madhavbaug Dhantoli Clinic, Nagpur. Today, I am presenting my presentation, and my topic is cohort study to study the efficiency of heart failure reversal therapy program in patients having reduced ejection fraction. As we are regularly dealing with cardiac patients, we commonly encounter cases of heart failure with 2D echo study showing reduced ejection fraction. The management of these patients comes in its own set of challenges. Here we are trying to put forth excellent result we encounter in our practice in treating this patient using principle of Ayurveda. Reducing ejection fraction of the heart to functioning optimal leading to insufficient amount of blood pumping from routine metabolic activity result in increasing resting pressure within the heart is known as heart failure. Some authors consider heart failure is a pandemic, and nearly 26 million of people has been affected it globally. In India alone has 9 to 10 million patients. Mortality rate in India is 0.16%. So we have to, heart failure are as high. So logically and anticipated that prevalence and burden of HF is rising in India. A variety of drugs are available for treating HF like ARBs, beta blockers, diuretic, antiplatelets, etc. Yeah, here survival rate in these patients are 75.5% at 1 year, 45.4% at 5 years, and 24.5% at 10 years, and 12.7% at 15 years. Therapeutic benefits of conventional therapy in HF like ACE, with ARBs, beta blockers, diuretic are due to anti-inflammatory, hypolipidemic, antiplatelet, and antioxidant action. Similar action has been found in various herbal drugs in clinical study. Thus, the quest are search of novel therapeutic agent for the management of Panchakarma and dietary therapies. Heart failure reversal therapy combines herbal Panchakarma therapy over oral polyherbal formation and dietary lifestyle modification. This retrospective study present the effect of HFRT in ejection fraction, low ejection fraction patients. Here we are using these 5 procedures to improve our patient to doing these therapies. That is 8 to 10,000 calories for diet, body cleansing method like Panchakarma, continue health monitoring, and drug tapering. According to improvement of the patient, we are reducing, and the protocol we are given from Madhavbaug, we are using tapering the dose of drugs. Panchakarma, here we are using 4 procedure in HFRT treatment, that is Snehana, Swedana, Ridhedhara, and Basti. Here we are using this sample size, that is 27 case study we are performing, and a study designed by observational. Duration of study is November 2018 to October 2021. Study site Madhavbaug, Dantoli Clinic, Nagpur. Patient including criteria is patient of age 50 to 75 year, ejection fraction less than 40%, and NYHA grade 2nd and 3rd. Function working capacity of HF as measure maximum on capacity VO2 max, which reflect on quality of life. Keeping this in mind, we plan our observation study of analysis of HFRT on VO2 max. Reducing ejection fraction EF lower than 40% with observation in effect of HFRT as per 2D echo. The following schedule is shown as next. Primary endpoint is ejection fraction, and secondary endpoint is peak, VO2 peak. HFRT is a 4-step procedure which was performed on patient with heart failure after a light breakfast on sitting. On procedure took 65 to 75 minutes. 6-minute walk test for VO2 max, 2D echo for EF, systolic blood pressure, diastolic blood pressure, BMI, ABG measure in day 1. According to their patients' cofactors, we are planning HbA1c, CD-angio, and anti-pro-BNP also. 21 Panchakarma in 3-month duration, plus diet box, diet according to patient's disease. It is 12 calorie per day, 1200 calorie per day. All these tests done on day 1 and repeated accordingly twice a week. The procedure we are using in HFRT is Snehana, massage and external orientation, yani centripetal upper stroke direction toward the heart. The drug we are using is Arjuna, 10 gram Dashmula, and 5 gram Nurgundi. Swedana, passive heart therapy. Here we are using Dashmul Kada for steam, and it is for 40 degrees Celsius. Ridhedhara, decoction dripping therapy for height of 7 to 8 centimeter. Lukewarm water with Dashmul Kada. Herbal we are using here. Basti, drug administration per rectum should be in body for 15 minutes for maximum absorption. And the drug we are using is again Arjuna, diffuser and calamus, that is Bacha. Statistically analysis, t-test was done here, and statistically significant to primary endpoint improvement is EF, VO2 peak, and secondary reduction in weight, BMI, ABG, heart rate, systolic blood pressure, diastolic blood pressure, and as well as reduction in dependency of conventional medicines. Here we are using null hypothesis, mean are equal and among all different time period. First with second follow-up, and whenever patient come to clinic according to their parameters. Alternative hypothesis, mean of an at least 2 group are significantly different. Level of significance is 0.00. The population we are study is male 17, female 13. Ejection fraction is more and less than 35. The past history of patients is CAD 6, HTN 20, DM 17, IHD 17, MI 90. The class 1 is 0, class 7, class 2nd and class 3rd are mentioned in the table. The sample size, the variable sample size, p-value are we planned as a statistically significant. Here we all see the parameters are improved comparatively. Other systolic and diastolic blood pressure is not that much significant according to other parameters. Effect of HFRT on body parameter as are shown in the table. Ejection fraction, that is 35, goes to improve by 53.4. VO2 max 19.4 goes to increase by 32.3. Weight 67 by 5 is decreased by 61.6, and BMI is 25.5 to 23.1. ABG 90 to 84. Systolic blood pressure 122 to 117. Diastolic blood pressure is 73 to 71. Discussion. The present observation study analyzes the effect of HFRT in patient of HF. Found that there was a significant improvement in EF, 6-minute walk, and VO2 peak from day 1 to day 90 of HFRT. Even secondary endpoint will BMI, weight, abdominal girth showed sustained improvement at HFRT.
Last minute, ma'am.
Yes. Change in ejection fraction, improving prognostic value for long-term survival and significant impact on the mortality risk. According to that, around 4 to 16% reduction fraction risk factor of mortality with increasing in VO2 peak by 1 mm per kg per minute was seen into one clinical study in patient with IHD. The significant improvement in EF and VO2 peak in the present study in 90 days of follow-up indicating reduction in death risk in patient of HF. So my result and conclusion is 27 patients with HF and EF lower than 40% were enrolled in the study of analysis where there were significant improvement in VO2 peak from 19.4 at baseline to 32.4 at the day of 90. The more significant improvement was seen in ejection fraction, which increased by from 35 to day 1 to 53.4 at day 90. Also, heart rate, BMI, abdomen girth, weight shown similar statistically significant improvement. Improvement in systolic blood pressure and diastolic blood pressure will not be significantly improved. Conclusion. From the finding of our study, HFRT has been found to be a potent and valuable therapeutic alternative option with HF, with reducing ejection fraction in improving the ejection fraction onto the echo examination. We observed significant improvement in EF, VO2 peak, 6-minute walk coupled with reduction in the body weight, BMI, heart, HFRT offer a promising indicative condition to potent therapeutic options treatment of HF with reducing ejection fraction. Thank you so much.
Super presentation, Dr. Sumaira. Over to you, Rahul sir. Okay. Over to you, Ranjit sir.
Yes,
your views on this?
Yes, sir, sure. Fantastic presentation, Dr. Sumaira. Awesome. 27 patient data on the EF is an excellent thing. Generally, what happens when the low EF patients come to someone clinics, so it is a concern of matter, so how we will manage. But you have managed 27 cases, so that is an excellent thing. One thing I want to know that how you were monitoring these patients. I mean to say that the 2D echo was assessment was on the first day and another one was on the 90th day.
Yes, sir.
So
yes,
in between, patient is going towards the right direction or towards the AF increase. So what was the assessment parameters? First one was their walk test, and anything other significant point? Is there was?
Yes, sir. When patient is coming to our clinic, we see all the parameters like I explained, 6-minute walk according to her symptoms. We plan what we have to do, 6-minute or TMT, and we check its VO2 max, and according to that we plan which category is in patient is in it. And after that, we plan systolic blood pressure, diastolic blood pressure, then BMI and loading. Just symptomatically, the patient are improving or not, we are seeing that on that paper, and accordingly we plan for that.
That's good. That's good. And have you also assisted lipid range of all these patients?
Yes, sir. Like I explained before, according to patient severity, we plan like lipid test, HbA1c, then if required, other tests like GLS. Now we are planning for GLS, stroke volumes, all these things we are doing now.
Okay, that's great. Super. All the best. Keep it up.
Yes, Rahul sir, your comments on this, please.
Dr. Sumira, superb presentation and congratulations because collecting a data of 27 chronic heart failure patient with HF-ref like condition, it is something more than superb, what I'll say. If I ask any cardiologist right now, do you have such patient data? I don't think any cardiologist is keeping such kind of a data and monitoring it and taking it to any conference. So hats off to you, your confidence, and congratulations once again for this. Few suggestions what I'm having. The patient, you said you check the VO2 peak. I just missed what you said after your presentation. Maybe Dr. Ranjit must have asked this question. The many of patient had HF ref like condition. So with by what method you calculate their VO2 peak?
6-minute walk test. How much patient working on the cover the distance, according to that will मतलब उस तरह से अपन उसको प्लान करते हैं कि वो पेशेंट 6 मिनट पे कितना मिनट चल रहा है एंड NYHA कितना है, उसका ग्रेड कितना है पर सेकंड.
How you are calculating the exact VO2 peak from the 6-minute walk test?
Distance covering by that much, sir. If a patient is covering 300, 400 and 700 distance, according to distance, we calculate VO2 max of the patients.
Okay. So I was expecting there must be some formula to calculate.
Yes, sir. Definitely, definitely.
Okay.
Yes, sir.
Okay. So each and every patient is you're with the same methodology, 6-minute walk test you are doing, right?
Yeah. Depend of NYHA, what the patient is in grade 1, grade 2, grade 3, or grade 4. According to that, we plan what to patient, what we have to do for patient. Is it in 6-minute walk test or TMT accordingly?
Okay. So even though the LVF is low, you may ask patient to go for walk on a cardiac stress testing.
No, sir. If patient is in grade 3 or 4 and having symptoms, so we plan before that कि भाई पहले उसको treat करे, subside करे, and accordingly फिर जैसे जैसे patient में improvement आएगा, accordingly we'll plan.
Okay. Well, just one suggestion: if you are conducting a 6-minute walk test, try to understand, try to analyze the heart rate recovery time after completion of a 6-minute walk test.
Yes, sir. I forget that point कि heart rate we are calculating before the patient मतलब पूरे parameter will calculate and after that we'll plan के 6 minute पे देके जाना है क्या patient.
Okay, because even though so many of time what happened, the LVEF is a visual based kind of a parameter, and maybe it may vary from patient, doctor to doctor, and clinic to clinic, and machine to machine. So it may have a huge variation. So many of this may happen if someone want to contradict to it, that this may be the inter-observer variation also. So, but the heart rate variability is a kind of a parameter which can be more accurate and more precise as compared to the LVEF. But the data what you have collected now, actually this is the reason our expectations are again very much higher from your side, and we want you to grow for beyond this. So this is the reason I'm asking you this. But at the end, this is the super presentation and good learning from your presentation that the 27 patients data, if anyone is collecting, this is a cohort. See, in level of evidence, the case studies comes at the bottom, then case series after that, then the cohort. So cohort comes above, far above the case study. So definitely the full marks to you and your presentation, and congratulations again.
Thank you, sir. Thank you, Rahul, sir. You are always supporting us whenever we are lacking. And here I am definitely thanks to Sadiq sir also. He helped me a lot for this making this PPT and all these things. So thank you, sir. Thank you, research team, for helping us.
Yes, thanks a lot, Sumira ma'am. And there is a question for you, Rahul sir, by Dr. Sandeep in the chat box. Have you observed patients with particular location and area of MI responded very well to your treatment and vice versa? So which MI zone is the worst?
Dr. Sandeep, as if there is a transmural MI, and in that case, the results, I'll say there will be little difficult to get a good results. But if the in other MI in other part, normally in Madhavbaug we don't treat patient as directly after the MI. We advise him to take some rest for at least 7 to 15 days, and after that we advise patient to come and start taking a treatment. Many of time what happened after MI, patient myocardium goes into the hibernation. If there is a full thickness MI, the hibernation time is more. If there is a partial thickness MI, the hibernation time is less. So recovery is depending upon the how much the MI, what are the severity of MI, regardless of maybe it is the anterior wall or the inferior wall or the apical, whatever, wherever the part is. But if there is a full thickness MI, the recovery is bit slow. But apart from that, there is no such problem, I guess.
Yes, thank you, Rahul sir, for clarifying the doubt. And now we'll move on to our next presenter. And the next presenter is Dr. Rakesh Fukure from Malgi Nagar Square, Nagpur. His topic of today's presentation is management of diabetic wound through Ayurveda therapies and lifestyle modification. Dr. Rakesh, I am going to spotlight you now. Be prepared. You have 8 minutes of time. Yes, doctor.
Unmute me. Yes, I'm on. Actually, I'm
yes,
not
you're
able
audible.
to unmute myself.
Yes,
audible?
you're audible. Audible. Perfectly
okay, yes,
audible.
sure. Thank you. Thank you. Thank you.
So you have 8 minutes of time. You can start your screen sharing.
Yes, thank you so much.
And keep it on presentation mode.
Sure, sure. Thank you, Omkar sir. Here I'm presenting. First of all, I'm Dr. Rakesh Fukure. I'm clinic head. I'm working since 3 to 4 years at Madhavbaug as a clinic head and franchise owner at Malgi Nagar Clinic, Nagpur. So today my topic is the management of diabetic wound with diabetes reversal through Ayurveda medicines, lifestyle modification, diet, Panchakarma, and compliance.
Your presentation mode needs to be on, doctor. It's still.
Is it in the presentation mode?
No, it's still not visible.
Because, sir, I have shared my another screen because there is certain technical issue regarding video. So you can see me log in twice.
That's fine, but
is it visible?
your presentation has to be on the presentation mode.
Hope it is visible, I guess.
It's visible, but it's not on the slideshow mode. Can you keep the slideshow mode on?
It is on the slideshow mode.
Do one thing, you should stop screen sharing and do it again.
Yes.
There may be a technical lag.
Is it okay now?
Now it's visible, sir. Yeah.
Yes. So his short introduction about diabetes. As we all know, diabetes is a chronic and metabolic disease characterized by elevated levels of blood sugar, which leads over time to serious damage to heart, blood vessels, eyes, kidneys, and nerves. So high blood sugar levels can seriously damage part of our body, including eyes. One second. Right. Okay. Damage to heart, blood vessels, eyes, and kidneys and nerves. High blood sugar level can seriously damage part of our body, including feet and eyes. These are called diabetic complications, but we can take action to prevent or delay many of these side effects of diabetes. So there are two types of diabetic complications: serious one that build up over time called chronic complication, and ones that can happen at any time called acute complication. So mentioned below are the two types of complications which are chronic and acute. Chronic complications are these are long period problems that can develop gradually and can lead to serious damage if they go unchecked or untreated. Like eye problems, foot problems, heart attacks, kidney strokes, kidney problems, nerve damage, gum disease related condition like cancer, and sexual problems in women and sexual problems in men. So acute complications, these happen at any time, may lead to chronic and long-term complication, hypoglycemia and hyperglycemia. Okay. So these are major complications of diabetes. Today we are going to discuss about one of the most important chronic complication like peripheral vascular disease result from narrowing of blood vessels, increasing the risk of for reduce or lack of blood flow in legs, feet. Wounds are likely to heal slowly, contributing to gangrene and other complications. So this is my objective: management of diabetic wound with DM reversal, diabetes reversal through Ayurveda medicines, lifestyle modification, diet, Panchakarma, and regular compliance to the patient. So what is food problems? Diabetic food problems are serious that can lead to amputation if untreated. Nerve damage can affect the feeling in your feet, and raised blood sugar can damage the circulation, making it slower for sores and cut to heal. That's why it is important to tell your general practitioner if you are notice any change in your feet, look or feel. So these are the basic symptoms of diabetic foot, like redness on foot, warm, swollen feet, break in the skin and discharge, itching, dryness, pain and stiffness, feeling unwell, ulcers of blister and sore feet. So here I'm presenting one single case study. One of my patient, she was suffering from diabetes with with hypertension, and she had diabetic. She was diabetic from 2013, and she has developed diabetic wound in 2016, which was uncontrolled, and she was on 2 oral hypoglycemic agents. She was admitted to one of the biggest tertiary care hospital in Nagpur district for wound management and suggested for skin grafting and be scared for amputation in future if this wound gets untreated and not well. So she approached to me in 2020. So she has short patient description. Patient was suffering from diabetes with hypertension since 8 years and developed diabetic wound since 6 years. She was not responding to the treatment. As I have already told, she has been approached to a tertiary care hospital for grafting. Patient approached Madhavbaug clinic for wound management with reversal of diabetes and hypertension in 2020. Patient was examined and found that patient was suffering from uncontrolled diabetes with swollen wound on right feet with pus discharge, redness, itching, not only over the wound but half of lower limb with severe pain. So she was advised some blood investigations like CBC, lipid profile, fasting and post-meal blood sugar, HbA1c, and clotting and bleeding time. So my diagnosis was diabetes with hypertension with complicated diabetic wound. So it's a short improvement in patients. Patient approached to Madhavbaug for a diabetes and heart disease reversal wound management. She was advised for our comprehensive diabetic care therapies, which we all know that within 90 days we are promising to patient for diabetes reversal, which includes diet, Panchakarma, Ayurvedic medicines, pranayama, along with local procedures for wound healing. So her parameters and medicines before treatment was she was on 2 hypoglycemic agents. One medicine was for 2 combinations and one was single drug, including metformin, glimepiride, and teneligliptin. Day 1 antihypertensive tablet containing telmisartan and amlodipine. Her day 1 weight was 80.4 kgs, BMI 27.8, and first HbA1c was 9.6. And she was having diabetes and hypertension with diabetic wound. So after treatment, within 3 months, I have succeeded to reverse her diabetes. So right now she is not on any oral hypoglycemic agents, not even antihypertensive medicines. Her weight reduced to 74.6 kgs, BMI reduced to 25.8 kgs, HbA1c 9.6 to 6.2, and her GTD is negative. And now, regarding the diabetic wound, for diabetes, we have treated in our CDC treatment with oral medications like Guduchi, Mesachangi, extracts, Daru Haridra, Amalki Haridra, Jambu Beach, Neem Patra, Lata Karanch, Beach, Khadir, Kiratikta, Swarnapatri, Shirish, Sativa, Trifa, and Chopchini. For that, I have given her a Prame diet kit, which was containing of 800 kilocalories with low carbs. For Panchakarma, as we are doing Snehan, Swedan, and Basti, like Snehan with neem oil, Swedan with Dashmul Kada, and Basti like per rectal drug administration with Gudmar, Daru Hadidra, and Yashtumadu. For diabetic wound management, I have done some interventions like Trifada Kwat Dhavan. So twice a week, a patient has been called for dressing. As patient was living to another city, it was difficult for her to visit regularly to clinic, but seeing the seriousness of her wound, she managed to do so, and we tried to heal the wound. Like for cleaning purpose, freshly prepared Trifera cloth was used. Trifera, a well-recognized and highly efficacious polyherbal medicines consisting of roots of the plant species like amalki, bibitaki, and haritaki. Due to its antioxidant, anti-inflammatory, immunomodulating, and antibacterial activity, it helps in early healing of diabetic wound as compared to tropical ointments. So Trifera cloth was regularly used for cleaning the wound. Next intervention we have done, twice a week regularly dressing with were conducted at clinic with Jethil oil after Trifera cloth dhawan. Jethil oil is a medicine which we are available at our clinic. Jethil oil is a local application medicated oil prepared with 19 Ayurvedic contents, which consist of Jatipatra, Nimba, Patol, Karanja, leaf, Madhu Chinsa, Yashti Madhu, Kushta Haridra, Daru Haridra, Putti, Manjishta, Padmak, Lodra, Hirida, Utpal, Tutta, Karanj Peach, and Tilatel. So it has anti-inflammatory, antiseptic, and wound healing ingredients. It improves blood circulation at ulcer site, improves healthy granulation, and prevents infection and pus formation. So for cleaning the wound, I have used Trifera cloth, and for dressing purpose, I have used Jethil oil, which we have at our clinic. More interventions. There are some suggestions to patients that patient was advised to keep blood sugar level under tight control, keep the bandage clean and protect from dust and water, do not walk barefoot, regular monitoring blood sugar level, and follow diet restriction as suggested. And she was strictly advised to take good nutritious food for faster wound healing, like rich in vitamin C, zinc, and protein along with our diet kit.
Last 2 minutes, please.
Right, sir. So here I'm presenting some of the glimpses of her wound. So day one, she had such type of diabetic foot. We continuously dress it, do it on dressing mode. So it takes almost 3 to 4 months. I have her wound remains like she is having no symptoms like itching, redness, swelling, pain, and her wound is healed. My conclusion was diabetes can be reversed and its complication can be treated with regular compliance to the patient. Low calorie nutritious diet helps for sugar control and for easy wound healing, and Ayurvedic herbs and Panchakarma. So these are basic reference which I got from the PubMed regarding Trifera and Jethil oil. Sorry, regarding Trifera only. Thank you.
Fantastic presentation, Dr. Rakesh. Handing it over to Rahul sir for your views and comments.
Dr. Rakesh,
yes, sir, please.
Very nice presentation and excellent work done. Complication of diabetes, it's something like a reading in between the line. We always try to just see what is his HbA1c status or what is the medicine status. But you done a good job that you corrected what that patient was expecting, get good treatment for his diabetic wound. And when I saw the wound, I think many of the allopathic doctors must have advised him for amputation.
Right, sir.
So, but you saved him, you saved his life, you saved his abilities, and God bless you. All the best.
Right, sir. Thank you. Thank you. Thank you, Omkar sir. Thank you,
Yes,
sir. Thank
Ranjit
you,
sir, your views.
Yes, super presentation, Dr. Rakesh sir. It's a good thing, and very nicely you have collected the photographs by time to time. And the great thing is that whenever we see this type of wound, we are afraid that how will we manage this case. But very confidently you have managed this case with all other things along with controlling the blood sugar and with this Jethil oil and the Trifera dhawan. So good, keep it up, continue this working and boosting your confidence. So all the best.
Thank you, sir. Thank you.
Dr. Rakesh, we have a couple of questions over here.
Sure, sir. Sure, sir.
What was the RBS of the patient is one of the questions which doctor has asked in the chat box.
Right. So previously, when patient approached to me that her RBS level remains on more than 300, 340, 350, but patient is in continuous follow-up. So in last 15 days, she has visited to me. Her RBS was 124. So RBS is also under control.
Fantastic. And one more question. Did she use any medicine for dressing?
No.
Apart from, I think, Jetil oil?
No. Dressing is done by me only. She is not allowed to do dressing at any clinic.
Superb results, Dr. Rakesh. Fantastic.
Thank you, sir.
So now we'll move on to our next presenter. Our next presenter is Dr. Lakshmi Narayan Sarbere sir from Tukum, Chandrapur. And his topic of presentation is efficacy of IRP therapy in IHD and CAD patients to improve quality of life. Dr. Lakshmi Narayan sir, I am going to spotlight you now and you have 8 minutes of time with you. Yes, sir. Now you can start your screen sharing.
Yes. Yes, sir. I am audible.
Yes, sir. You need to keep your screen on this presentation mode.
Yes.
Yes,
sir.
Perfect, sir. Please carry on.
Good afternoon to all research team and all the doctors, my colleagues. This is Dr. Lakshmi Narayan Sarbere from Madhavbaug Chandrapur Clinic, and today I am presenting my cohort study presentation. My topic is to study efficacy of ischemic program in stable ischemic heart disease and coronary artery disease patient to improve quality of life. Over the introduction for my topic is, over the past few decades, rapid transition of disease burden in India. Among the non-communicable disease, cardiovascular disease account for nearly 135.9 million per year, near about 81% all deaths from occur every year. According to WHO, by 2025, over 60% of world heart disease patients will be from India. This is an alarming sign for India. My aim and objective for the topic is the present study was conducted to evaluate the role of Ayurveda-based ischemic program using Panchakarma procedures, Nail, Sedan, Basti, and Duke treadmill score in ischemic heart disease and coronary artery disease patients. A variety of drugs are available for treatment of ISD like ranolazine, nitrate, antiplatelet drugs, statin, ARBs, beta blockers, CCBs, and AC inhibitors. Despite earlier this extensive list of conventional therapeutic options, there is a very little improvement in terms of morbidity and mortality of these patients. Method for this topic is study type observational retrospective study center Madhavbaug Clinic Chandrapur. Study period from March 2018 to December 2021 and sample size is 40. Methodology in this, the Duke treadmill score is composite index used as diagnostic and prognostic investigation based on result from the stress test, maximum net ST segment deviation, angina, and MATE value in risk patient of ISD. Formally from Duke treadmill score, DTS is equal to MATE value minus 5 into ST deviation minus 4 into angina index. Score is more than or equal to 5, low risk, minus 10 to 4 moderate risk, is less than minus 11 is high risk patient. Inclusion criteria: men and women from age group 40 to 75 years having clinical diagnosis of stable ischemic heart disease and coronary artery disease. The time of onset in ischemia determined by stress test using modified Bruce protocol. Patient exclusion criteria: patient with recent MI previous 3 weeks, patient with unstable angina, severe hepatic or renal insufficiency, patient with acute heart failure, severe aortic stenosis, cardiac arrhythmia, pregnancy or lactation, patient with severe anemia. Therapy that used for this study is, first is SNEHAN, centrifugal ovulation with CCM oil, which reduces sympathetic overstimulation, improves cardiovascular tone, decreases myocardial workload, reduces myocardial oxygen demand. Second procedure is SEDAL, thermal vasodilation with decimal decoction. By this, by inducing sweat, causes vasodilation at microoscillation, reduces systemic vascular resistance, decreases in afterload, decreases in cardiac workload, reduces myocardial oxygen demand. Basti parental administration, which is the contents of 3 herbals, contains privileged terrestrials, means gokshur. Preclinical studies have shown it has nitric oxide mediated vasodilatory effect. Curcuma langa has a proven anti-inflammatory effect. Phyllanthus emblica reduces oxidative stress, which decreases in oxidative stress, reduces inflammation of endothelium, improves endothelial function and dilate capacity of blood vessels, and promotes healthy healing. This is the result of our Basti Chikitsa. You can see in this, there is a endothelium of veins which regularly, when it is flexible, it stimulates nitric oxide from the endothelium. But when it is damaged or it gets occluded by the blockages, function capacity of the endothelium is decreases, which result in decreased nitric oxide, which increases, which promotes due to our Basti Chikitsa. There is a result. There was a significant improvement DUET score by 8.09, that is from baseline minus 1.76 to 6.33 at the end of IRP therapy, found to be statistically significant. P-value is 0.0001, less than 0.1. Second, a significant improvement in time of ischemia by 3.32. That is from baseline 7.60 to 10.92 after IRP therapy. P-value is less than 0.0001. A significant improvement in time of angina by 5.18. That is from baseline 7.54 to 13.12 after IRP therapy. Here P-value is less than 0.0001. Again, there is significant improvement in systolic blood pressure by 9.18 from baseline 131.17 to 122.07. Here also P-value is less than 0.001, and diastolic blood pressure of 9.10 from 80.50 to 73.44 after therapy. P-value is 0.001. The baseline average BMI of the patient was 26.08, which decreased to 24.29 at the end of therapy. Here is again a fantastic result in drug tapering also. Here in chart you can see that we taper nitrate fully, anticoagulant, anti-angiolin, statin, beta blocker, CCBs, ARB and AC, DP4 inhibitor, sulfonylurea biagonal. Here we all the drugs which is used for ischemia, risk factor, that is hypertension, diabetes, cholesterol level. All these drugs are we are trapping here. Conclusion: over the last 3 decades, considerable advances have been made in understanding the pathophysiology of ischemic heart disease, but these advances have focused on acute coronary syndrome, that is STMI, and non-STMI or angina, unstable angina pectoris. The purpose of this communication is to critically review the pathophysiology of chronic IC. Myocardial ischemia is a consequence of reduced blood flow in coronary arteries due to combination of fixed vessel nerving and abnormal vascular tone as a result of atherosclerosis and endothelial dysfunction. This leads to an imbalance between myocardial oxygen supply and demand. Here is a chart where you can see supply-demand mismatch. When supply decreases due to coronary obstruction, microvascular obstruction, perfusion pressure, less PO2, and decrease of hemoglobin. Oxygen demand increases due to heart rate, contractility, and vaultation. Cardiac ischemia is usually the result of increase in one or more determinants of myocardial oxygen demand. These include increases in heart rate, left ventricular loading, which include afterload, that is system wall stress, arterial stiffness, systemic blood pressure, or preload, which increase diastolic wall stress and end-diastolic pressure and volume and wall thickness or contractility. In the present study, we evaluated the efficacy of an Ayurvedic treatment regimen as add-on therapy to conventional treatment in patients with ILD and CAD. The underlying etiology in patients with ILD and CAD is reduced capacity of coronary arterial blood supply to meet the myocardial oxygen demand. An increase in myocardial oxygen supply can only be made by an increase in coronary blood flow. It was observed that the IRP regimen improves blood supply to myocardium at higher workload.
Last 2 minutes, sir.
Okay, sir. Here is a definition of quality of life, which I showed to. There is an improvement in quality of life. Quality of life is defined as the physical and mental health perception, that is energy level and mood, and they are correlated including health risk and condition, functional status, social support, and socio-economic status. State of well-being, which is composite of 2 components: the ability to perform everyday activities, which reflect physical, psychological, and social well-being; patient satisfaction with level of functioning and the control of disease or treatment-related symptoms. In this study, we achieve all this goal of quality of life. Conclusion is that an Ayurveda-based ischemia research program, IRP, when administered as add-on therapy to conventional treatment, may effectively improve quality of life by improving DUE score, blood pressure, heart rate, BMI, with significantly tapering conventional medicine in stable ischemic heart disease and coronary heart artery disease patients. As in also, we can see here is the quality of life, improving quality of life with tapering conventional medicine and improving all symptoms of patient on DUE score, time of ischemia, time of angina, and all parameters of the patient for the disease. For what he is come to my clinic. Here is the fantastic result I get to improve quality of life, reduce the rate of mortality and morbidity in stable ischemic heart disease and CAD patient. Thank you. Thank you all, my respected Dr. Rohit Sane sir, Dr. Amin sir, Dr. Praveen Gadigavkar sir, Omkar sir, Dr. Sadiq sir, Rahul Mandole sir, for giving me opportunity to present this cohort study in this large bench, large stage. Thank you.
Thanks a lot, sir. It was a super presentation. The batch size was of 40 patients.
Yes, sir.
Super, super. This data collection is really going to take us in various strata of the world, because such kind of data is going to bring a good future, a golden future in Ayurveda. Rahul sir, your comments on this? Unmute, sir.
Yeah. Dr. Sarveri sir, you are a role model for all the upcoming clinical cardiologists. And the way you are practicing in Chandrapur is actually a good clinical practice. It's an ideal clinical cardiology practice that you are doing. And hats off to you. Especially, I can understand the Rome was not built in one day, and so as your presentation is, because collecting of data of like a 40 patient, and so it needs consistency, it needs dedication, it needs that futuristic approach, and superb. So at the end of the day, I have one suggestion. The last, as a chairperson, I have to give some suggestions. This is the reason I'm giving you a suggestion. So this Duke treadmill score, it's a good parameter because it includes the electrophysiology, your subjectiveness or the symptom of your patient, and the effort tolerance or the exercise tolerance of the patient. So it's a integration of the three various different indicators. But if we need to take one step further now, so as we are doing the Duke treadmill score, so we need to add few more accurate and precise investigation tools for the ischemic heart disease. Maybe the GLS study हो सकता है, या फिर आप SPECT MPI कर सकते हो. But it's a 40 patient का robust study and presenting here on this platform of MUHS, MIPC and Medemy. So congratulations, sir.
Definitely we will try. But is GLS study not available in Chandrapur? This is our hurdles for our study.
If you start showing this data to some cardiologists in Chandrapur, they will say, I may plan करके देता हूँ तुझे GLS यहाँ पे in the cardiology.
Definitely. Thank you.
Yes, thank you. And Ranjit sir, your views on this, please.
Yes, fantastic presentation, Dr. Lakshmi Narayan sir. It was awesome thing that you have collected the 40 patients data.
Thank you, sir.
Yes, and no questions in the chat box means 100 out of 100. So we are moving to our next participant. Next presenter rather is Dr. Kirti Mirchi from Dharampet, Nagpur, and her topic of presentation is impact of Jatamansi Quat Shirodara on obesity. Okay, a very unique topic, a different topic has been chosen by Dr. Kirti. And now we'll move on. I'll spotlight Dr. Kirti, and ma'am, you can unmute yourself and start your screen sharing.
Omkar, sir. Just need one just reminder. 30 minutes left to start our valedictory function, and our beloved Dr. Rohit Sane sir will be here along with Dr. Gurudatta Amin, the Chief Medical Officer and Director of Medemy, And I request all the participants to call or contact your friends and all to be active part of this valedictory function, because we are going to distribute the certificate to all the participants. We are going to distribute certificate to all the presenters. And Dr. Sane, Rohit Sane, who is a founder, who is actually behind, who is an ideologist behind all this concept. So he is going to address us here on this platform. So I request everyone to actively share and contact your friends and your other colleagues to join the event as early as possible.
Don't miss this golden opportunity. And we are back to Dr. Kirti Mirchi. Yes, ma'am, you can start your presentation. You have 8 minutes of time.
All the best, Dr. Kirti.
Thank you, sir.
You need to keep it on presentation mode. Yes, perfect, ma'am. Please carry on.
Good afternoon, all. Myself, Dr. Kirti Mirchi. Am I audible, sir?
Perfectly audible, ma'am.
Yes.
Okay. Good afternoon, all. Myself, Dr. Kirti Mirchi. I am going to present how Shirodara treatment can control obesity. Before obesity, we have before objective, we have to understand the obesity. Obesity, stolya, is a significant health problem that can cause negative impact on the mental social well-being of the person. The patient also suffer from the stress-related issues such as sleep disturbances, anidra, and poor digestion. The objective of this study was to evaluate the Shirodara treatment on obesity and stress on psychophysiological and physical health of the patient. Patient medical history. 50 years female, known case of STN and hypothyroidism since 2015, was diagnosed in March 50 years old female, known case of STN and hypothyroidism since 2016. In March 2019, was diagnosed pre-diabetic with a HbA1c of 6.3%. In April 2019, patient consultation done and obesity management treatment was advised. At that time, 136 kg weight was observed. After at the time of 5th Panchakarma, 130 kg weight was observed. After 5th Panchakarma, the rate of weight loss is little slow. So Shirodara implemented from 6th Panchakarma. After 15th Panchakarma, 100 kg weight was observed, and in January 2020, after 18th Panchakarma, 96 kg weight was observed. Patient personal history: diet vegetarian, habits no, sleep disturb, bowel, bloating and constipation. Occupation principal at nursing college. Major complaint of patient: onset of uneasiness that leads to the craving of food, multiple type eating habits, body swelling, joint pain and lethargy. On physical examination, parameter BP 120/80, pulse rate 117, temperature normal, BMI 48.19, ABG 120 centimeter, SpO2 98%, CNS conscious and oriented, and RS bilateral normal. In a biochemistry parameter, HB 12.8, total cholesterol 256, triglycerides 276, LDL 151, HDL 53, HbA1c 6.3, TSH 4.66, vitamin D 9.96. Pre-treatment medication: metoprolol succinate, thyroxine sodium, olmesartan, atorvastatin and aspirin, cholecalciferol and torsemide. Diagnosis: obesity with complication. With a treatment, oral medicines advised for to reduce the stress, to reduce water retention, improve the basal metabolic rate, and liver tonic. In diet, customized 1000 kilocalorie diet box for 3 months, which contain high protein, low fat and low carbohydrate. Moong dal diet weekly once for 3 months. In exercise guidelines, 45 minutes brisk walking in morning, pranayam, anulom vilom and omkar, yogasan, utkatasana and bhujangasana. Treatment. Baseline therapeutic procedure for obesity management consists of 3 stages. 90 minutes Panchakarma procedure was carried out once in a week for consecutive 10 weeks, and then 8 Panchakarma was carried out at the interval of 30 days by skilled staff. Neem oil Snehan act as a subcutaneous fat deposition. Dashmul extracts Vedan to reduce the extra salt and water retention to the profuse sweating. Meshashungi Nagavalli Patra Kulatha decoction Basti that can scrap out the fat deposit, increases the leptin and control the hunger, which reduces the overeating, which can control the overeating, weight gain, and it also helps in a fat metabolism. During the follow-up after 5th Panchakarma, it was observed that the weight reduction rate was very low and the patient was in stress as the stress indicating parameter, even they following the customized 1000 kilocalorie diet by baseline treatment. Stress indicating parameter of patient: uneasiness, fatigue, disturbed sleep, craving for food, means multiple eating, and tachycardia. So final diagnosis: stress was a main reason for obesity. Line of action: additional therapeutic procedure of Jatamonsi 10% extract decoction 15 to 20 minute Shirodara procedure was implemented from 6 Panchakarma to control the stress, insomnia, anxiety, tachycardia, and hunger feeling. Result. In physical parameter, initial and after 18 setting results: BP 120 by 80, after 120 by 80, ABG 120 centimeter to 100 centimeter, weight 136 kg to 96 kg, BMI 48.19 to 34, pulse rate 117 to 68, sleep disturbed, normal after 18 setting, body swelling, joint pain and lethargy which was initially present was absent after 18 setting. In a biochemistry parameter, HB 12.8 to 12, total cholesterol 150, total cholesterol 258 to 167, triglycerides 267 to 157, LDL 153 to 101, HDL 52 to 43, HbA1c 6.3% to 5.1, TSH 4.66 to 4.04, vitamin D 9.95 to 32.2. Discussion. In a present study, we have done the treatment of 50 years extreme obesity class 3 patient with the help of baseline polyherbal formulation, specific set of medicinal Panchakarma and 1000 customized diet, and we added Jatamonsi Shirodhara in baseline treatment to accelerate the rate of weight reduction. Role of Jatamonsi Shirodhara: it is effective in a psychological disorder and pitta diseases, made their drug. Through the Shirodhara, Jatamonsi specify hyperactivated sympathetic nervous system, settle down the increased heart rate, peripheral resistance in a blood vessel, and facilitate sound sleep, gives the ability to withstand stress. Logic for implementation of Shirodhara: many studies shows that Shirodhara significantly decrease the level of state of anxiety and stress. 2 hormones in the body responsible for the regulating hunger. Ghrelin is a hunger hormone and leptin is a satiety hormone. Whenever the stress increases, ghrelin increases, which leads to the hunger feeling, multiple eating habits, occurs, so leads to the obesity. Effect of sleep on these 2 hormones: less than 8 hours of sleep can cause the 16% reduction in a leptin level. Ghrelin level can increase by 32%, which a single day. Getting less than 7 hours of sleep means less sleep leads to the hunger feeling, which leads to the obesity. The Shirodhara improves the sleep quality and reduce the stress level, which improves the function of leptin and ghrelin, which control the overeating habits. After treatment, we found 40 kg weight reduced from 136 kg to 96 kg with a no body swelling, joint pain, lethargy. The improvement was observed in a symptomatic and biochemistry parameter. Conclusion. The baseline polyherbal formulation, diet modification, and set of Ayurvedic medicinal Panchakarma can reduce obesity with a normalizing biochemistry parameter and symptomatic relief. As it is a stress-induced obesity, the Jatamonsi extract decoction Shirodhara implemented, which control the stress, accelerated rate of weight reduction, which gives the result of 40 kg weight loss. After 24 hours of treatment, patients still maintain 94 to 98 kg weight, hence no recurrence found. These are the references. Thank you.
Super results, Dr. Kirti Mirchi. Over to you, Rahul sir.
Because many of time overeating patient are into the overeating. The cause of overeating could be the stress. Many time we miss this thing, and because of overeating, patient gain a lot of weight and he lands up into so many metabolic disorder. And you find a very right key, Dr. Kirti, here. The leptin resistance can be controlled with help of a Shirodara, and if we can control the hunger, then we can control anything. And very nice presentation, excellent data collection, and all the best for your future.
Thank you, sir.
Yes, Dr. Kirti, we have a couple of questions in the chat box. One by Dr. Sandeep. Your patient had hypothyroidism. Her weight was 136 kg. Did you clinically examine her? And if she had any hormonal obesity, one with the scanty axillary hair, and what was her family history regarding obesity? Can you please answer these questions?
In a family history, there is no family history as such for obesity. Since the hypothyroidism, she gained the weight in a hormonal study. Actually, patient has a history of infertility. At that time, her hormonal study was done. So, because of that, majorly not an issue in that hormonal study. At a time of starting of treatment, I have not done any kind of hormonal study reports.
Right. As it is, obesity has two presentations, hypercellular and hypertrophied. And the maximum 95% cases are of hypertrophied obesity, which we are treating effectively in Madhavbaug. Very rarely a hypercellular patient comes to you. And I think that's the reason why Dr. Sandeep has asked this question. There is one more question from Dr. Sonia Malik. Have you used Jatamansi Kashayam for Shirodara? Could you please elaborate?
Jatamansi 10% extract decoction was used for Shirodara, which is present in a Madhavbaug.
Fantastic. Thanks a lot, Dr. Kirti. Fantastic results. Now we move on to our next presenter before the valedictory function, and that is Dr. Preeti Sarbere, madam, from Chandrapur. Just a moment, ma'am. And your topic of presentation is to study the role of lifestyle modification in type 2 diabetes to maintain glucose tolerance capacity for 3 years. Her clinic is Jatpura Gate, Chandrapur. Over to you, ma'am. So you have 8 minutes of time.
Good afternoon, doctors. Myself, Dr. Kirti Sarbere, Ayurvedic Preventive Cardiologist from Madhavbaug Chandrapur Clinic. My case series presentation. Research title is to study the role of lifestyle modification in type 2 diabetes to maintain the glucose tolerance capacity for more than 3 years. Aim of my study is, as India leading in terms of prevalence of diabetes, it's our challenge to control the prevalence rate, mortality and morbidity. For this, I taken this challenge research topic to check possibility of reversal of diabetes and maintain the glucose tolerance capacity it for long time with the help of lifestyle modification. Introduction: diabetes mellitus contribute to a major chunk of morbidity, mortality and healthcare cost on a global level. The prevalence of diabetes is rising alarming worldwide. India is leading in terms of prevalence of diabetes with a prevalence rate of around 10%. That is, every 10th adult in India is suffering from diabetes. As per WHO report, about 30 people die per 1 lakh population in India due to diabetic complications. Present scenario in India is 7.4 crore people are suffer from diabetes complication like heart disease and blood pressure. My case details are study type observational study at Madhavbaug Chandrapur Clinic from November 2018 to August 2021. Sample size 4. Men and women are included, age group 30 to 75 years and BMI above 20. Abdomen girth 80 to 125, HbA1c 5 to 11, some GTT. Male and female patient, this is 4 patient we have taken. Weight 123, 83, 58, 90, day 1 data, BMI 48, 27, 24 and 32, abdomen girth 126, 105, 84, 110, HbA1c day 1 11, second patient day 1 HbA1c 7.2, day 1 third patient 6.1 and day 1 fourth patient 5.3. 5.3 पेशेंट जो था वो इंसुलिन पे था, इसलिए उसको हमने डायबिटीज पे इनरोल किया था. Next, glucose tolerance test. This test is carried out to check glucose tolerance capacity of patient. In this test, first we check fasting blood sugar after we give 75 gram glucose, and then check blood sugar after 1 and 2 hours. In recent decade, diagnosis is also done by measuring glycosylated hemoglobin, since it reflects blood sugar control over the past 2 to 3 months. 4.5 to 5.6 is a normal range. The 5.6 to 6.5 is a pre-diabetic, and above the 6.5 that is a diabetic patient. GTT normal reading fasting is below 110, 1 hour after glucose administration below 160, and 2 hours after glucose administration below 140. पेशेंट मेडिकल हिस्ट्री, पेशेंट मेडिकल हिस्ट्री में यदि हम जाएंगे तो 2018 में मेरे चारों पेशेंट इनरोलमेंट है, वो सिम्टोमेटिक पेशेंट थे. उनका हमने सिम्टोमेटिक विथ मेडिसिन प्लस इंसुलिन पे वो पेशेंट अपने पास आए थे. उनको हमने पंचकर्मा थेरेपी के साथ में डाइट बॉक्स का प्लान करके उनका मेडिसिन टेपर डाउन करके 1 ईयर में अपन ने फर्स्ट जीटीटी पास किया था 2019 में. उसके बाद में 2019 के बाद में 4 पेशेंट में से 1 पेशेंट ने नवजीवन प्लान लिया है और डाइट चार्ट फॉलो किया है, और बाकी के 3 पेशेंट ने विदाउट नवजीवन और विदाउट सिर्फ डाइट चार्ट इसको फॉलो किया है. मंथली डॉक्टर का विजिट लिया है क्लिनिक में, मंथली इन्वेस्टिगेशन फॉलो किया है, और डाइट काउंसलिंग डॉक्टर के पास से मंथली विजिट में उनको फॉलो किया अपन ने, और उससे अपने को सेकेंड जीटीटी भी उनका निगेटिव आया है. उसके बाद में पेशेंट को थर्ड ईयर में यदि हम देखेंगे तो पेशेंट ने नॉर्मल डाइट खाया है, मतलब शादी में भी उसने सब कुछ खा के भी अपना नॉर्मल जो हम खाते हैं बस उसी को हमने थोड़ा सा मॉडिफिकेशन किया है कि किस टाइप से खाना चाहिए, कैसे खाना चाहिए. और डॉक्टर के क्लिनिक विजिट में उसको काउंसलिंग कर करके उसको समझा के उसका डाइट प्लान करके दे के इस टाइप से अपन ने उसका डाइट नॉर्मल डाइट में रख के उसका 1 साल का मॉनिटर किया है. और उसके बाद में हमको थर्ड जीटीडी भी पॉजिटिव नेगेटिव मिला है, जो कि 2021 में मुझे मिला है. ये एवरेज निकाला है मैंने डे 1 का कि 88.75 वेट जिसका था, तो 1 ईयर में एवरेज उन चारों पेशेंट का 77.82 था. और सेकेंड ईयर में हम देखते हैं तो 78 म्हणजे उन्होंने वेट को मेंटेन किया है, और थर्ड ईयर में भी उन्होंने अपने वेट को 75 तक मेंटेन किया है. बीएमआई यदि हम देखेंगे तो डे 1 में 32.36 उनका एवरेज था चारों का. 1 साल का एवरेज हमने निकाला तो उन्होंने 1 साल में 30 बीएमआई क्रॉस किया, लेकिन 30 को उन्होंने वैसे ही मेंटेन किया. 28 और 27 बीएमआई भी 3 साल तक उन्होंने मेंटेन किया है. एब्डोमेन गर्थ 106 से 99 पे रिड्यूस किया है, लेकिन 2 साल तक उन्होंने अपना एब्डोमेन गर्थ भी मेंटेन किया है. HbA1c अपन देखेंगे तो डे 1 का 6.8 एवरेज है उनका, तो और 1 साल में हमने 5.7 उनको लाके दिया था, और 3 साल में उनका HbA1c भी वेल मेंटेन है 5.8 एंड 5.7. फास्टिंग शुगर भी हम यदि देखेंगे तो उनका 83 और 80 और 88 म्हणजे उन्होंने जीटीटी में भी उनका अच्छा सा फॉलोअप है. मेरा रिजल्ट कि वेट के बाद हम देखेंगे कि डे 1 का वेट जैसे एवरेज 88.35 था, तो 3 साल के बाद में उनका टोटल चारों का एवरेज वेट 74.85 था, और बीएमआई 32.36 था, जो 3 साल के बाद में उनका एवरेज 27.42, और 106 एब्डोमेन गर्थ का 96.25, और HbA1c 6.8 से 5.9. ये खूब सुंदर रिजल्ट है कि हम पेशेंट ने 3 साल भी उसको अच्छे से मेंटेन किया है. इसके साथ ही हम यदि जीटीटी का रिजल्ट देखेंगे तो जीटीटी में फास्टिंग में पेशेंट का 83 था, फास्टिंग फर्स्ट जीटीटी में 83 एवरेज है,
तो सेकंड जीटीटी 80 और थर्ड जीटीटी 88.1, म्हणजे बहुत सुंदर उनका फास्टिंग उन्होंने मैनेज किया 3 साल तक। और यही मेरा रिसर्च टॉपिक है कि पेशेंट यदि अपना लाइफस्टाइल मॉडिफिकेशन बनाए रखता है तो वो अपना जीटीटी 2 से 3 साल लॉन्ग टर्म तक वो अपना जीटीटी नेगेटिव रख सकता है। ये इससे मेरे रिसर्च से पता चलता है कि फास्टिंग भी उन्होंने मेंटेन किया। और मेन तो PP2 जो हम बोलते हैं कि प्रीवियस स्लाइड में हमने कहा है कि 140 के नीचे रहा तो नॉर्मल रेंज में आता है और जीटीटी पास होता है वो पेशेंट। तो यहाँ पे PP2 में आप देख रहे होंगे तो फर्स्ट, सेकंड, थर्ड तीनों भी साल में उनका 140 को क्रॉस ही नहीं किया, 120 के अंदर में ही उनका PP2 मेंटेन है। तो बहुत अच्छा रिजल्ट है ये। इसके बाद मेरा कंक्लूजन है कि इफ डायबिटीज रिवर्स, जीटीटी पास, पेशेंट फॉलो द लाइफस्टाइल मॉडिफिकेशन गाइडेंस, कैन मेंटेन द ग्लूकोज टॉलरेंस कैपेसिटी फॉर लॉन्ग टाइम। थैंक यू।
Fantastic presentation, Dr. Preeti Sarbere ma'am. Over to you, Rahul sir.
डॉक्टर प्रीति मैम, कॉन्ग्रेचुलेशंस।
थैंक यू सर।
बहुत ही अच्छे रिजल्ट्स हमने देखे आपके। और taking a follow-up for 3 years and keeping patient healthy is not an easy task, and you did it very well. So congratulations again to you and your team, and keep it up.
Thank you, sir.
Yes, Ranjit sir, your views on this, please.
Yes, super presentation, Dr. Preeti ma'am. This was a really fantastic thing that you have observed keenly, very nicely, the patient along up to the 3 years. One thing here I want to know, and one suggestion for you, is there any significant or any special point which was observing you or which was giving you hint that yes, patient is on track? Along with the blood sugars and HbA1c you were continuously monitoring, but is there any another point, any pathological investigation or any other observational point that you can identify that yes, patient is going on track? Is there anything?
Yes sir. सर जैसे हम देखते हैं कि पेशेंट तो नॉर्मल डाइट खाता है, म्हणजे वो शादी में जाएगा तो शादी का डाइट खाएगा, उसके बाद में उसको फॉलो कैसे करना है उसके लिए मैं करती थी कि उनको फास्टिंग पे मॉनिटर करती थी और HbA1c को फोकस करती थी। क्योंकि पेशेंट ने आज यदि 800 से 1000 कैलोरी आज खाता है तो उसको 7 दिन का मॉनिटरिंग देना पड़ता है कि नहीं तुम 7 दिन तक तो मूंग डाइट पे जाओ, 7 दिन तक ज्वारी की रोटी खाओ, यानी 7 दिन तक उनका डाइट रेस्ट्रिक्टेड रखना होता है कि जिससे वो कैलोरी वो बैलेंस कर सके।
Okay, and in this 3 years of span of journey,
Yes.
Have you observed on the weight that weight is too much increasing or too much reducing? Is there any observation on weight?
Yes sir, जैसे इन चारों पेशेंट में से मेरा एक पेशेंट है, तो वो पेशेंट के हस्बैंड एक्सपायर हो गए थे, जिसकी वजह से उसका थोड़ा सा वेट भी गेन हो गया था और स्ट्रेस की वजह से उसका शुगर भी थोड़ा सा फ्लक्चुएट हो गया था। लेकिन उसको फिर से मैंने वीकली काउंसलिंग के लिए बुलाया क्लिनिक में और हर वीक में उसको मेडिटेशन और डाइट, उसको थोड़ा सा मोटिवेशनल पुशअप उसको दे के उसको थोड़ा सा पुशअप लिया तो उसका फिर से जीटीटी नेगेटिव आया।
Superb. Keep motivating your patients and all the very, very best.
3 years of data is just fantastic. We have strong follow-up systems in Madhavbaug, and I think this is what all the doctors who have joined for this symposium will appreciate, that we are not leaving our patient just after treating them and we are getting them GTT for the first time. We are following up them for next 3 to 5 years. So this is a big strength of Madhavbaug, the follow-up, the monitoring system. So Rahul sir, I think we'll take a 5-minute break now. Thank you, Dr. Preeti, for your fantastic presentation. It was an awesome, super presentation. And Rahul sir, we'll just come back in 5 minutes time. By the time Aman sir joins and Dr. Rohit Sane sir, the MD and CEO of Madhavbaug, as well as Dr. Gurudatta Amin sir, the respected CMO of Madhavbaug joins, we'll have a 5 minutes break. And then exactly at 3 p.m. we'll be joining back.
It's almost 3 p.m. Dr. Okay.
Yes.
So 2 minutes break.
Yes, we can give a 2 minutes break to all. Please join back fast. We are going to start a very fantastic valedictory function over here. And all of you are going to interact with Dr. Rohit Sane sir. So it is a big opportunity for all of you. Rahul sir, over to you.
Thanks a lot, Dr. Omkar sir.
One request to Dr. Omkar. Please don't end the meeting. Otherwise, if you end the meeting, automatically the whole stream will get disconnected.
Relax, don't worry.
I'll be joining within next 2 minutes.
Yes, sir. No worries. Yes, Rahul sir.
Yes, Dr. Omkar sir, पिछले 4 दिनों से the way we are discussing the cases, I think it is really taking a best clinician out of from each of everyone. And from the bottom of our heart, we are hardcore Ayurveda clinical practitioners, and the way our doctors are presenting their cases, they are doing really wonders in their clinic setup. And I think this is the perfect way to take Ayurveda to the next level. And best thing, as even yesterday I discussed the same point. Normally what happened, if someone go to the cardiologist will take care of the heart. He will assess the heart, he will assess the cardiac marker, he will assess the cardiac sonography, and he will just focus on the heart. But when you go to any Ayurveda physician and if you complain him that I am having a chest pain, so he will not just look in your heart. He will not just look for your heart. He will look for the other parts also, like what is the condition of your gut, what is your mental status, what is your kidney status. So this is the way we each and everyone should approach, and this is the reason why Ayurveda physician we are different from the other people, and this is the reason we are having not only the results but the sustainable results, as recently Dr. Preeti ma'am has shared. Even after a GTT negative, that means a complete remission of a diabetes, of the patient are still non-diabetic even after the 3 year. Yesterday we saw the HF-ref patient. Normally in India, if a patient get diagnosed with a chronic heart failure, the probability of death is around 23% in just 1 year. But yesterday we saw the case, the patient, even after a 10 year, the patient is coming to the clinic and is living his life happily. So there is something very fantastic. This is where we are standing apart from the crowd, and this is why Ayurveda is like a blessing for every one of us.
Yes, true,
our
sir.
Acharyas has given us something which is what we are, we never expected this thing. And I think agar ye mujhe 11th mein pata hota, so I could have prepared my CET to get admission in BMS. And as I think in coming few years, if we are continuously doing practice like this, when our children will try to crack the CET, they will definitely try to get the seat first in the BMS for the BMS first. Right? The pehle BMS colleges full honge. Okay, abhi NEET hai, hamare time pe CET thi. So NEET crack karne ke samay, they will try to get the admission in the BMS colleges first, and then they will get the admission for the MBBS ke liye. Tab I think seat complete honge ya nahi honge, I don't know. But the BMS colleges jo bhi honge, so but wo situation lana, this is our moral responsibility, this is our duty जो हमें करनी है, हमें निभानी है. And the way हमें अभी रास्ता तो पता चल गया है कि how we can conduct, how we can go achieve that level. हमें जैसे डॉक्टर सर्वेरे सर ने किया 40 cases का compilation with the pre and post cardiac stress testing. So this is where we can, this is how, if we continuously keep practicing, definitely that day will come when the Ayurveda will become the first line treatment option.
True, sir. Yes, Ranjit sir, your views on this, please. Before we start the valedictory function, what is your learnings from the last 4 days of all the presenters who have presented in the symposium?
Yes, all the presenters who are going and have presented all the work they have done at their clinics, these all are awesome. The entire thing is the important thing is that जो अभी तक हमें लगता था कि ये सारा first line of treatment बनने के लिए आयुर्वेद हम कब करेंगे, कैसे करेंगे, so this is such a platform जो हमें आज दिखा रहा है कि ये शायद कुछ सच होता हुआ दिख रहा है. सो ये जो भी तरीके के हम लोग अभी तक सोचते थे कि ये कैसे होता है, उन सभी को अलग अलग डिफरेंट क्लिनिक्स पे माधवबाग के सभी डॉक्टर्स ने करके दिखाया है। और करने के बाद ये जो एक रिसर्च टीम में मैं कहूँगा डॉक्टर राहुल सर ने जो अच्छा है ये इनिशिएट लिया हुआ है कि हम सब लोग मिल करके यहाँ पे सामने आपकी क्लिनिक पे किए गए डॉक्यूमेंट्स को सामने रख पा रहे हैं। और यही एक पहला पड़ाव है कि जिससे हम इस अपने किए गए कामों को सारी दुनिया को, सारी सोसाइटी को, यहाँ सारे सभी डॉक्टर्स भी जो कर सकें उसके लिए हम इजी बना रहे हैं। सो दिस इज रियली सच अ गुड एंथुसियास्टिक स्टेप कि जो सिर्फ ना हमारे लिए बल्कि पूरे सोसाइटी के लिए, बाकी सारे प्रैक्टिशनर्स, सारे डॉक्टर्स के लिए एक बहुत ही हेल्पफुल साबित होने वाला है। So thank you, Dr. Rahul sir and Omkar sir, Dr. Aman sir and team Madhavbaug जिन्होंने ये इनिशिएटिव लिया। और इस काम के साथ ही बहुत सारे लोग ऐसे हैं जो एज ए हिडन पिलर की तरह यहाँ पे इस सभी काम को कर रहे हैं। So thank you doctors, आप सब लोग बहुत बढ़िया कर रहे हो and all the best, keep it up.
Yes, and we will be continuing the presentations after the valedictory function. Now it's 3:03, so we are going to start with our valedictory function, and for this purpose I'll be introducing the man behind the technical support of Madhavbaug, all the platforms on the social media जिस व्यक्ति ने पकड़ के रखे हुए हैं Facebook, Twitter, Insta as well as YouTube and Zoom। तो हमारे जबरदस्त ऐसे जो दिग्गज है, मैं स्पॉटलाइट करना चाहूंगा डॉक्टर अमन कपूर सर, जनरल मैनेजर डिजिटल हेल्थ केयर माधवबाग। अमन सर, इट वाज एन ऑनर फॉर मी टू anchor this event, to host this event, but this was not possible without your support.
Thank you so much
for this fantastic platform given to all the doctors of Madhavbaug. With this platform, I think all the doctors of Madhavbaug can easily connect with all the other doctors in Ayurveda fraternity, and definitely in a joint collaboration we can do wonders in the next future. Over to you, sir. Aman sir.
Thank you so much, Dr. Omkar, for talking about me. It's kind of you to do that right now. आपने इतना टेक्नोलॉजी का बात किया और अभी टेक्नोलॉजी मेरे साथ नहीं दे रही है. I'm right now not visible, but just give me a few seconds. Probably I hope I'll be visible on the screen in the next 5 to 7 seconds, and hopefully my screen will be visible now. So good afternoon everyone. Yes, I think I am visible. Great. So good afternoon everyone, and I've been seeing यहाँ पर आप सबके presentations, awesome presentation, really amazing presentations, and this has been an exceptional experience. चलिए यहाँ पर जो भी connected है, जितने भी लोग connected हैं, जल्दी से मुझे chat box में जाइए. देखिए मेरी पुरानी आदत है, I like people chatting. So all those who are there in the chat box, just quickly give me a thumbs up if you are really enjoying the presentations from all the doctors. जहाँ पे भी आप connected है, fantastic, that's the spirit. ये thumbs up तभी होता है जब तब मजा आता है कि हम सब connected हैं. We are really having all of us together. ये energy रहती है. So first of all, Dr. Omkar, Dr. Rahul sir, thank you so much for your amazing and exceptional work over here, especially Dr. Rahul Mandole for initiating this and spearheading this whole session. So fantastic work and heartiest congratulations to all of you. मैं थोड़ा इधर देख रहा हूँ क्योंकि मुझे देखना है हमारे बाकी के लोगों को. So मैं यहाँ पर I'm managing too many screens, so please forgive me if I am not able to see towards the screen. मतलब मैं ऐसे देख के बात नहीं कर रहा हूँ. बहुत बढ़िया. So यहाँ पर even those who are connected on Facebook, can you please let me know कि भाई आप में से जो यहाँ पर जुड़े हुए हैं, right? Facebook पे, YouTube पे and Twitter पे वगैरह, मुझे एक बात बताइए सबके सब कि जो यहाँ पे देख रहा है, आपके लिए what is the biggest learning point? What is the biggest learning point from this event today? Not today, rather last 4 days से जो आपका जो event है, आपका सबसे बड़ा learning point क्या है यहाँ पे? So आप वो डालेंगे, so then we will be able to अंडरस्टैंड कि भाई यस सब सही दिशा में जा रहा है कि नहीं जा रहा है. सो ऑल दोज हु आर हियर, सबसे इंपॉर्टेंट आपका लर्निंग पॉइंट क्या है? जल्दी से चैट बॉक्स में डालिए. लेट्स सी किसका सबसे बढ़िया आंसर आता है. प्रॉपर डेटा कलेक्शन, फैंटास्टिक फैंटास्टिक, क्या बात है. दैट्स अ वंडरफुल वे टू पुट इट अक्रॉस. एंड प्रॉपर डेटा कलेक्शन इज वेरी इंपॉर्टेंट, देयर इज नो डाउट अबाउट इट. गोइंग अहेड और देखिए क्या किसका राय आती है. हम देख रहे हैं. आई एम वेटिंग फॉर योर रिस्पॉन्सेज while I am struggling to connect my screens. अलग अलग स्क्रीन्स को मैं कनेक्ट करने की कोशिश कर रहा हूं. और यस, ओके. सो पहला है डेटा कलेक्शन. चलिए, ये तो बहुत सही बोला आपने. डेटा कलेक्शन इज एक्सट्रीमली इंपॉर्टेंट, एंड विदाउट प्रॉपर डेटा कलेक्शन वी ऑल स्ट्रगल. बहुत बढ़िया. डॉक्टर ओमकार, आपको यहाँ पर लोगों के जो व्यूज दिखाई दे रहे हैं, कमेंट्स दिखाई दे रहे हैं, व्हाट डू यू से अबाउट दैट? आपका क्या कहना है? एंड ऑल्सो यहाँ पर मैं रिक्वेस्ट करूंगा सबको, जो हमारे साथ में जुड़ रहे हैं, सबको मैं रिक्वेस्ट करूंगा जरा बताइए कि आपका इसमें क्या कहना है.
बेसिकली जो हमने यहाँ पे हासिल किया हुआ है, व्हाट वी हैव अर्नड इन द लास्ट 4 days इज अ विजन टू टेक आयुर्वेदा टू बीइंग द फर्स्ट level of the treatment in India, and for this purpose a specific thread needs to be taken forward. The thread is the methodology, and that is the research methodology. Now, if all the Ayurveda graduates think in this point of view, which Dr. Rahul Mandole sir or Dr. Rohit Sane sir is trying to teach all of you in the last 3-4 days, is if we have a proper data with us, we have a golden future of Ayurveda in India. So we will be unstoppable. Please mark my words, all the BMS graduates, all the MD doctors of Ayurveda, we will be unstoppable. But for that, we will require a proper data compilation with a proper consent of the patient, and a guide, a mentor like Rahul sir or Rohit Sane sir or Dr. Gurudatta Amin sir, who will take us ahead to achieve this dream.
Really, thank you so much. I know मैं थोड़ा टाइम ज्यादा ले रहा हूँ, अपॉलॉजीज, क्योंकि मैं आई एम वाइल अभी डॉक्टर ओमकार ने इतनी ज्यादा तारीफ की कि टेक्नोलॉजी ये वो, एंड टेक्नोलॉजी के लिए थोड़ा मुझे चैलेंज आ रहा है. So just bear with me for a few seconds.
No problem.
Just bear with me for a few seconds.
Just to announce, we still have 19 more presenters. After this half an hour's valedictory function, we are going to keep on sharing this knowledge to all the Ayurveda fraternity, because 19 more doctors are going to present their topics. So please stay tuned. Don't leave after this valedictory function. We are going to continue till 6 o'clock. As usual, last 3 days, we have invested 15 hours, 5 hours each day. And today too, we are going to do the same. So please stay glued to your seats, and we are going to witness some fantastic presentations after this valedictory function.
Great.
Yes,
so I think we are ready. I would request Rohit sir to join in with us
yes,
on
Rohit
screen.
sir and Gurudatta sir have joined, sir.
Awesome. So we are having Rohit sir on the screen with us. Good afternoon, sir. I think Dr. Omkar, you will have to unmute Rohit sir. I don't have the host controls with me as of now, so you'll have to unmute Rohit
Yes,
sir.
sir. Done, sir. Rohit sir?
Yes. Am I audible?
Perfectly audible, sir.
Great. So thank you, Dr. Aman, for giving me the screen so early. And as we all are aware about this fact, that the basic intention behind this whole event was very simple, as we always have a single common goal with everybody within our organization, that we are an organization who deals for the patient's health. The only aim that we go ahead with is keeping the patient happy, healthy, and hearty for his whole life. And in doing this, what is happening is patient's belief on Ayurveda, patient's belief on the patient, on the doctor, on the therapist, all of this is improving gradually. And as a fruit, what is going to happen is Ayurveda would be called up as the first line of therapy for chronic cardiological disorders. So the end aim that we are looking at is making Ayurveda the first line therapy. Now, the question arises that is Ayurveda not the first line therapy nowadays? This is a general question that every Ayurvedic physician will think about. लेकिन मेरे हिसाब से what do we actually label as the first line therapy is the confidence inside the doctor's mind. When a doctor starts thinking कि यस, ये जो मैं शास्त्र इस्तेमाल कर रहा हूं ये सबसे बेहतरीन शास्त्र है और इसी शास्त्र के हिसाब से मैं हर एक पेशेंट को किसी भी डिसऑर्डर्स में से ट्रीट कर सकता हूं, ये अगर मैं मन में रखता हूं तो वो मेरे लिए फर्स्ट लाइन थेरेपी हो जाती है। पर कई बार ऐसा भी होता है कि लोग जब माधवबाग छोड़ करके बाहर के डॉक्टर्स अगर हम सोचते हैं तो उनके दिमाग में कभी कभी ये सवाल आ सकता है कि अगर ये पेशेंट कुछ इमरजेंसी वाला है, ये पेशेंट कुछ सीवियर डिसऑर्डर वाला है, कोई कॉम्प्लिकेशन वाला है, तो शायद मैं इसको एलोपैथी यूज करके देखूं क्या? इज ऑलवेज अ क्वेश्चन दैट कम्स टू एवरीबॉडीज माइंड। ये थॉट जब सबके दिमाग में से निकल जाएगा, पेशेंट कब आयुर्वेद को फर्स्ट लाइन थेरेपी बोलने वाला है वो पेशेंट पे छोड़ देंगे। सबसे इंपॉर्टेंट है कि हम डॉक्टर्स कब अपने आयुर्वेद को फर्स्ट लाइन थेरेपी बोलेंगे, ये सबसे इंपॉर्टेंट चीज है। और ये निर्माण करने के लिए लगता है एक प्रकार का कॉन्फिडेंस। और कॉन्फिडेंस कब आता है? तो मैं बार बार अगर मैं उसी चीज को बार बार सुनता हूं, उसी चीज को बार बार दोहराता हूं और उसी चीज को मैं बार बार इंप्लीमेंट करता हूं, तो अपने आप मेरे दिमाग में वो कॉन्फिडेंस निर्माण होते चला जाता है। जैसे फॉर एग्जाम्पल, मैं जानता हूं कि हमने कभी ना कभी अपने पूरे लाइफ में कोई ना कोई किसी ना किसी प्रकार के एलोपैथी की मेडिसिन तो जरूर इस्तेमाल की होगी। Like for example, आपने अगर पैरासिटामोल, दिस इज द मोस्ट कॉमनेस्ट मेडिसिन दैट इज टू बी यूज्ड इन एलोपैथी, अगर आपने पैरासिटामोल का अगर मैकेनिज्म ऑफ एक्शन अगर पढ़ा होगा, फार्मेकोलॉजी सातोस्कर भंडारकर का जो बुक होता है हमारा, उसमें अगर पैरासिटामोल का अगर मैकेनिज्म ऑफ एक्शन पढ़ा होगा तो आपको मालूम होगा वो नॉन स्टेरल एंटी इंफ्लेमेटरी ड्रग है। लेकिन एट द सेम टाइम अगर उसका हमने अगर इंडिकेशन इस्तेमाल किया करने का क्या होता है वो देखा तो फीवर होता है, ये तो हम सबको मालूम है। But at the same time, if at all we see what is the adverse effect of paracetamol, तो adverse effect में भी लिखा होता है फीवर, तो इंडिकेशन भी फीवर है और उसका एडवर्स इफेक्ट भी फीवर है। So this confuses a doctor, but still we have a lot amount of confidence on the allopathic स्ट्रीम और एलोपैथिक मेडिसिन। जैसे फॉर एग्जांपल कार्डियोलॉजी की जब हम बात करते हैं तो इकोस्प्रिन नाम की गोली होती है। जो इकोस्प्रिन नाम की जो गोली होती है वो सबकी बहुत ही चहेती गोली होती है। क्यों चहेती होती है गॉड नोस, बट किसी भी पेशेंट को एक एलोपैथी डॉक्टर की तरफ से बोला जाता है ये गोली जन्म भर बंद नहीं करना, बंद कर दिए तो हार्ट अटैक आ जाएगा, ये खून को पतला कर देती है ये गोली, एंड दिस इज अ वेरी वेरी इंपॉर्टेंट गोली। लेकिन एट द सेम टाइम इफ एट ऑल यू जस्ट गो ऑन गूगल और गूगल में जाकर के सिर्फ आपने NNR या तो फिर NTR मतलब नंबर नीडेड टू ट्रीट और कॉमा डाल के एस्पिरिन इकोस्पिरिन अगर डाल दिया तो आपको दिखाई पड़ेगा कि 1000 लोगों को गोलियां रोज के रोज 5 साल खिलाए तो उसमें से 4 या 5 लोग जिंदा बचेंगे ड्यूरिंग अ हार्ट अटैक। इफ दिस इज द एफिकेसी ऑफ इकोस्प्रिन, जिसपे हम लोग इतना भरोसा करते हैं, इतना उसके ऊपर प्यार करते हैं, एंड दिस इज द सिंपल, इतनी छोटी सी एफिकेसी वाला ये ड्रग अगर इतना बड़ा हो सकता है तो जस्ट इमेजिन आप लोगों ने इस 4 दिनों में जो पेपर्स प्रेजेंट किए हुए हैं, आपके आयुर्वेद के ड्रग्स की, आपके आयुर्वेद के थेरेपीज की, आपके आयुर्वेद के ज्ञान की एफिकेसी जस्ट मेजर करो, यू विल बी लॉट मोर स्ट्रॉन्गर देन व्हाट एलोपैथी इज। एलोपैथी, जब मैं खुद एमबीबीएस हूं, मैंने खुद फेलोशिप इन कार्डियक रिहैब अपोलो हॉस्पिटल में किया है, मैंने क्या सीखा है तो सिंपल सी चीज है, आप कोई भी एलोपैथी का ड्रग उठा लो, लाइक फॉर एग्जांपल अगर हम कार्डियोलॉजी की बात कर रहे हैं तो सिंपलेस्ट ड्रग दैट वी कैन बी नोइंग इज गोइंग टू बी डिजिटालिस। डिजिटालिस, द ओरिजिन ऑफ डिजिटालिस इज फॉक्सग्लोव प्लांट, मतलब इन शॉर्ट हृदपत्री। अगर आप सबसे भयंकर जिसको बंद करना पड़ा ऐसा एंटी हाइपरटेंसिव मेडिसिन ले लेते हो रिसरपाइन, तो ये रिसरपाइन इज नथिंग एल्स बट सर्पगंधा। उसी तरह से अगर स्टैटिन्स, जो आज बहुत ही ज्यादा लेवल पे इस्तेमाल होते हैं स्टैटिन्स, व्हाट इज दिस? दिस इज नथिंग एल्स बट अ फंगस। और वो फंगस मतलब क्या? तो ऐसे प्रकार से निर्माण किया हुआ फंगस जिसको हम लोग कोई भी चीज को अगर हम लोग बैक्टीरियल फर्मेंटेशन करते हैं, फर्मेंटेशन के बाद जो फंगस निर्माण होता है उस चीज पे, उसको स्टैटिन उसमें से डिराइव करते हैं। मतलब अगर आपके आयुर्वेद में बोले गए कितने तो ऐसे प्रिपरेशंस है जिनको आपको फर्मेंटेशन करवाना रहता है, जैसे कांजी। कांजी इज अ सिंपल प्रेजेंटेशन ऑफ एनीथिंग दैट कैन बी फर्मेंटेड, और ये फर्मेंटेशन प्रोसेस से निर्माण होती है स्टैटिन्स। सो अगर कोई भी ड्रग अगर एलोपैथी में से उठा लो, एवरी एलोपैथी ड्रग हैज अ ओरिजिन फ्रॉम आयुर्वेद। And having said this, even though that all these drugs have been derived from Ayurveda, still we consider allopathy as the first line of therapy. अब इधर हम सारे आयुर्वेद डॉक्टर्स को आगे आकर के अपने पॉइंट्स आगे डालने हैं दुनिया के सामने। अब दुनिया के सामने अगर पॉइंट्स डालने हैं तो कई लोग जो आज माधवबाग से जुड़े हुए नहीं है, इस पूरे सिंपोजियम को देख रहे हैं, मैं उनको ये बताना चाहूंगा, शायद आपके दिमाग में ऐसे सवाल होंगे कि आयुर्वेदिक थेरेपी करके जो सारे डॉक्टर्स ने प्रेजेंट किया है, आई वुड लाइक टू कॉन्ग्रेचुलेट देम बिकॉज दे हैव लर्नड ऑल दोज मॉडर्न पैरामीटर्स। ये सीखना बहुत डिफिकल्ट होता है। हम एमबीबीएस में रहते वक्त हमको सीखना इतना मुश्किल हो गया था, आप लोगों ने एमबीबीएस ना करते हुए भी ये सारी चीजें सीख ली है। फर्स्ट ऑफ ऑल कॉन्ग्रेचुलेशंस टू यू एंड हैट्स ऑफ टू यू। अब ये सारी चीजें सीखने के बाद आपने आपके आयुर्वेदिक थेरेपी को मेजर किया है, उसकी एफिकेसी ऑन द मॉडर्न पैरामीटर्स, दैट इज एक्सीलेंट। अब सवाल कई लोगों को उठा होगा कि ये मॉडर्न पैरामीटर्स पे क्यों हम आयुर्वेद की थेरेपी को गेज कर रहे हैं या एफिकेसी चेक कर रहे हैं। सो सिंपल सी चीज है कि उसका कारण एकदम सिंपल सा है कि अगर हमको आयुर्वेद को फर्स्ट लाइन थेरेपी बनानी है तो आज के जो पैरामीटर्स बाहर दुनिया में जो देखे जाते हैं, उन पैरामीटर्स के हिसाब से अगर हमने खुद को बता दिया कि अगर सीटी एंजियोग्राफी पे जब ब्लॉकेजेस रिडक्शन करके दिखा देते हैं तो ये है आयुर्वेद की ताकत। अगर HbA1c पूरी की पूरी आप नॉर्मल ला करके GTT नॉर्मल कर देते हो और पूरे 1-1.5 साल के बाद भी वो पेशेंट बिल्कुल डायबिटीज में नहीं जाता है, तो ये है आपके आयुर्वेद की ताकत। वैसे ही कितने तो ब्लड प्रेशर के पेशेंट्स, जब मैं एमबीबीएस कर रहा था हमको सिखाया जाता था कि एक बार ब्लड प्रेशर हो गया उस पेशेंट को तो उसको जन्म भर के लिए ब्लड प्रेशर का पेशेंट बुलाया जाएगा। लेकिन आप लोगों ने यह सिद्ध करके दिखा दिया है कि यू पीपल कैन एब्सोल्युटली रिवर्स ईच एंड एवरी लाइफस्टाइल डिसीज, एंड दिस इज द स्ट्रेंथ ऑफ आयुर्वेदा. I would always like to salute you people because presenting anything on such a big platform in front of so many hundreds and thousands of people on various different platforms, ये symposium आज अमन सर, ओमकार सर, राहुल सर, ये सारे ये पूरा अलग अलग प्लेटफॉर्म पे symposium दिखा रहे हैं. I am sure that more than 1,000 people are watching this symposium on various different platforms, और ये thousands लोगों के सामने आप लोगों ने आपके आयुर्वेद को आगे लेकर के मॉडर्न मेडिसिन के पैरामीटर्स से कंपेयर करके आपने आयुर्वेद की ताकत दिखा रहे हो. हैट्स ऑफ टू यू पीपल. You people have done an extraordinary job and I will always be proud about it. हमेशा मुझे ये, जब मैंने 2006 में ये जब माधवबाग की शुरुआत की थी तो कई आयुर्वेदिक एक्सपर्ट्स ने मुझे बताया था कि whatever you are doing is not of any worth and nothing is going to happen. आप छोड़ दो ये सब कुछ. You are wasting your time as well as you are wasting your money and resources. But I was confident on my team that yes, as the team goes ahead, we will be seeing that Ayurveda would be the first line of therapy in the days to come. And that day is not going to be far away. If the team leaders like Dr. Rahul, Dr. Omkar, Dr. Aman, Dr. Gurudatta, Dr. Praveen, and all these clinic heads who are presenting their papers for these kind of patient improvement, I am sure that the day when we have seen the dream of making Ayurveda the first line of therapy, that is soon supposed to be there in front of us. So once again, congratulations to all of those who have presented. More than 82 people have presented, I guess. And congratulations to all those people who have come to listen to these presentations. क्योंकि बात करना और प्रेजेंट करना इसके लिए अलग प्रकार का एक करेज लगता ही है, लेकिन अपने बिजी शेड्यूल में से ये आकर के सुनना और सुनकर के सारे डॉक्टर्स को अच्छे विशेष देना, अच्छा उनके बारे में बोलना, अच्छा उनके बारे में सोचना, ये भी बहुत बड़ी बात होती है. किसी दूसरे को प्रेज करना ये एक्चुअली एक लीडर की क्वालिटी होती है. So I would like to congratulate all those people who have come to listen and come to view this whole symposium. Hats off to you people. In the coming days, I am sure that we all will be working on the same mission of making Ayurveda the first line of therapy. So thank you once again.
Thank you so much, sir. Thank you very much for your fantastic words of motivation. Sir, here I would request you to please go ahead and inaugurate and open the certificates that are to be presented to our participant. And we will, I would request you to please do the honors. I'll just open the certificates within a couple of seconds. So let's have the inauguration of the certificates.
Dr. Aman, am I supposed to click somewhere?
I'll arrange. I am starting.
Okay.
It will get automatically started within the next 3 to 5 seconds, sir.
Yes.
Thank you so much, sir, for your inaugurating these certificates. And this is going to be a big motivation to all the doctors who have presented. And also, like you rightly said, people who have joined us today on the screen and are, commenting, motivating all the people who are presenting. So thank you very much, sir, for your words of motivation for us. I would also now request our Chief Medical Officer, man who is, extremely full of knowledge and vim and vigor, Dr. Gurudatta Amin, to please join us on screen and to please share his kind words with us. Gurudatta sir, you are on screen. Yes, sir.
Okay. Thank you. Thank you very much, Aman Kapoor sir. So first of all, as I said, बहुत बढ़िया लग रहा है. हर एक ऑर्गेनाइजेशन के पास एक तो फाइनेंशियल कुछ कैपिटल्स होते हैं और कुछ इंटेलेक्चुअल कैपिटल्स होते हैं. तो पिछले 4 दिन हमारे कलेक्शन कितना है, फाइनेंसेस क्या कह रहे हैं, इससे भी ज्यादा इंपॉर्टेंट या बहुत बड़ी जो असेट होती है, दैट इज कॉल्ड इंटेलेक्चुअल प्रॉपर्टी. और आज मैं देख रहा हूं कि पिछले 4 दिनों से जो कुछ एक विचार मंथन चल रहा है, जिस तरीके से सारे डॉक्टर्स पार्टिसिपेट कर रहे हैं, मेंटर्स उन्हें क्रॉस चेक कर रहे हैं, बाहर के डॉक्टर्स उन्हें क्वेश्चन कर रहे हैं, ये एक बहुत बड़ा, मैं कहूंगा, एक ज्ञान का यज्ञ चालू था। और उस यज्ञ को आप सब लोगों ने उपस्थिति दी, इसके लिए मैं आप सभी का अभिवादन करता हूं। विशेष रूप से मैं डॉक्टर राहुल और अमन कपूर, ओंकार चौधरी, डॉक्टर प्रवीण, सारे झड़े में जिन सभी का अभिनंदन करता हूं, क्योंकि मैं जानता हूं कि उन लोगों का इसमें बहुत बड़ा योगदान है और इसी तरह से हम आगे बढ़ते रहेंगे। सो व्हाट आई वाज थिंकिंग दैट कि हमारे फ्रीडम मिलने से पहले, यानी 1947 से पहले या फिर 1947 के बाद जो कुछ हमें फ्रीडम मिला, हमें एक्चुअली फिजिकल फ्रीडम मिला था, मेंटल फ्रीडम नहीं था। 1947 के बाद ब्रिटिश तो चले गए, लेकिन उन्होंने एक गुलामी की मानसिकता हमें दी थी और वही मानसिकता कह रही थी कि व्हाटएवर इज कमिंग फ्रॉम द वेस्ट इज अ बेस्ट एंड व्हाटएवर यू हैव इज अ वर्स्ट, वो अच्छा नहीं है। और इसी नजरिए से आयुर्वेद को भी देखा जाता था। आगे चलते हुए पिछले कई सालों में आप देख रहे हो कि हमारा देश एक ट्रांसफॉर्मेशन की फेज में है, एक परिवर्तन की फेज में है, खुद को समझने की फेज में है, खुद के सिद्धांतों को, खुद के तत्वों को समझने की फेज में है। और वहीं पर आयुर्वेदिक तरीकों को या फिर आयुर्वेदिक ट्रीटमेंट्स को एक्सप्लोर करना, ये भी उस सेल्फ रियलाइजेशन का एक बहुत महत्वपूर्ण अंग बन जाता है। इसी के तहत पिछले कई सालों में से, मैं कहूंगा पिछले 20 सालों से जो कुछ माधवबाग में डेवलपमेंट्स हुई है। अमन सर, एम आई ऑडिबल?
यस सर।
तो पिछले 20 सालों में जो कुछ माधवबाग में डेवलपमेंट्स हुई है, उनके पीछे सबसे पहला रीजन था अपने शास्त्र पर विश्वास। रोहित सर का अक्सर कहना रहता था कि अगर ग्रंथों में लिखा है तो वो ऐसे ही नहीं होगा, उसके पीछे कुछ ना कुछ रीजंस तो होंगे, और उसी रीजंस को एक्सप्लोर करना और उसके लिए एग्जिस्टिंग सारे साइंस के फील्ड्स का इस्तेमाल करना, फिर वो मैथमेटिक्स हो, फिर वो फिजिक्स हो, फिर वो केमिस्ट्री हो, एनीथिंग, बट उन सारी चीजों का पूर्ण इस्तेमाल करना। सबसे पहले मुझे याद है कि हमने ईसीजी मशीन लाया था, तो ईसीजी मशीन लेके ईसीजी सिखाना, ईसीजी सिखाने के बाद ईसीजी के बाद स्ट्रेस टेस्ट लेके आना, स्ट्रेस टेस्ट के बाद टूडीको का मशीन लेके आना, टूडीको के बाद पैथलैब इन्वेस्टिगेशन, पैथलैब इन्वेस्टिगेशन के बाद सीटी एंजियोग्राफी, छोटी चीजों के माध्यम से हम व्याधियों को समझते गए और प्रिसाइज ट्रीटमेंट्स डेवलप करते गए। मुझे लगता है ये जो कुछ रीवैलिडेशन ऑफ द फैक्ट्स होता है वो हमें हर बार करते रहना है, ताकि हम पेशेंट को कम से कम कॉस्ट में, कम से कम समय में और कोई भी साइड इफेक्ट न क्रिएट करते हुए व्याधि से जल्द मुक्त कर सके। ये जो प्रक्रिया है हमारे शास्त्रों को एक्सप्लोर करने की, ये निरंतर चलने वाली है। लेकिन पिछले 4 दिनों ने निश्चित रूप से इस मानसिकता में बहुत बड़ी ताकत भर दी है कि यस, हमें रिसर्च करते रहना है, हमारे सिद्धांतों को रिवैलिडेट करते रहना है, अलग अलग तरीकों से सोचना है कि हमारे पेशेंट में इंप्रूवमेंट कैसे हो। ये जान लें कि सिर्फ एक दवाई से, एक कोई छोटा सा इंटरवेंशन करने से वो व्याधि ठीक नहीं होगा। हमें उस व्याधि के जड़ तक जाना है। उस व्याधि के डेवलपमेंट के लिए जो कुछ शारीरिक, मानसिक, आहारीय, व्यायाम से रिलेटेड जो कुछ कारण होंगे, उन सारे कारणों का विशेष विश्लेषण करना है। मैं यहाँ देख सकता हूँ कि कुछ डॉक्टरों ने द्रव्यों के ऊपर रिसर्च पेपर प्रेजेंट किया था, कुछ डॉक्टरों ने सिर्फ पेशेंट एंगेजमेंट के ऊपर पेपर प्रेजेंट किया था, कुछ डॉक्टरों ने मनस स्वास्थ्य के ऊपर पेपर प्रेजेंट किया था, कुछ डॉक्टरों ने बल्क ऑफ पेशेंट्स में बात की थी, कुछ डॉक्टरों ने किसी पर्टिकुलर डिसीज कंडीशन में बात की थी। तो जो कुछ वैरायटी ऑफ केसेस हमने देखे थे, इससे मुझे लगता है कि माधवबाग की इंटेलेक्चुअल प्रॉपर्टी बहुत बढ़िया तैयार हो चुकी है और इसका पूरा श्रेय आप सभी को जाता है। सो थैंक्स अ लॉट एंड कांग्रेचुलेट टू ऑल ऑफ यू। मूविंग अहेड, पिछले कई सालों तक हमने जो कुछ काम किया है उसके फलस्वरूप हमने करीबन 22,000 डायबिटीज के पेशेंट्स को रिवर्स किया है। लेकिन 2025 तक रोहित सर का जो विजन है, वो विजन है कि हमें करीबन 5 करोड़ डायबिटीज के पेशेंट्स को रिवर्स करना है। ये विजन छोटा, ये मिशन छोटा तो नहीं है, 5 करोड़ बहुत बड़ी संख्या है, लेकिन क्या ये रिवर्स करना पॉसिबल है? यस, डेफिनेटली पॉसिबल है, क्योंकि फिलहाल हमारा सारा इंफ्रास्ट्रक्चर मजबूत हो चुका है। बेसमेंट बहुत बढ़िया क्लियर हो चुका है, तो आगे बढ़ने का जो हमारा स्पीड होगा वो बहुत ज्यादा होना चाहिए। हर एक क्लिनिक हेड ने ये देखना है कि हमारे नंबर ऑफ पेशेंट्स हम डबल कैसे करें एक एक साल में। इसके लिए प्रयास करना है, सोसाइटी को एजुकेट करना है, अवेयर करना है, असेस करना है और क्योर करना है। तो इसके लिए आप सब लोग कटिबद्ध हो, ये मैं जानता हूं। इसी के साथ साथ आगे बढ़ते हुए हम ये भी जानते हैं कि अगर 5 करोड़ डायबिटीज के मरीजों को रिवर्स करना है तो माधवबाग के डॉक्टरों के साथ साथ माधवबाग के बाहर जितने डॉक्टर्स हैं, आज पूरे भारतवर्ष में करीबन 6 लाख से ज्यादा बीएमएस डॉक्टर्स हैं जो प्रैक्टिस कर रहे हैं, उन सारे डॉक्टरों को भी साथ में लेना होगा। और उसी लिए माधवबाग ने एक नया उपक्रम शुरू किया है जिसका नाम है माधवबाग एसोसिएट। जो कुछ ज्ञान हमने पिछले 20 सालों में प्राप्त किया है इन टर्म्स ऑफ डिसीज रिवर्सल, डायबिटीज हो, ब्लड प्रेशर हो, हार्ट डिसीज हो, इन सारे ज्ञान को आप तक पहुंचाने का एक सीधा प्रयास हम करने वाले हैं ताकि आप भी इस शास्त्र का इस्तेमाल करते हुए आपके पेशेंट्स को रिवर्स कर सको। और इसी के लिए माधवबाग एसोसिएट के संकल्पना का विकास हमने किया है। तो आप में से जितने डॉक्टर्स जो माधवबाग के साथ जुड़े नहीं हैं और वो जुड़ना चाहते हैं, उनके लिए एक बहुत सरल तरीका है माधवबाग के साथ जुड़ने का, और वो है माधवबाग एसोसिएट। डॉक्टर ओंकार सर इसी चैट बॉक्स में उसके बारे में लिंक या उसके बारे में विशेष विश्लेषण निश्चित रूप से करते रहेंगे। और मैं चाहता हूं कि अपने से हर एक व्यक्ति जो माधवबाग की व्यवस्था से, सिस्टम से प्रभावित हो चुका है, वो आगे आकर माधवबाग के साथ जुड़े, क्योंकि ध्येय बहुत ऊंचा है। 5 करोड़ डायबिटीज को रिवर्स करना है, इसके लिए हमें बहुत सारे बीएमएस डॉक्टरों की आवश्यकता होगी। और सिर्फ आवश्यकता हमारे सूत्रों को या फिर हमारे नियमों को फॉलो करने की नहीं, इस ज्ञान के यज्ञ में निरंतर अपनी आहुति देते हुए हमें इस ज्योति को प्रज्वलित करते रहना है। और उसी के लिए हर एक डॉक्टर ने आगे आना चाहिए और इस मिशन के साथ जुड़ना चाहिए जो आयुर्वेद को फर्स्ट लाइन ऑफ थेरेपी निश्चित रूप से बनाएगा। यहाँ पर मैं रुकता हूं और फिर से आप सभी का, आयोजकों का और पार्टिसिपेंट्स का तहे दिल से मैं शुक्रगुजार हूं जिस तरह से उन्होंने प्रेजेंटेशन किया। सैल्यूट टू ऑल ऑफ यू एंड थैंक्स अ लॉट। धन्यवाद।
थैंक यू सो मच गुरुदत्त सर फॉर योर वंडरफुल एंड काइंड वर्ड्स जो आपने आज हमारे पार्टिसिपेंट्स को दिए हैं। एंड जो आपकी और रोहित सर ने जो हौसला अफजाई की है हमारे जितने भी यहाँ पर पार्टिसिपेंट्स हैं उन सब की। नाउ जो गुरुदत्त सर ने बताया है आपको एक प्रोग्राम के बारे में, दैट प्रोग्राम इसके डिटेल्स हम आपको बहुत शॉर्टली देने वाले हैं। इट इज गोइंग टू बी एजुकेटिव कोर्स जो आप लेके आप बन सकते हैं एक माधवबाग सर्टिफाइड डायबिटीज रिवर्सल एक्सपर्ट 1। और बहुत कुछ उसमें आपको सीखने को भी मिलेगा और एक मिशन में जुड़ने को मिलेगा जहां पे आप सब मिल के पेशेंट्स की डायबिटीज दूर कर सकते हैं और बहुत ही सरल तरीके से। इट्स अ वेरी इंपॉर्टेंट नॉलेज। 15 साल का सार आसार है उसके अंदर में, निचोड़ ऑफ 15 years of experience, research of close to 100 papers and 22,000 plus successfully treated patients का नॉलेज का निचोड़ है उसके अंदर में। वी विल श्योरली शेयर द डिटेल्स ऑफ दैट लिंक के अंदर में। एंड और समय ना लेते हुए वी विल मूव ओवर टू डॉक्टर ओमकार एंड डॉक्टर राहुल to please go ahead and continue the whole presentation ahead.
Yes, thanks a lot, Dr. Aman Kapoor sir, the technology man of Madhavbaug, and Rahul sir. I will, with your permission, I will like to start the presentations again.
Yes, we all must be charged, very charged, and I think this is time that we should continue with our manthan. And Dr. Omkar, please request the next presenter to.
And as per the kind words of our respected MD and CEO, Dr. Rohit Sane sir, and our respected CMO sir, we will be keeping this Guru Shishya Parampara on, and we are starting with our presentations again. Our next presenter is Dr. Pallavi and Dr. Divakar Pawar from Medical Square Clinic, Nagpur. And the topic of presentation is role of low carb diet and Panchakarma therapy in reduction of HbA1c with special reference to diabetic retinopathy in type 2 diabetes.
I will request everyone to stay tuned till the end of this presentation because Dr. Pallavi is going to share very new evidences which I think we never came across. So all the best, Dr. Pallavi, and
Thank you, sir.
we are waiting for you.
Sorry, before I leave, I'm obstructing for a quick second. There is a special announcement for all the doctors over here, those who have joined and those who have been presenting. So please note one important point to all of you is that in shortly, within the next couple of hours, maximum by tomorrow, late afternoon, you will receive an email with a link to download your certificate. You will be getting an auto certificate. Everybody, those who have registered on the registration link, you will be getting a certificate to download and take it. Get your certificate directly from there. Also, it's a request when you receive the email, do share your feedback, your comments, and your suggestions also in that. Thank you so much. That's apologies for taking the time. Over to you.
Thank you, sir.
Thank you, Aman sir, and thank you,
Yes,
sir.
yes, you're audible, ma'am, and you have 8 minutes of time. Best of luck.
Thank you, sir. Here, myself, Dr. Pallavi Pawar from Madhavbaug Medical Square Clinic, and with me, here is Dr. Divakar Pawar, and we are going to present here a case series of 3 patients entitled Role of Low Carb Diet and Panchakarma Therapy in Reduction of HbA1c, with special reference to Diabetic Retinopathy in type 2 diabetes. Our objective is to study what is the role of low carb diet and Panchakarma therapy in reduction of HbA1c, with special reference to Diabetic Retinopathy, type 2 diabetes. And when I was searching for some kind of data for my personal research work, I came across the prevalence of this risk factor, the risk of suffering Diabetic Retinopathy in diabetes. When the disease duration is more than 5 years, then in type 1 diabetes, there is a 25% of chances to getting Diabetic Retinopathy, and in type 2 diabetes, its percentage is 35%. And when the duration is more than 10 years, it's 75% in type 1, and in type 2, it's 55%. Rationale of my study, after I came to this, I came across to this prevalence, we suddenly tie up with one ophthalmologist, and from January 2021 and January and February 2021, we planned a campaigning for a checkup of Diabetic Retinopathy, and around 24 patients we have screened up, and with that 24 patients, Dr. Pawar and Dr. I, both of us had a retina scan also to motivate our patient to be done that. And then amongst that 24 patients, 8 patients who are having more than 10 and 20 years duration of disease, they diagnosed with Diabetic Retinopathy, and then the treatment started. But when Diabetic Retinopathy occurs, there is only one thing is there to treat that, surgical or laser therapy. So for previous damage, they go for that laser, and again they follow up with us and ophthalmologist also. And among that 8 patients, only 3 patients came up with markable improvement. And then we dig up why only 3 patients are come out of that 8 patients with improvement. We dig up that data and know the results that they are strictly stuck up to their diet compliance, their Panchakarma therapy, and still they are following the same regimen after getting recovered also. Introduction, as we all know, what is Diabetic Retinopathy? Type 1 diabetes, there is no production of insulin at all, and in type 2 diabetes, there is alteration, production, and function of insulin, as well as ignorance of insulin by the cells. And now, what is Diabetic Retinopathy? What exactly happened with there? Diabetic retinopathy is a progressive dysfunction of the retinal blood vessels caused by chronic hyperglycemia. It can be a complication of diabetic type 1 as well as type 2 diabetes. Initially, DMR is asymptomatic. Few patients show with symptoms, and some not. If not treated, it can cause a loss of vision permanently or low vision. Risk factor of Diabetic Retinopathy, as we previously seen, duration of diabetes is the main predictor
for the diabetic retinopathy. When the 10 or 20 years more diabetes is there, the risk is more. And second one is HbA1c level more than 7.5%. Before going ahead, we should know what is normal, what is the normal retina, how it looks. So here is normal retina. You can see in scan normal retina looks like that. This picture. This is optic disc. Red ones are retinal arteries. These blue are retinal veins. This is macula, and the branches of red are retinal arterioles, and these blue are retinal venules. This is a normal. When I and Dr. Pawar goes for retina scan, our retina were looking like this. But when one get a diabetic retinopathy, the retina looks like such. These red spots are retinal hemorrhages due to ischemic changes here. This is the red, all spots are retinal hemorrhages, and these yellow spots, these are the exudates. Exudates means कि जहाँ पे प्रीवियसली हेमोरेज हो चुका है वो ड्राइड अप हो जाता है, आरबीसी डिस्ट्रक्ट हो जाती है और जो लिपिड्स ब्लड में रहते हैं वो ड्राई होते हैं. तो वो जो ड्राई लिपिड्स है, these are these yellow spots, and these are cotton wool spots, white spot. When once had previously hemorrhage, you should have laser therapy, and after that laser, this white spot can be seen here. Now, these three patients with us in this case series. First among case 1 is 59% male patient who is having 25 years of his diabetic history, and since 2017 he is with us, and patient hide the history of having retinal hemorrhage previously. उसे लगा कि ये आयुर्वेदिक डॉक्टर से ये मेरा डायबिटीज ट्रीट करे, ये मुझे कार्डियक थेरेपीज दे रहे हैं, तो आई सर्जन अलग होते हैं, आई स्पेशलिस्ट अलग होते हैं, ये मेरा क्या करेंगे हेमोरेज के साथ. तो he doesn't think it's significant to tell us about that hemorrhage. But in 2021 he was hospitalized for COVID-19, and the glycemic control which he achieved in previous 4 years drastically वो shoot up हुआ hyperglycemic के साथ, और sudden he had again retinal hemorrhage. Then he come to us, and amongst that 24 patients he was also there. Then second one is 56 years old male patient who is having 20 years of diabetic history, and third one is 62 years old female who is having diabetic history since 12 years.
Last 2 minutes, ma'am.
Yeah. This is the average study of these three patients. Average baseline HbA1c was 9.2. Average duration of this is more than 10 years, and they were having blood vision, floaters, flashes, partial loss of vision, darkness, and poor night vision. All the patients were assessed on different clinical parameters as we regularly do with diabetic patients, and all clinical and laboratory investigations we have done. That is HbA1c, post-meal fasting, blood sugars, and all that. Then we advise that patient ophthalmic checkup and retina scan, and treatment advice was Panchakarma therapy. Diagnosis: type 2 diabetes, diabetic retinopathy, and treatment information. We orally use Gudmar Amal ki Haridra extract to prevent macro and macrovascular complications in this patient, and Daru Haridra is which is well known anti-hyperglycemic agents and which reduces insulin resistance. For diet therapy, initially for 3 months we use 8 kilocalories of diet, followed by 1000 kilocalories diet for 1 or 2 months according to their BMI, and after that they are continued with multigrain atta, which mainly contain barley, which is having low glycemic index and high ORAC values, with portion control breakfast kit, and Panchakarma therapy, centripetal ovulation with neem seed oil and thermal vasodilation, and parectal drug administration with Gudumar, Daruvaridra, and Himarupa. These are the baseline. Average of 3 patients, weight 61 kg, day 1, 26.6 BMI, and HbA1c baseline average was 9.2. And recently they were having average weight 56.6, BMI 22, and average HbA1c 6.5 with a drastically tapered OHS and insulin intake. These are the results you can see here. Significant changes in their weight and BMI and 4 consequent HbA1c readings from 10 to 6.8. All the 3 patients were having here. Since last 8 to 9 months, they are having same the reading below 6.1 to 7. Here is signs and symptoms which are reduced. Signs in second retina scan. Before treatment, they were having proliferating diabetic retinopathy with diffuse vitreous hemorrhage, all the 3 patients. And in second scan, ophthalmologist observed that there is no bleeding and no macular edema at all. Here we can see medicine. This 6.1 to 6.8 एवरेज HbA1c वो भी उन पेशेंट्स का है कि फर्स्ट केस जो है 100 यूनिट्स ऑफ इंसुलिन लेते थे जो कि ओनली 6 यूनिट इंसुलिन पे नाउ ही इज गोइंग ऑन एंड विथ 4 टाइप ऑफ OHA he was taking now only 2 type of OHA and only 6 unit insulin he is taking now. Second one is 3 types of OHA. Now he is having once a day 2 types of drugs for OHA, and third one is taking 50 unit insulin BD dose में ले रहे थे जो कि अब सिंपली OHA पे स्टेबल है 6.1 HbA1c पे. This is the first patient scan, completely opaque. You can see before treatment. This is vitreous bleeding जब होता है तो रेटिना पूरी तरह से opaque दिखता है. After treatment, it looks like normal. रेटिना आर्टरी यहाँ पे विजुलाइज हो रही है. In second case also, this is a complete vitreous bleeding. This is also vitreous hemorrhage, and here you can see optic disc and retinal artery clearly. This is the laser therapy patch. In this case, V-shape. This is the baseline endothelial lining, which should be like this V-shape in normal retina, but it's inverted in this case. Because of severe macular edema, it looks like this. And after treatment and stabilized HbA1c values, it looks like this normal V-shape. Discussion. In oral medicine, Gurmar, Amalke, Haridra and Daru Haridra plays a main role to prevent micro and macrovascular complications in these patients, as well as 800 to 1000 kilocalorie diet leads his metabolism to reduction to insulin production, and which results in utilization of fat and protein which are stored in muscles and use them as a main energy source. On the aim of using the low carbohydrate diet here only to force the body to use stored fat.
Ma'am, please come to conclusion.
From this study, I came to the conclusion that decreasing carbohydrate level intake results in lower insulin levels, which causes the body to burn stored fat energy and lowering the blood glucose level and reduction in HbA1c. Diabetic retinopathy is preventable through strict glycemic control and annual dilated eye examination by an ophthalmologist. And I would like to share one take-home message with my colleagues, all the doctors. Please go for retinal scan when you come across the patients of diabetic type 2 or diabetic type 1 and having disease duration more than 10 years. So screen him with a retina scan to prevent further damages. These are some references. Special acknowledgement to Dr. Sandeep Anjankar, vitreoretinal surgeon, for this photo courtesy and following my patient sincerely for 8 to 9 months across. Our team, clinic head Dr. B.N. Pawar. Thanks for all.
Amazing results, amazing results. This was one of the case which we haven't discussed since last 3-4 days, and this was a stand-apart case. Congratulations, Dr. Pallavi Pawar ma'am and Dr. Divakar Pawar sir.
Thank you.
So over to you, Rahul sir.
As I said, excellent results The first of all, when I was reviewing the PPT presentation, and when I saw the results, I was so amazed. I was like, this is a kind of a presentation that I was expecting in this at this platform, because diabetes is not just a disease; it comes with the complication, and retinopathy is something which is beyond our imagination how to treat and how to manage. But when you are managing a sugar levels, when you are managing his other parameters, we never had any evidences of like a retinoscopy what Dr. Pawar ma'am and Mr. and Mrs. Pawar has done. So superb work, ma'am, and very good result. Keep your good work.
Thank you.
Ranjit sir, your views on this, please.
Yes, superb work, Dr. Pallavi ma'am. A unique work where we were missing like that. We trust that everywhere we are repairing the blood vessels, microvascular complications reduces after the diabetes reversal. But we never seen just like these evidences. So you have collected and you have focuses on these sections. So this is the unique work. So excellent work, ma'am. Keep it up. That's good. All the best.
And we have a very constant doctor, the doctor who is asking questions throughout last 4 days. Special appreciation to Dr. Sandeep, who has been very pinpoint, and he has asked a question for Dr. Pallavi Pawar, whether these retinopathies were due to diabetes or whether these were from hypertension. Can you please clarify on this point?
Sir, we have focused on his HbA1c level because they are highly shoot up, and as we all know, hypertension is one more predictor for that. But all the 3 patients are stable, having stable in their blood pressure. And whenever, as I say, first patient who is having 25 years of history, and since 2016, he is having repeated and frequent episodes of retinal hemorrhage. For this, he has to go to Hyderabad and get surgery for that. Since last 1.5 years, he is not having that episode.
So that has been concluded that this was due to diabetes.
Due to only diabetes, because when dig up that these 3 patients, then came to know blood pressure is completely normalized and not having any hypertensive and history hai, but they were stable at that age.
Sandeep sir has mentioned such hemorrhage is seen in hypertension, HT and retinopathy as well.
Not outside.
Yes, thanks a lot. Superb confidence, Dr. Pallavi Pawar, and absolute gem of a presentation. So now we will be moving on to the next presenter. And our next presenter is Dr. Just a moment. Yes, Dr. Preeti Vanjari ma'am from Gandhinagar, Wardha. And her topic of presentation is efficacy of ischemia reversal treatment in post-angioplasty angina. One more good topic. So Dr. Preeti Vanjari ma'am, I am going to spotlight you.
To the next presenters, please stick to the time, because time is something which is more precious thing right now, and everyone, I think, please, 8 minutes, you have to finish your presentation.
Yes, Dr. Preeti, you have 8 minutes of time. After 6 minutes, I will be signaling you. So you need to hurry up then. Kindly keep it on slideshow mode. Yes, perfect.
Sir, I am audible?
Perfectly, ma'am. Okay, you can start with your presentation. Best wishes.
Myself, Dr. Kirti Mirchi from Madhavbaug Clinic. Today's topic of my presentation is efficacy of ischemia reversible program treatment in post-angioplasty angina. Aims and objective of the study. As in last decades, the number of myocardial revasculation procedure using coronary angioplasty in a patient with chronic stable angina has been continuously increasing. More than 30% of the patient with the prior revascularization still report episode of angina in a 3-year follow-up. In our trial, angina was present in 21% of the patient in 1 year after angioplasty, and 42% patient showed either recurrent angina or repeat revascularization after 5 years. In large retrospective study of Mayo Clinic, 30% patient treated with the angioplasty experience angina, and 12% patient reports the severe recurrent angina. So my case presentation is on related to this topic. My patient, male patient, 53 years old, electrician by profession, residing of Vardha, having a Varpita Prakriti, Agnimandal Mudhu Koshta, and BMI was 23, and Bala was a lean, he was a history of non-addiction. His medical history, briefly I will explain. He has a chest pain in July 22. He got admitted in hospital. Diagnosed as a MI. After that, hospital advising for angiography. After angiography, there was finding of plug in LED 100%, and he was advised as a PTCA, and PTCA was done. PTCA was done. After that, this is his angioplasty reports, angiography reports. And now he come to my clinic. He come to clinic with the complaint of chest pain, and he severe chest pain from a week later, since a week, and he got a difficulties in regular activity, and just got relief just by the sorbitrate only. His present patient assessment was done. The pulse was 52, BP was 90/60. Pulse oxygen saturation was 98%. 6-minute walk test was taken. As the patient have a continuously chest pain in routine activity, so I didn't advise him trust test. I took the 6-minute walk test. He can walk only 4 minutes. He covered 181 meters distance. Stopping criteria was the chest pain. ECG was taken before and after chest walk test. It shows T inversion in V5, V6, and V4 periods. First day he was on the medicine, the Diplet A tablet involves BD, tablet Lacelectron 20 mg, Lepicure tablet 20 mg OD, ZNR MRBD, tablet sorbitrate SOF, but he was taking PDS in the recent days. Monotrek 30 mg OD and Bisotep 25 mg BD. From all above walk test, and his history of chest pain reviewed by only sorbitrate and chest heaviness after walking and daily routine activity, I diagnosed as it is a ischemic heart disease, and advanced treatment was ischemia reverse treatment for 14 weeks. As ischemia reversible treatment is consists of the centripetal ovulation with the teal oil, the strokes and directed towards the trunk region for 14 minutes. Steam was given with the Dashmul Kada in the steam box for 20 minutes, and colorectal and drug administration was done with the decoction of Mosul, Haridar, and Amalki. 100 ml decoction was used. And with that, oral medicine also advised. The tablet comes considering consisting Mosul, Haridar, and Amalki. It improves intrinsic and extrinsic nitric oxide secretion, coronary artery. Kadha with the Arjun Vacha and Punarava will act as a cardioprotective, myocardial antioxidant, and improve myocardial functions. And Churna containing Arjun Punarava Vacha, Dalchini Vibhita was given, vasodilator, anti-inflammatory, and act as a reducer chest pain. I advise him taken as a sorbitrate instead of sorbitrate when having chest pain. Also given a Mrudu Virechan with the Aaron oil, given Fauna with the Musta, Haritki, Chirak, Sunti, and Rumichi. With that, I advise him a proper diet plan. Especially, I advise him a moon diet for 3 days when he have a severe episode of chest pain. As the reference was taken from Charakta Chatush Prakara Sanshudri, Pipasa, Maruta, Atapa, Pavanascha, Upasha, Vayama, Chitti, Langana. As a moon, I can't keep him envium as it was a heen color. So I advise him moon diet with a rich potassium, high fiber, high protein, which help to lower the cholesterol, antioxidant action, it has an anti-inflammatory action. After that, I advise him portion control diet with having a low protein and low carbohydrate diet. Medicinal changes was done as sorbitrate stop as soon as I gave him confidence and advised him taking the Churna sublingual instead of sorbitrate when he got the chest pain. If he don't get relief, then Churna, then he can take a sorbitrate. Lacelectron, I may make it alternate day, then Clavidon MR OD doses and Bisotep on OD. Dietary changes: when there is an episode of chest pain, I prefer him to take a moon diet, and Hridayadhara was advised when he have a complaint of DV.
These are the results. BMI before the treatment is on 23.3, after 21.3. Blood pressure was 90/60, and after that 110/70. Pulse was 52, and now the present is 70 per minute. Abdominal circumference was 96, now 86 meter. As I told before, peak walk test was 6-minute walk test. He only can walk for 181 meter, and stopping criteria was chest pain. Now, after this, I took him on stress test. He completed 10 minutes stress test using modified boost protocol. There was no fresh changes, and he have no absolute complaint of chest pain in about 10 minutes. These are his report showing no regional abnormality. As we can see, first report was there is a regional wall abnormality. EF was 35. Now he has 64% of EF, and no ischemic changes are there in echo report also. These are his present medicine. I kept him on Diplet 8, Invas, OD, and Lepicure 20 mg.
Last 2 minutes, ma'am.
Yes, discussion. Ischemia is a result of imbalance between myocardial oxygen supply and demand. Stiffness of central arteries increase the atherosclerosis, is an independent predictor of adverse pulmonary event. Various procedures performed is a part of ischemia reversible treatment, may help to reverse the phenomenon of ischemia. Srehena, that is centripetal ovulation, reduce sympathetic overstimulation, improves the vascular tone, decrease the myocardial workload, would thus reduce the risk of ischemia. Svedana cause vasodilation at the microvascular, and which in turn reduce systematic resistance, vascular resistance, and myocardial oxygen supply. Reduction in the afterload decreases the cardiac workload and myocardial oxygen demand, thus reduce the risk of ischemia. The Basti, which contain Zebustus terrestrialis boxure, clinical study has proven it a nitric oxide mediated vasodilator effect. Udayadhara, Harindra, which proven an anti-inflammatory herb, and Amalki, and already animal study proves that it has a reduced oxidative stress and inflammation along with the risk of ischemia. From that, we can conclude that the recurrent angina after angioplasty can have severe limitations of quality of life of the patient. It can be problematic in day-to-day life, leading to the degradation of the quality of life of the patient. Ischemic reversible treatment can have value addition for the dose post-angioplasty life. Thank you. These are the references. Thank you.
Thank you, Dr. Preeti Vanzari, ma'am. Super presentation. Over to you, Rahul, sir.
Results, ma'am. Excellent results, ma'am. And superb presentation. All the evidences you have collected, superb. Again, the same suggestion for you also. Do not disclose your patient's name while giving the presentation. And I request rest all the other presenters, upcoming presenters, please do not disclose your patient's name while presenting. It is not in favor of ethics, right? So, but keep it up, ma'am. Very nice presentation.
Yes, Ranjit sir, your views on this, please.
Superb presentation, Dr. Preeti ma'am. The entire presentation was very good. But the one thing I wanted to know that in that results, whatever you have showed, in this VO2 max was little bit lesser before and now. So what may be the reason, and what was your observation on this? It was due to some other factors or what?
Sir, as he was chest pain, so he can't walk more than 4 minutes.
Okay. So you are taking this on the walk test?
Yes. Firstly, I taken walk test as he got only 35 years, and he was even he came to my clinic in auto. Okay. He stopped doing his all the routine activities. He was healable, and मेरे को उसको psychological बहुत motivate करना पड़ा क्योंकि sorbited he was taking TDS sorbited. Even when I taper his Invas tablet, तो he was also at that confusion कि Invas लेने से भी मेरा दर्द कम होता है. तो ये patient इसलिए मैंने select किया. ये बहुत सारे challenges थे. उसको 3 anti-anginal drugs चालू थी. उसके बाद वो मेरे यहाँ ऐसे है कि रेफरल बाय वन ऑफ हिज कलीग वर्किंग एट द सेम फॉर्म कि जाके देखो, मुझे भी बाईपास सजेस्टेड किया था, लेकिन मुझे भी बहुत चेस्ट पेन कम है, तो आप भी एक बार मिल के देखो.
तो इसमें ऐसा था कि उसमें मुझे VO2 max से अच्छा पेशेंट का मानसिक बल भी बढ़ाना था। उसको नया डाइट में उसको सिर्फ उर्दू विरेचन दिया सर, मैं अगर उसको हेवी विरेचन भी देती मुझे रिजल्ट जल्दी मिलते थे, लेकिन थिंकिंग ऑफ द साइकोलॉजी ऑफ द पेशेंट आई टेक हिम इन थोड़ा थोड़ा उसको मोटिवेट करके, और कॉम्प्लेक्स बहुत स्ट्रॉन्ग रखा उसमें।
That's good. That's good. The entire results are very good, and as you have presented the 2D echo, which shows that the hypokinesia it was recovered. So this is really a fantastic thing. That's very good. Keep it up, ma'am, and keep collecting like this all documentation. Okay, fantastic. All the best.
So, madam, was it a stable angina or unstable angina? Unmute, ma'am. Yeah. Yes, ma'am.
पहले तो जैसे स्टेबल ही था, कभी कभी उसको ये था, बीच बीच में उसको एपिसोड्स ऑफ अंजाना आते थे। ही वाज टेकिंग जैसे कभी ज्यादा हो रहा है कभी कम हो रहा है अभी, और जैसे कुछ हेवी वर्क हो गया कंपनी में, एज ए इलेक्ट्रिशियन ही वाज डूइंग हेवी वर्क्स, एट दैट टाइम द angina get worsened.
Fine, ma'am. Thanks a lot. So now we'll be moving on to our next presenter, Dr. Kalyani Belorkar, ma'am, and her clinic is Jackerpet, Akola, and her topic of presentation is what is the role of polyherbal formulation of Brahmi in anxiety neurosis of hypertensive patient. Yes, Dr. Kalyani, you have 8 minutes of time. You can start with your screen sharing.
Am I audible, sir?
Yes, ma'am. And you need to keep it on presentation mode. Oh, there's some network issue, I feel so. Dr. Kalyani? Yes, please try.
Is screen distracted, sir?
You need to share your screen, ma'am. Yes, now keep it on presentation mode.
Today's my topic is what is the role of polyherbal formulation of Brahmi, the Bacopa monnieri, in anxiety neurosis of hypertensive patients. Patient medical history: 54-year male.
Madam, your presentation should be on slideshow, on the presentation mode. Now, presently we are seeing the first slide.
Is it okay, sir?
Rahul sir, is it visible at your end?
मॅडम तुम्ही तुमच्या स्क्रीनवर स्लाइड शो ला क्लिक करा. इथे होम इन्सर्ट डिझाइन एनिमेशन वगैरे लिहिलेलं आहे ना वर राइट हँड साइड. हा 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 तर तिथे स्लाइड शो वर या. हा क्लिक करा स्लाइड शो. हा आता तिकडे खाली फ्रॉम बिगिनिंग वर क्लिक करा. लेफ्ट ला एंडला हा क्लिक करा त्याच्यावर.
Yes. आता दिसतंय सर?
डबल क्लिक करावं लागेल मॅडम तुम्हाला. परत एक वेळेस ट्राय करा. सेम तसंच स्लाइड शो वर जायचंय. क्लिक करा स्लाइड शो. हा डबल क्लिक.
This seems to be a technical issue. Kalyani ma'am, what we can do is we'll go up to the next presenter. Meanwhile, you can send this presentation to Rahul sir.
Wait. माझ्याकडे, I think I have her presentation.
Okay. Fine, sir. Now that's visible. Yes, Dr. Kalyani, please continue. You have 8 minutes of time.
Thank you, sir. What is the role of polyherbal formulation of Brahmi, that is the Bacopa vulnari, in anxiety neurosis of hypertensive patients? Next. Medical history of this patient, a 54-year male patient, known case of HCN, diagnosis in 15 days, located in Akola, occupation teacher. A patient suffering from fatigue, dyspnea, exhaustion, constipation, shoulder pain, went to investigation. After examination, detected as hypertension. After 15 days, patient come to our clinic with the same complaint, exam is still high, and advise investigations like ABPM, lipid profile, and serum creatinine. Next. ABPM report suggests as patient is stage 1 hypertensive and a white coat effect present. Next. Diagnosis of this patient according to guidelines published by American Heart Association. The category of blood pressure patient suggested as stage 1 hypertension, that is the BP 130 to 139 mmHg, or diastolic would be 80 to 89 mmHg. And according to World Health Organization, 1 in 13 people globally suffer from anxiety. The WHO reports that anxiety disorder are the most common mental disorder worldwide, with a specific phobia, major depressive disorder, and social phobia being the most common anxiety. For these, hospital anxiety and depression scale used in this case. Next. Treatment given to this patient: oral medications, polyherbal formulations, Brahmi extract with Kirti extract, 250 mg/d, Arjun with Punanava and Vacha decoction 20 ml BD, Gandharva Haritki 5 gram SS, Aranda oil mixed with a Triphala 30 ml once in a
Your
week.
voice is not coming clearly. Can you use some headphones? You need to change the settings.
You have removed your headphones. You have to go to your audio setting and you need to make a change.
Yes, because the voice is echoing and it's not clear.
Now it is audible. May I audible now, sir?
Yes, you're audible. Just raise the volume of your laptop.
Yes. Diet given to this patient: oral calories 1000.
Please continue.
Come little closer and speak loudly.
Low calorie 1000 kilocalorie diet, sodium restricted less than 2000 mg, high potassium 4700 mg per day, low carbohydrate 40%, protein 20%, and fat 40%, and high fiber. Good source of magnesium should be given in this diet to reduce BP and maintain a weight. Celery salt 2.5 milligram per day. Panchakarma should be done in this case. Snehan, that is the massage or external oleation with 100 ml Vitex Negunda oil, extract proceed in sesame oil, 30 to 35 minutes. Svedan, that is the passive heat therapy with a dashmul with a steam at less than 40 degrees Celsius. Duration of this therapy 10 to 15 minutes and 34 minutes of relaxation after procedure. Shirodara, that is a decoction dripping therapy from a height of 7 to 8 centimeter. 100 ml of lukewarm water, Jatamansi decoction, and duration of this period is a 30 minutes. Exercise with meditation, daily 30-minute walk, 25 minutes. Please back.
back cancer. Treatment with timeline, blood BP 160 per 100 mmHg baseline, oral medication explained as above. Panchakarma first therapy was done. Diet explained as above. Allopathy medicine tablet aspirin 75 mg, atorvastatin 10 mg/h, tablet metoprolol 25 mg, and amlodipine 5 mg. Exercise schedule plan in first treatment. Follow up after 1 week. BP still high 150-90 mmHg. Oral medication same as above, but Brahmi extract with Sunthi extract should be started from this follow. Second therapy was done. Medicine as it is. After first week, BP was reduced 124 by 80 mmHg. Fourth therapy of Panchakarma should be done. Oral medication, diet, and allopathy medication as it is. Follow up after 3 months. BP still maintain 120 by 80 mmHg. In this follow up, ABPM should be done, and ABPM suggestive as white coat effect absent and HDN stage is elevated. No any fresh complaint. Weight 71.7 to follow up after 3 months, 61.4 kg, BMI 23.4 kg, abdominal girth 84 cm, pulse 68 per minute, 126 by 80 mmHg, respiratory rate 18 per minute, lipid profile, cholesterol 122, HDL 44, triglyceride 88, LDL 60, serum creatinine 0.95. Next.
Hello. Next slide.
Result.
Yes.
Patient were found to have a HDN for the first time on their visit. After taking brief history, patient also suffering from anxiety neurosis after 1 week on follow-up started Brahmi extract and Sunthi extract 250 mg in BD dose with advised lifestyle and dietary modification. There was a significant decrease in MAP in reduced anxiety symptoms on after 1 month as compared to that on day 1. In Ayurveda, Brahmi is considered to be a powerful medicine, that is a brain tonic, and has been a better study for this nootropic effect. However, it has also shown promises as an anti-stress as well as antioxidative agent. There have been a very few studies which have tried to evaluate the effect of Brahmi as an anti-anxiety as well as anti-hypertensive agent. No any kind of adverse effect developed during treatment of this period. Next. So please next. Discussion. Hypertension is one of the most common and dangerous non-communicable disease affecting a worldwide population. Stress is a common and sometimes unavoidable problem that may lead to serious health effects. Current allopathic antihypertensive drugs used for HDN are not associated with anxiety neurosis. CDRI-08 is a specific extract of Bacopa monnieri, possesses an anti-anxiety effect, antidepressant activity, anti-conversion action, and antioxidant activity. Supplementation of Brahmi normalized the level of corticosteroid hormone, which were imbalanced due to acute and chronic state induction in rats. This study published in National Library of Medicine. Important to look alternative medicine for safe and cost-effective option to treat anxiety neurosis in HDN patients. Next. Our polyherbal formulation of Brahmi, which is successful in significantly reduced anxiety neurosis in HDN patients without any adverse effect.
Fantastic presentation, ma'am. Over to you, Rahul sir.
Yes, ma'am. Very nice presentation. Just one point, I think the blood pressure ranges that you have given, the stages of a blood pressure, and you assess your patient with ambulatory blood pressure. So, is the range of ambulatory blood pressure, the stage as per the range of ambulatory blood pressure, is same as the clinic blood pressure, or it is different?
It is same as blood pressure.
I think we need to check on that point again. I think you go and do the literature again, and I think rest your presentation was superb. And the concept that you have suggested, that the Brahmi and the Rho, its role in the anxiety neurosis and its role in hypertension, superb. And the blood investigation that you use ABPM is showing the superb results. So congratulations. The only one point, I think we need to re-evaluate the stage of hypertension as per the ABPM and stages of the hypertension as per the clinic blood pressure monitoring.
Yes, sir.
Yes, Ranjit sir.
Yes, congratulations, Dr. Kalyani ma'am. Very nice topic you have selected for the presentation. The one thing is here I want to know that how can you conclude that this effect was due to Brahmi or just because of your counseling? It may be the reason that your counseling is always good for the patient, so it may be the due effect of your counseling. So how can you conclude that it is the effect of Brahmi?
So there is a technical issue. I think she's got disconnected. Okay. Fine. There are a couple of questions, but it will be better that Dr. Kalyani
I think we should
answers. Yes, we'll move on to the next presenter. Yes, we'll move on to the next presenter now. Our next presenter for today is Dr. Charan Sonare from Varud Madhavbaug OPD, and his topic of presentation is role of polyherb in low ejection fraction. Dr. Charan Sonare. Yes, sir. Yes, sir. Charan, sir, you have been spotlighted and now you can share your screen.
Sir, I am audible?
Yes, perfectly audible, sir. Share your screen on presentation mode.
Yes.
Yes, sir. Perfect.
Thank you, sir. Thanks to all for giving me this such opportunity for presenting such case. My name is Dr. Charan Sonare, Head Madhavbaug OPD Varud. My paper is on is there role of polyherb medicine in heart failure with low ejection fraction. Methodology is that a prospective single case study. There was number of case study for low ejection fraction, but that case was different because of her ejection fraction was only 50. Case detail is like that. She is of 26 years, female patient, housewife, coming with complaints, breathlessness, reduced appetite, vertigo, body ache, and bilateral heat edema. Her weight was 45.95 kg, blood pressure 140/90, temperature 98.40 degree, and respiration rate was 22. Tongue coated, pallor absent, clubbing absent, cyanosis absent, heat edema present, CNS oriented but some androgy because of cardiac output is less and some hypoxia like condition was there. CVS was S1 S2 loud and mild murmur, that mitral regurgitation that create that murmur. Respirations bilateral air entry is normal. Per abdomen soft and not tender. Her blood investigation was CBC normal, ES normal, KFT normal, but addressing that NT-pro BNP2 was 33,562 pg per ml. Her ECG sinus tachycardia. Main focusing point was that first echo on 4 January 21, cardiomyopathy, severe global hypokinesia. Her ejection fraction was 15 to 20%. Diastolic dysfunction grade 3, mild MR, mild BH, and private ER, thin pericardial effusion, and TVC congested, IVC congested. Here mild mitral regurgitation, as there was cardiac diastolic dysfunction. Patient was advised cardiac transplant, but her low economical status, so she searched for Ayurveda treatment and come to me. Her diagnosis, differential diagnosis, some point like LVH, valvular disorder, anemia, and diastolic dysfunction. As there is no such CHD congenital heart disease was history, valvular disorder was no there. As her CPC was near normal, no anemia, diastolic dysfunction it considered, but final diagnosis dilated cardiomyopathy with low ejection fraction by 2D echo. That diagnosis was final. Treatment history. She was taking modern medicine like valsartan, amlodipine, furosemide, digoxin, and advice for cardiac transplant as early. And she was come as per Madhavbaug protocol. Ayurvedic treatment was decided like Dincharya, diet, Ayurvedic medicine, exercise, yoga, and Panchakarma. Her Dincharya point was specifically important because of she was Sutika Paricharya is important. She was not follow that case, and we can say the Sutika Paricharya is not done properly by patient, that can cause cardiomyopathy, and that Ayurveda mentioned very well in our granthas. Treatment protocol, first point diet, time 9 to 11 a.m. Yes, that time was as a Pittaskal, and it, digestive enzymes is properly is there. Evening 6 to 8 p.m. Salt restricted diet, potassium rich diet, plenty of fruits. Avoid junk, fast, fermented, and heavy oily foods. Avoid potato as it is high in sodium and fats. Advice for exercise and yoga, light stretching, deep breathing, cardiorespiratory exercise, yogasan, including Bhujangasan, Pavan Muktasan, and Mandukasan. That all asans increase cardiac blood flow as a refilling of heart. Walking on plain surface and aims to for 6 minutes walk test. At first time, she is not receiving that and take more than 15 minutes, 20 minutes for 350 meters walking, and as the treatment given day by day, she was improving it. Medicine treatments, the polyherbs. Main topic is that polyherbs can correct ejection fraction. In this medicine, Arjun, which is cardiotonic, increase cardiac muscle tone and stroke value. Goxuria GT act as a vasodilator, Rasayan, cardiac and diastolic dysfunction improves. Amalki as a rejuvenating, Brahmi reduce stress. Vidarikanda and Kharik as an anabolic, which is in our Balyakalpa. In that case, Yasi is cachexic and toxic loop in Ayurveda like Bhekvarna Hatendriyam. So I use in that case Vasanta Kusumakar Rasa Aushadhi, Suvarna Sud Sekhar, and Vasanta Kusumakar. That is the antioxidant Mazdhatu protective and increase appetite, maintain pH of blood by Suvarna Sud Sekhar. As the cardiac output that function by Ayurveda under the Vyan Vayu, and Rasa Vikshepan is the main function of Vyan Vayu. We can say cardiac output is maintained by that Vyan Vayu. So Arjuna Amalki Brahmi is doing properly work. Shitopaladi Churna is the main Rasayan medicine, which include deeply and Vanshalochan that can reduce the pleural effusion, cardiac effusion. That first Echo mentioned that there is a effusion.
Sorry, sir, you have last minute. Please come to the conclusion.
Snehan Svedan and Vasti Ruddhara follow that main point is second follow is 35 ejection fraction. Second follow-up 60% ejection fraction in 1 month, and after 1 year 60% she was normal in mid-time. Discussion is that in Ayurveda, all causes of heart dysfunctional Rasa Dhatu Agni, which causes production of poor quality of Rasa Dhatu, which when goes in heart causes various cardiac disease. In this patient, default Rasa Dhatu cause heart disease with low ejection fraction in Ayurveda. Above discussed polyherbs and Panchakarma treatment can correct heart function, that is low ejection fraction. And now we can say all polyherbs are improve systolic and diastolic dysfunction discussed in Ayurveda. Thank you. Thank you, sir, for promoting me such case presentation by Mandole sir, Mahesh sir, and Chaudhary sir.
Thank you, sir. Superb presentation. Rahul sir, your views on this, please.
It's very nice presentation, Dr. Sonare. And by using just simple medicine, we can improve the condition like heart failure with reduced ejection fraction. We haven't seen so many parameters like NT-proBNP in the follow-up and other like end-diastolic volume and the rest other parameters. I think they were missing in your presentation. And I'll request you, and then next time you please come up with a more stronger evidences, because even this evidence is a very constructive and very robust, and your presentation is very nice. The only few points they are lacking, but that is there is a scope of improvement, and definitely we can come up with the best next good presentation. All the best for the future, sir.
Yes,
sir, I think we should move to the next presenter.
Yes. By the time I spotlight the next presenter, Ranjit sir, will you like to comment on this?
Yes, Dr. Sonare sir, the presentation was very good, but one thing we should come up that the long follow-up of this patient should be taken for the future. And I hope, as Dr. Rahul sir guided us with new evidences, with more evidences we will represent, we can take the long follow-up this patient again. All the best, sir. Keep it up.
Thank you, sir. And we move on to the next presenter, Dr. Anusha Sadhunavar from Vidyanagar Clinic, Hubli, and her presentation topic is role of IRP in improving global longitudinal score, GLS. So, Dr. Anusha, I am going to spotlight you now. Best wishes for your first presentation on this huge platform. You can start your screen sharing now. You have 8 minutes of time. Yes, kindly start with the PowerPoint presentation, slideshow.
Good afternoon all. I am Dr. Anusha Sadhunavar, Madhavbaug, Vidyanagar, Hubli. Today I am going to present the topic, the role of Ischemia reversal program treatment in improving the global longitudinal strain.
You need to start the presentation mode on, ma'am. See the slideshow tab next to animations. On the top, there is an animations tab. Next to it is slideshow. Yes, click that. Yeah, and from beginning, the first one. Yeah. Perfect. Now move on.
I'm going to present the topic, the role of Ischemia reversal program in improving the global longitudinal strain. Cardiovascular disease remains the leading cause of the diseases. Ischemic heart disease is defined as when metabolic oxygen demand of the heart muscles are not met due to insufficient oxygen delivery. That is, when there is a mismatch between demand and the supply. Recent studies suggested that GLS might be helpful for prediction of the cardiovascular outcomes in a general population. GLS has emerged as a new method for assessing the ventricular functioning, and GLS is a more sensitive test when compared to 2D echo. Contents, research question, case details, diagnosis, treatment, and the discussion. Research question. Does IRP Panchakarma help the patient for improving the global longitudinal strain and improving the patient's day-to-day activity? Case details. Patient medical history, age 72 years, Gender male. He was a known case of ischemic heart disease, coronary artery disease, type 2 diabetes, hypertension, and dyslipidemia. Location Hubli. And his present history was he was a known case of ischemic heart disease and coronary artery disease since past 1 year and type 2 diabetes since past 10 years. And he was suffering from hypertension since last 6 years. Assessment and investigations done. Patient visited the clinic with report of CT angiography plane and 2D echo lipid profile. As cardiologist suggested him to go for CABG. As his creatine levels were little on higher side and due to age factor, patient was not willing to go for a surgical. He wanted a non-surgical treatment. So they visited the Madhavbaug clinic. Investigation suggested by our Madhavbaug team are GLS, HbA1c, 6-minute walk test, and a lipid profile test. Diagnosis: ischemic heart disease with type 2 diabetes and hypertension. Patient present complaints were he was having chest pain, generalized weakness, constipation, and patient was not so active. And he was on allopathic medicine, tablet losartan, icabod, ecosprin, and glycifil. Patient vitals detail. Day 1, he was weighing 60.7 kg, BMI was 20.8, random blood sugar was 220, and HbA1c was 9.7. And this was a challenging case to us as his BMI was low. We need to reduce his HbA1c without reducing his weight and maintaining the BMI. And his GLS score was on day 1 -17 and ejection fraction was 52%. And 6-minute walk test, he covered 300 meters. And lipid profile was D range. The latest vitals were his GLS score improved from -17 to -20 and ejection fraction improved from 52% to 62%. And HbA1c reduced from 9.7 to 6.5%. A relationship between diabetes mellitus and ischemic heart disease. Long-term hyperglycemia leads to vascular damage. Treatment. Panchakarma therapy. It includes centripetal ovulation, thermal vasodilation, and per-rectal drug administration. Snehan was done with Abhyanga oil for 30 minutes and Swedan with Dashmula Kada for 15 minutes and Basti per-rectal drug administration with GHA Kada. Oral medications were given, polyherbal preparation, decoction of Arjuna, Punarnava, and Vacha. Dose 20 ml twice a day after meals with equal quantity of water. Polyherbal tablet which contains Arjuna, Gudmar, Nimba, Rasona, and Karavellaka. Tablet, 1 tablet twice a day after meals, and a polyherbal tablet which contains Amalaki, Haridra, and Meshashungi. And we advised him a portion control diet, 800 calorie diet, which was rich in fiber and protein and low carb diet. And daily exercise like 30 minutes walk and muscle strengthening exercise were advised. Discussion. The role of Arjuna bark helped in strengthening the heart and myocardium, and it significantly lowers the cholesterol by its coenzyme Q10 inhibitor property. The role of Vacha. It dilates the blood vessel and increases the coronary flow and reduces the load on heart. And the role of Panchakarma played a very important role in improving the GLS score. A centripetal ovulation helps to improve the venous drainage towards the heart, and thermal vasodilation helps to dilate the blood vessel, and per-rectal drug administration help to improve the myocardial contractility. Here we can see the GLS score improvement. Before treatment, we can see here, it was before treatment, and after 3 months of treatment, GLS score has been improved from -17 to -20. And his ejection fraction improved from 52% to 62%. And special thanks to Dr. Nilesh for his constant support. Thank you. Thank you all.
Thank you, Dr. Anusha. I will take this as an opportunity and request Dr. Nilesh to have 2 words regarding Dr. Anusha, as she has newly joined in Madhavbaug. And Nilesh sir, with your support, definitely she'll be doing wonders in Madhavbaug clinic. I am adding a spotlight to you. Nilesh sir.
Yes, Omkar sir, really a great thing to share here is Dr. Anusha is one of the most youngest doctor. With her age and also Madhavbaug's experience, still she handled this case very well because this was a quite challenging case. Patient was having many allopathy medicines, his HbA1c was deranged, and patient also had concerns regarding monitoring his cardiac issues. So, Dr. Anusha, really congratulations the way you have treated the patient. Keep going. Best of luck.
Thank you.
Yes, Rahul sir, your comments on this, please.
Yes, truly young guns of Madhavbaug, young guns of Ayurveda, they are firing very clean and clear. And you took a very delicate and interesting topic, GLS, diabetes and ischemic heart disease, and you presented it very well. And keep it up. I'm expecting more presentation from you in the next symposium.
Sure. Thank you, sir. Thank you.
Sir, your comments? Unmute.
Yes. Yeah. Congratulations, Dr. Anusha ma'am. Very rapidly, very fastly, you are accepting the new challenges and the new techniques, and the overall presentation was too good. Congratulations and all the best.
Thank you.
Thank you. And now we are moving to our next presenter, Dr. Shabrani from Kaulkhed Chowk, Akola, and her presentation topic is role of Panchakarma in improvement of NLR ratio in CAD patients. One more unique topic, Dr. Asha Shabrani. I'm going to spotlight you, ma'am. You have 8 minutes of time. Best wishes. So you need to share your screen on presentation mode. Requesting all doctors to kindly share your screen on presentation modes. Otherwise, Rahul sir and I will be having nightmares about sharing screen. So kindly help us out. We'll save some time over here. Yes, Rahul sir.
Role of Panchakarma. Good afternoon, all dignitaries. My topic of presentation is role of Panchakarma in reduction vascular inflammation in known case of CAD with IHD.
Dr. Asha, I think you have to enable editing first. Then you need go to the presentation mode and start the presentation.
Yes, presently your thank you slide has been displayed, ma'am.
Okay. Clearly visible, sir?
Nothing.
Thank you is clearly visible.
Okay, at my end it's showing first slide.
So stop sharing.
Stop sharing and then
Okay, sir.
So Rahul sir, best wishes.
Is it visible, sir?
Perfect, ma'am. Thanks a lot. Yes,
thank you, sir.
Please continue.
Myself, Dr. Asha Shabrani. I am clinic head at Kaulkhed Chowk, Akola. My topic of presentation is role of Panchakarma in reduction vascular inflammation in known cases of CAD with IHD with vascular inflammatory marker neutrophil lymphocyte ratio. Nowadays, we are seeing many patients are having the CAD in almost diabetic patients. That is in non-diabetic patient, there are 11% chances of CAD, and in the diabetic patient, there are 21% chances of developing CAD. Here I have selected the 3 case studies. So is my slides are changing or not? Because
No,
at my end,
they are not
still on the first slide.
Is it, sir?
Can we stop sharing and share again, ma'am? I think there is some technical issue.
Yes, sir. Maybe.
We still have 13 presenters left with their fantastic case studies. Every case is a unique case and a lot of things to be learned in each and every case.
Yes, sure.
Yes, Dr. Asha.
So I am finding it difficult to move on the slides.
Okay.
Maybe there are some technical issues in.
Rahul sir, if you have a presentation with you, you can share the screen too.
Yes. Dr. Asha, please stop sharing.
Okay, sir. Now it's moving. Sir, now it's moving.
Okay.
Okay, go on.
Nowadays, we are seeing there are many CAD patients. Almost 21.4% diabetics are falling and are diagnosing as CAD nowadays. That's why neutrophil lymphocyte count ratio is independently associated with CAD marker. And I have studied for that with the help of Panchakarma, how can we reduce the NLR ratio? Next, sir. My treatment in this case, I have selected the 3 cases and I have given the Panchakarma therapy, that is Snehan, Swedan and Basti. In the Snehan, we have used the til simply sesame oil for massage in the centripetal directions for 20 minutes, followed by the Swedana, that is steaming with the Dashmul extract, and followed by the Basti, and that is 100 ml decoction of Tribulus tertiaris and Curcuma longa and Phyllanthus umbilica. Next, sir. Total 7 settings of Panchakarma were given to all the 3 cases within a span of 1 month. Here the results are: in the case 1, weight was 59.4 in which get reduced to the 57. Along with the Panchakarma, I have also given them portion control, low carb and a high fiber, high antioxidant diet in these cases. And the BP is also reduced from 122 by 77 to 118 by 67. Heart rate reduced from 93 to 71. Also the cholesterol levels get changes, and NLR ratio get reduced from 7 to 2. NLR ratio get also improved. Sir, little bit slide. In case 2, also the weight get reduced and BP is also get improved. Here the HbA1c shows drastic change, 7.1, it get reduced to 6.15, and NLR ratio get improved from 4.16 to 1.6. Next, sir. In the case 3, NLR ratio was 2.9 and it get reduced within a span of 30 days. It get reduced to 2.2. Also, along with the NLR ratio, dyslipidemia get improved in this case too. So with the help of Panchakarma, averagely the NLR ratio was 4.68 in all the 3 cases, which get reduced to 2.0. So it suggests the vascular inflammation get reduced, and also the dyslipidemia get improved, and the risk of CAD and ischemia were reduced in these 3 patients. In this case, in these cases, I got the significant improvement in NLR ratio with Ayurvedic treatment. The coronary artery disease, as we all know, caused by the atherosclerosis, that is because of deposition of plaques in the coronary vessels, which attracts the white blood cells at the atherosclerosis sites, which results into more inflammation. With the help of Panchakarma, we reduce the inflammations. Because Snehana helps in improving the vascular tone, and Swedana helps for the vascular dilatation at microvasculatures also and macrovessels, and hence reduces the systemic vascular resistance. In this, the Basti we have used of the 3 drugs. These 3 drugs, that is Tribulus tertiaris, act as a nitro oxide mediated vasodilatory effect. Curcuma longa act as anti-inflammatory, and the 3rd drug act as in reducing the oxidative stress, that is Phyllanthus umbilica, which all these 3 combination helps me for regression in the plaques. Second, sir. Next, sir.
Close.
Thank you, sir.
Thank you, Dr. Asha. What was the conclusion of this case?
Conclusion is that, sir, nowadays we are doing variety of the tests regarding the CAD cases, and NLR is also a significant marker for knowing diagnosing the CAD cases and knowing the prognosis of that cases.
Fantastic. Rahul sir, your comments on this?
Fantastic, Dr. Asha. Vascular inflammation is a very significant problem. Because of that, patients are suffering from a dyslipidemia, and then later on they'll land up into the coronary artery disease. So if you want to assess whether your patient is on a reversal mode or a progression mode, the NLR is a good predictor who can indicate whether the patient whether the CAD is progressive or you have started the progression. NLR is a neutrophil to lymphocyte ratio. Neutrophil, we all know, it's a kind of a WBC which indicate there is some kind of a new pathogenesis or new infiltration. It is indicating. So if neutrophil is increasing, and as compared to lymphocyte, it is showing a neoplaque genesis. So NLR is a very what we can sensitive marker, and superbly explained clinically, Dr. Asha Chavrani. Few things the duration of treatment, somewhere it was written 30 days, somewhere it was written 90 days. So there was some discrepancy in your presentation while you were presenting. So I think those points have to be avoided in the future. Rest, your presentation was superb, and your clinical knowledge and practice, keep it up.
Thank you.
All the best.
Yes, Ranjit sir.
Yes, super presentation, Dr. Asha ma'am. It was fantastic thing that you have observed the NLR ratio, because many new researchers has given the outcome that NLR is the predictive factor for the CAD disease. So you have observed this, and one suggestion for you, I think you have also observed some other parameters like lipid profile and VO2 max, and if they are also presented here in this case, so it would better. So
Yes, sir. I have observed, sir. I have observed the 2D echo with stress test, 2D echo with GLS study, and along with that, stress test is also done, all the 3 cases, and all the 3 cases are improved on that parameters also. But due to time limitations, I have not presented that, because I want to get focused on NLR ratio. And as the Sandeep sir is asking a question about internal internal and external environment, I want to answer that that's many factors are affecting NLR ratios, but NLR ratio, as the Rahul sir just explained, that neutrophil count increases when there is a plaque formation inside the blood vessels. Hence, NLR ratio is very important to check. That's why I have checked it along with the Panchakarma, how Panchakarma helped in all that cases.
Super, that's great. All the best.
Thank you.
In absence of an external pathology, NLR is a very good predictive of a progressive coronary artery disease or the regressive coronary artery disease, and very cheap also. We can get the NLR done in 100 rupees. While if you ask patient to go for the lipid profile, it will charge them like 700, 800 rupees. And so patient will not give you resistance to go and get it done, NLR. And it will be like, it will give you the unique idea, the ideal कि patient का progression हो रहा है, नहीं हो रहा है, lipid उसका कम होने वाला है या नहीं होने वाला है. This idea can be given by the NLR ratio. So a very important tool. I think that each and every clinician should use in their clinical practice, neutrophil to lymphocyte ratio. Okay, so I think Dr. Omkar, without wasting any time, we should move to
our next presenter. Thank you, Dr. Asha Chavrani. And now we are moving on to our next presenter, Dr. Shailendra Kushwaha from Amravati Rukmini Nagar Clinic. And his topic of presentation today is efficacy of IRP treatment on ischemic heart disease patients with Duke's treadmill score, DTS.
What I'll request now, we are discussing all these interventions since last 4 days. So most of our doctors and most of our participants, they are aware about the intervention part. So without wasting your time in the repetition of the same intervention methodology and all, if you come to directly your point, what point you want to make, what in the thought you have in your presentation, so that will save your time as well as that will save the repetition, so others time also. So Dr. Kushwaha, all the best for your presentation.
Thank you, sir.
Yes, sir, you have 8 minutes of time, and kindly share the screen on presentation mode. If you can change your background, I think that's overlapping on your face. Yes, so there's a share screen button at the bottom. Kindly click that and please share your screen. So if you're facing any technical issues, please let us know.
Yes. Am I audible?
I think somehow
Yes,
Dr.
presentation is seen, but it should be on the
has successfully reached.
Yes, it should be on the presentation mode now.
Go to the slideshow, Dr. Kushwa. Go, yes, even that can be helpful.
Is it okay, sir?
Press the icon just beside the 60%. And unfortunately, I don't have your presentation with me, so it's difficult for me to share your presentation.
Yes, it's visible, sir. You can start with the presentation. It's fine.
Hello. Good evening, everyone. Hello.
Yes, sir, you're audible. You need to be a bit loud.
Yes, sir. Good evening, everyone. Today's my topic is role of Ayurveda-based ischemic reversal therapy on ischemia heart disease patients with in correlations with deep treadmill score. Introduction. Despite of the availability of the plethora of the options of the treatment of ISD, it is still amongst the leading contributor to global morbidity and mortality rates. Deep treadmill score is used to diagnostic and prognostic investigation in risk of ISD patients. This study was conducted to evaluate the role of Ayurveda-based IRP treatment on deep treadmill score in ISD patients. Purpose: we study the efficacy of IRP treatment in ischemic heart disease. We study the ischemia reversal program on deep score, and to study the effect of ischemia reversal treatment on time of ischemia. Methods in this, I have selected 17 ISD patients were selected from Madhavbaug OPD, irrespective of age, sex, and religion. In this therapy, therapy was used ischemia reversal therapy, which contains centripetal oleation, thermal visualization for rectal drug administration. And in Basti, we have used Gokshu, Harida, and Amalji as the for rectal drug administration. In this inclusion was symptomatic patients aged from 45 to 65 years with ISD of either gender. Exclusion was patient with history of recent MI, uncontrolled hypertension, severe hepatic or renal insufficiency, pregnancy, and lactating mother. In this procedure, this medicine was used. Objective parameters which I have recorded or which I have observed is due score, time of ischemia, blood pressures before and after BMI, and medicine dependency. These are the parameters which I have recorded of 17 patients, which we will see further. And what is the deep treadmill score? It is a weighted index using treadmill exercise time performed according to standard boost protocol, maximum net ST depression deviation, and exercise-induced angina. It was developed to provide diagnostic and prognostic information to help evaluate patients with suspected coronary heart disease. Duke Retinopathy score is calculated by maximum access time in minutes minus 5 into XT segment deviation in mm minus 4 into angina index, where 0 is equals to no angina, 1 is non-limiting angina, and 2 is excessive limiting angina. This is the Duke treadmill score level and list. Greater or equal to +5, patient is on the low list, and survival rate at 4 years is 99%. +4 to -10, moderate risk, and survival rate at 4 years is 95. Less than -10, and the patient is in the high risk. Survival rate at 4 years is 79%.
सर शैलेंद्र सर आपकी स्लाइड चेंज नहीं हो रही है, प्लीज एक बार स्लाइड के ऊपर या नीचे से आपका स्लाइड शुरू करनी है, डायरेक्टली अभी आप कंक्लूजन पे भी आ जाएंगे तो भी चलेगा। जो आप अभी रिजल्ट्स बता रहे थे उस वाली स्लाइड पे आके
My PC is changing.
जस्ट चलेगा, यू कंटिन्यू, बस नेक्स्ट स्लाइड आप अपनी तरफ से कर दीजिएगा।
These are the effects of time of ischemia. Initially, patient on day 1, the time of ischemia was 257 seconds. And after the completion after 90 days, the time of ischemia was increased to 587 seconds. Effect on Duke treadmill score. Initially, the average of patient Duke treadmill score was -5.11. And after the completion of 90 days, it has raised up to 6.41.
So please click on the next slide, मतलब वो जहाँ आपने 11 पे क्लिक किया हुआ है वहाँ पे 12 पे 13 पे आपको क्लिक करना पड़ेगा क्योंकि आपका वो स्लाइड शो मोड पे नहीं गया अभी।
Sir, what I'll request you, go to the conclusion slide because you have already consumed 8 minutes of your presentation.
Out of the 1700 patients, mostly 10 males, there was significant improvement in Duke treadmill score by 11.52. Also, there was significant reduction in BMI by 1.4. Systolic blood pressure and diastolic blood pressure also get reducing significantly. Discussions, medicines, Arjun is same repeated Konarama.
Okay.
Results after 90 days. TOI was increased by 5.5 minutes. And Duke treadmill score was improved by 11.52 minutes. Systolic BP reduced by 21.1. Diastolic BP reduced by 7.1. Acid depletion was reduced by -0.59. So angina index was also reduced. And the Ayurvedic ischemia reversal program is effective in improving Duke treadmill score as well as blood pressure in ISD patients. Thank you.
Thank you, sir, for this fantastic presentation. Rahul, sir, your comments on this, please.
Yes, superb presentation, Dr. Shailendra Pushpa, sir. Technically, we need to improvise the presentation, and as we are going ahead, we have to adapt the presentation skills as well. But your case was clinically, it is very superb the way you have improved the patient's time to onset of ischemia, because you noted the time to onset of ischemia. It's a very rare thing any physicians is noting. Duke treadmill score you have improved. That means you have prevented your patient from getting into the acute coronary syndrome. You saved his life. You prevent his life. So congratulations and all the best.
Yes, I move on to the next presenter now, Dr. Vrushali Rajgure from Amravati Rukmini Nagar. And our topic of presentation is role of Ayurveda-based heart failure reversal therapy on 2D echo and VO2 max in chronic heart failure and observational cohort study. Dr. Vrushali.
I request the presenters from the Gujarat and Karnataka and Madhya Pradesh region to hold their breath and keep themselves motivated, because I know it's I think almost 12 presentations now, Dr. Omkar, ab tak hua hai. Yes, and it's a very long.
This is the 15th presentation.
Sorry?
This is the 15th presentation.
15th presentation. So I know, okay, pad up hoke baithna pavilion mein ताकि अगला बैट्समैन आउट हो जाए तो मैं जाके मुझे बैटिंग करनी
Yes,
है.
yes, yes.
So it's the most frustrating thing, and I can see from your faces, doctors, and please keep yourself motivated and wait for your opportunity. And we are here. यहाँ पे रात को 10 भी बज गए तो we are going to listen to your case study with our all energy. So don't worry at all.
डोंट वरी, एंड का बटन मैं ही दबाने वाला हूँ, तो जब तक सभी के नहीं हो जाते आई एम हियर, डोंट वरी एट ऑल. राहुल सर और मैं रहेंगे आपके साथ में. यस डॉक्टर रुशाली, यू कैन प्लीज स्टार्ट योर स्क्रीन शेयरिंग नाउ. रुशाली मैडम,
Am I audible, sir?
yes, yes, perfectly. Rahul sir, if you have your presentations, if you can screen share, that will work too. Thank you, Anandi madam. Thanks a lot. It will be good if you keep the presentation mode on. Click the slideshow button. Yeah, next to animations. Next to animation, there's a slideshow tab.
Yes, I got.
Yes, slideshow. Yeah, and now click from beginning, the first one, first option.
Sir, myself Dr. Rushali Rasure from Amravati Rukmini Nagar Clinic. Today's my topic is role of Ayurveda-based heart failure reversal therapy program on CDE code and VO2 max in chronic heart failure, an observational cohort study. Introduction: it has been estimated that around 4.6 million people are affected by CHF worldwide. It is projected that by 2030, the number of heart failure patients would be rise by 25%. The patients with heart failure have shown reduced functional capacity, which is turn affect quality of life. VO2 peak is maximum aerobic capacity and independent of predictor of mortality. It is
Ma'am, presentation mode on kara.
Wait, I'll be sharing the presentation.
Yes, sir. Better.
presentation mode on.
No, your screen showing a single slide. Yes, Rahul sir, thanks a lot. We can save time over here. No worries, ma'am. Yes, ma'am. Now you can start. Your presentation mode is on. Best wishes.
This study was conducted to observe the impact of Ayurveda-based heart failure reversal treatment with 2D echocardiography and maximum aerobic capacity, that is VO2 max, on patients with the heart failure with reduced ejection fraction. Materials and method. Selections of patients. 20 CHF patients were selected from OPD of Madhavbaug, Amravati Rukmini Nagar Clinic, irrespective of age, sex, and religion, from periods of April 2018 to December 2021. Selection therapy: Madhavbaug's HFRT therapy containing Snehan, Svedan, and Basti was chosen. Selection of drug: Basti of Arjuna and Punarnava 100 ml per rectal drug administration, Hridayadara and Dashanulkara. Duration and methods. So next slide. Objective parameters. Variables like 2D echo, VO2 peak, systolic, diastolic pressure, BMI are first day and 90 days of the are observed. Observations are as follows. Next slide. VO2 max before was 14.9% and after 90 days treatment it was 30.5%.
BMI average be 26.42 and after 90 days it becomes 23.83. Effect on blood pressure, systolic blood pressure decreases from 135 to 117.5 and diastolic blood pressure 2D echo. 2D echo improvement seen as 36.9 to 52%. Baseline tapering, drug tapering are observed as follows in 90 days. All medicines are tapered in 19 days. Likewise. Next. Results. Out of 20 enrolled patients, mostly male, 15 were considered for data analysis. There was significant improvement in 2D echo by 12.20% and VO2 max by 15.6 ml per kg per minute to 30.5 to 62 plus after 19 days therapy as compared to baseline. Their discussion: Ayurveda-based HFRT treatment reduces without heart rate and thus reduces workload. Drug used in treatment increases contractility of heart muscles and blood coming out of the left ventricle increases. Also, treatment helps in reducing weight and sympathetic activities, which collectively decreases overload of heart and thus increases efficacy of work of heart. Conclusion: Ayurveda-based HFRT program was very much effective in management of heart failure with resolved EF patient. Thank you.
Fantastic presentation, ma'am. Ranjit sir, your comments on this, please.
Awesome session, but I want to know here that in this 2D echo outcome, what was the interval?
एक्चुअली प्रेजेंटेशन स्लाइड्स में कुछ चेंजेस किए थे बहुत सारे जो राहुल सर ने बताए थे, लेकिन राहुल सर के पास पुरानी पीपीटी अवेलेबल थी, अभी जो चेंजेस थे वो अवेलेबल
whatever, but Rushali ma'am, I really hats off because I know you since last 7-8 years and you are consistently participating on all the research conferences, and today you presented this your as a cohort study. I saw the statistic analysis as well, and very pleasant feeling aati hai jab I see the statistical analysis, and especially if someone from a clinic is doing the statistical analysis since the morning. Dr. Rupali, Dr. Sarvere sir, when you people are presenting the cohort and that cohort is suggesting the improvement in the LVEF, improvement in the VO2 max, we all know VO2 peak 1 ml improvement in the VO2 max can reduce down the risk of mortality by 15%, and here you have significantly improved all the parameters. So hats off to you, your clinical effort as well as your now newly adapted research skills also. And over to Dr. Omkar sir. I think we should move to the next presenters.
Yes, so hereby we have finished Vidarbha region. All the presenters of Vidarbha region have presented their topics, and now we move on to MP region. The first doctor is Dr. Vijay Kumar Sharma sir from Dwarka, New Delhi, and his topic of presentation is effect of CDC treatment in insulin-dependent teenager. Dr. Vijay sir, I am going to spotlight you. Best wishes, sir. Kindly share your screen on presentation mode. Sir, the first slide, please.
Good evening, everyone.
Sir, this is the last slide.
Vijay. Okay. Good evening, everyone. Myself, Dr. Vijay Sharma, working as a preventive cardiologist in Madhavbaug, Delhi, branch since last 3 years. Today, I am presenting a single case study, and my topic is effect of diabetes, effect of comprehensive diabetic care treatment in insulin-dependent teenagers. Contents of my topic is research questions, case detail, diagnostic, treatment, discussion, and conclusion. Objective is to identify that the diabetic patient below 20 years of age is always type 1 or can be type 2. And other objective is to identify that insulin-dependent teenager can live medicine-free life or not. Patient medical case history: a 17-year school-going male patient from Hanumangarh, Rajasthan. History of weight loss, polyuria, polydipsia, weakness. Come to me in December 21 as a known case of insulin-dependent diabetic patient since September 21. And he was taking insulin 14 units short-acting and 4 units long-acting. His previous report, which was done on November 2021, HbA1c was 12.9, ketone and sugar 3+ in urine, KFT was in normal limit. For confirmation of diagnosis, whether patient is type 1 or type 2, him to check C-peptide, serum insulin and urine after stopping insulin for 24 hours. His C-peptide level was found 1.46, serum insulin 4.03, and HbA1c was 11.2. After confirmation that patient is a case of type 2 diabetes, I started the treatment with oral medicines, diet, balanced diet, Panchakarma, and strength training exercise. In oral medicines, we use Gurchi, Meshrangi, Banawa, Haridra, Amlaki, and Ashwagandha. In diet, we advise Madhavbaug atta is a barley flour which has a low glycemic index. We advise him for 100 grams per day, and sunrise breakfast kit which have a pre-packed calorie restricted low carbohydrate, more protein and high breakfast options. In Panchakarma, we have done Snehan with neem oil, Swedan with Dasmul Kada, and Vasti with decoction of Gudmar Daru Ishtimadu. And we advise him for strength training exercise. During treatment, we have achieved milestone as follows. We started treatment in December 21. In January 22, total insulin stopped with the absence of ketone and sugar. HbA1c was 9.7. In February 22, HbA1c was 7.9. In March 22, HbA1c was 6.9. In April 22, HbA1c came down to 6.5. Fasting blood sugar below 110 and PP is below 140. Then we plan for GTT, and on 7th of May, GTT was conducted and found GTT negative. In GTT, fasting blood sugar was 86, and after intake of 75 gram glucose, PP was 102 mg per dl. Discussion of my study: the proper diagnosis and investigation is important while goal setting. Keen observation with regular monitoring along with Panchakarma, regular oral medication, balanced diet, and exercise is very important. Regular follow-up and motivation to patient create miracles. Believe in treatment and positive mindset of patient help in reversal of disease. Result of my study: insulin completely stopped, HbA1c 12.5 to 6.5 in 4 months, GTT negative, patient have no complaint and feel more energetic. Conclusions: diabetic in teenager with low BMI can be reversed with comprehensive diabetic care treatment and maintain healthy life without insulin and other OHA. Another conclusion of my study is that a diabetic patient which is below 20 years of age can be type 2 diabetes. Thank you.
Thank you so much, sir, for this unique presentation. Ranjit sir, your comments on this, please.
Yes, super presentation, Dr. Vijay sir. This was really a fantastic case. You have given a new vision that yes, many times when the patient come across to us and that age is below 30, we confuse that it may be type 1 or as this in this case the boy was insulin dependent. But you have given the new vision that yes, by a perfect diagnosis with clinical skills and perfect handling, by identification that type 2 we can reverse it. So super presentation, sir. That's fantastic. All the best.
Thank you. Thank you so much.
Yes, Rahul sir, your views, please.
Fantastic presentation, sir. I have just a query: how you are taking this patient the further management?
Sir, for guiding आगे आने वाला समय जो भी होगा उसको अच्छे से जो हमने इसको ट्रेंड किया है फॉर डाइट, फॉर एक्सरसाइज और जो भी लाइफ स्टाइल रहने वाली है, उसको अच्छे से गाइड किया है। और उस अच्छे से गाइड जो वो कर रहा है, सबसे अच्छी बात सर इस केस में मुझे ये लगा कि 16 ईयर की एज में और 17 ईयर की एज में जो बच्चा जितना सेल्फ मोटिवेटिंग था और जितना एंथुजियास्टिक था, कभी भी मुझे उसको पुश आउट करने की जरूरत नहीं पड़ी। और जो उनके पेरेंट्स से जो मुझे सपोर्ट मिला, उन्होंने कहा कि सर जो भी होगा आज की कंडीशन से तो खराब नहीं होगा, इसलिए आप विदाउट किसी भी प्रेशर के अपना सारा काम कीजिए, मुझे आपसे कोई शिकायत नहीं होगा। और इससे मुझे सब कुछ अपना करने में बहुत हेल्प मिली। तो क्योंकि उनके पेरेंट्स की और उसके खुद के पेशेंट की उसने सारा कुछ ट्रेन कर लिया है, ठीक है, तो वो उतना करते करते भी विदाउट इंसुलिन या विदाउट मेडिसिन रह सकता है।
Absolutely right. You said कि patient self motivated हो तो it's very easy to manage him, but 16 years of age and whether अभी जो type 2 diabetes था, maybe see diabetes 16 अगर young age में it is starting, तो definitely वहाँ पे cytokine storm जो पहले था that must be subside after your treatment, that we have not noted. If you could have gone through the other investigation like antibodies, whether there is the previous antibodies and now there change reduction in the antibodies for type 1 diabetes, so definitely we could have seen that the picture could be different. But यहाँ पे अभी जो cytokine storm रुक गया है, maybe because of your anti-inflammatory treatment and all this, that the possibility will be remain there only कि this patient might be very susceptible for such kind of a antibody attack again and again. Normally this is how type 2 यानी पेशेंट टाइप 1 डायबिटिक में कैसे जाता है यंग एज में, तो रिपीटेड जो अटैक्स होते हैं एंटीबॉडी अटैक, जिसकी वजह से बीटा सेल डिस्ट्रॉय होते 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 ही स्लोली ग्रेजुअली लैंड्स अप इनटू द टाइप 1 डायबिटीज. So we have to make sure कि patient repeatedly every 3 months if he is doing his HbA1c, if he is continuing with his lifestyle as you have said, so definitely we can prolong the state of getting him into the type 1 diabetes as led. तो वो हम लोग prevent कर सकते हैं, but for that वो patient का continuous follow up रखना is going to be a huge task, and you are capable of doing that. You already did that in the past and definitely you will do this in the future also. So congratulations and all the best, Dr.
Thank you. Thank you so much, sir.
Thank you so much, Vijay Sharma, sir, for this unique case. And now we'll move on to our next presenter, Dr. Arunima Yadav from Vijayanagar, Jabalpur. And the topic of presentation is clinical improvement in patient of chronic LVF, CKD, CAD, post-angioplasty, STN and DM. So that's a good case to discuss, and I am going to spotlight Dr. Arunima Yadav, madam. Ma'am, you can now share your screen. Yes, ma'am. You have 8 minutes of time. Best wishes.
Good evening, everyone.
Good evening, ma'am.
Good evening, everyone. Am I audible?
Yes,
yes, very audible.
My case is clinical improvement in patient of. Sir, please note करिएगा. Topic मैंने revise किया है. Clinical improvement in patient of chronic heart failure with chronic kidney disease with diabetes mellitus type 2 by Panchakarma therapy. My objective was whether Panchakarma therapy, including centripetal oleation, thermal vasodilation, and thoracic rip with parectal drug administration, can improve a patient of chronic heart failure with CKD with DM. The medical history of patient was, she was a 67-year-old female. She had diabetes, type 2 diabetes since 2012. Also diagnosed with single vessel disease, that is plaque on LED. 90%. She underwent angiography with angioplasty on 2014. After that, she hospitalized for severe acute LVF on 2017, where she improved mildly, followed by chronic heart failure. Since 2021, she is also complaining of CKD with raised serum creatinine. I want to bring in notice, since 2020, she had several episodes of hospitalization. Why? That is, I'm answering in next slide. When patient came to me, she had all the symptoms which belongs to NYHA grade 4 with episodes of, please listen these symptoms very carefully, because nobody notices these symptoms in outside Madhavbaug world. These are episodes of bloating in abdomen, frequent episodes of diarrhea and constipation with anorexia, which was also causing blood sugar fluctuation, severe fatigue, which was making patient very uncomfortable for day-to-day life. We investigated her in various parameters like CBC, RFT, LFT, etc. She came with me the diet. Already, I was knowing that she is having chronic heart failure, CKD, and DM type 2, but it wasn't the only diagnosis. There was something else remaining, which was undiagnosed by the other world, or I can say main treatment world, that is cardiointestinal syndrome, which was making patient very sick and very liable toward mortality. As my treatment sutra was Agnideepan Trashna Nigrahan, followed by Virechan. I also gave her Balyahar. Panchakarma therapy was HFRT. Oral liquids was Lekhya and Mutral. Diet which I prescribed was renal diet with low carbohydrate intake with Deepan Pachan Dravya. Course of treatment was Panchakarma HFRT therapies done for 3 months in 3 days interval. We were very important was monitoring. We were monitoring her blood sugar level. We managed her insulin also, which made her hospitalization almost finished, which finished her hospitalization. HbA1c, RFT, serum electrolyte were also very important to be noted on monthly basis. Clinical improvement, as you can see, patient reached to NYHA grade 1 from NYHA grade 4. Her HbA1c also reduced, blood sugar came into range, serum creatinine reduced. After I started treatment till nowadays, she doesn't underwent any hospitalization. She had very fatigue, very much fatigue, but now she can do her activities normally. Now, this is which I want to bring to focus. That is, how did it happen? As I all know, the venous system of our body contains up to 70% of blood volume, and the compliance of splanchnic vein is much higher than peripheral venous system. Splanchnic veins means veins which are draining blood from spleen, stomach, and pancreas head. So these veins have much higher than peripheral venous system, hence act as relatively greater reservoir. Splanchnic vein has large number of alpha-1 and alpha-2 receptors, so they are very responsive to sympathetic nervous system. As in CHF, there is amplified sympathetic nervous activation, which leads to decrease in capacitance of splanchnic vein, therefore increased effective circulatory volume, which increases preload of heart and with same body volume, because all diuretics he was taking. And this exaggerates hemodynamic effect of sodium and water retention. Also, hypoperfusion of gut is there because of CHF, which increases gut permeability, alters the immunological barriers, and play important role in chronic heart failure. So our therapy, that is centripetal oleation, improved venous return to a heart, that all we know, normalizes sympathetic activation. This activation normalization creates increased splanchnic reservoir and decreases preload of heart. That is very important. And it also reduces peripheral resistance. That means it decreases congestion of heart. Thermal vasodilatation, we all know it dilates blood vessel, so reduce the load of heart. And obviously, because of sweating, there is excretion of salt and water, which reduces water retention.
Last
Thoracic
2
drift
minutes, please.
strengthen. Okay, sir. Thoracic drift strengthen chest muscle by improving blood supply, and Basti Chikitsa helps in giving medicine in bolus form, which improves contractility of heart and reduces oxidative stress. Combined effect of therapy, which is also very important, it corrected hypoperfusion of abdominal viscera. Conclusion: Panchakarma therapy, that is centripetal oleation, thermal vasodilatation, thoracic drift, Vasti, is effective in clinical improvement of chronic heart failure patient with CKD, with GM patient, and also that patient is having cardiointestinal syndrome. These are my references, and that's all from my side. Thank you.
Thank you, ma'am. A new way of explaining things, a new term which all of us have learned today. Rahul sir, your views on this, please.
Sir, today's.
Yes.
Dr. Omkar, my today's takeaway is that I learned something from this symposium. And thank you, Dr. Arunima ma'am, that very knowledgeable session, I would rather say. We all are doing the same thing. I think many of doctors are doing the same kind of treatment to their patient, and they are getting results, but they don't know why they are getting the result. But you explained very well that the way why we are getting the result and what are the dynamics behind the results of Madhavbaug. And hats off to you. Very nice presentation, superb, and keep it up, ma'am.
Thank
yes,
you.
Ranjit sir, your views on this, please.
Yes, Dr. Arunima ma'am, very nice presentation. Many times it happens when we are working, but we do not know that what's happening inside. That the similar thing is happen here. You have given the new insights for that. So this is such a new thing, and this is the good quality of a researcher. जो कहते हैं ना, एक researchers की best qualities में से एक ये कि उसको नए angle से देखना. So it was something different. So that's fantastic.
But Dr. Ranjit sir, मैं कहूँगा यहाँ पे कि more than a researcher ना, I think I discussed this case with Dr. Arunima ma'am, and she rightly said, sir, don't look at any other parameter, just look at how her quality of life has changed.
Exactly.
And that parameter actually can impress anyone, because if you ask me which is the best treatment for heart failure, I'll ask you कि जो treatment hospitalized ना होने दे patient को. And if this treatment is helping the patient to reduce down the hospitalization need, so nothing like it. And this is the quality of a very good clinician. So researcher तो सिर्फ parameter देखेंगे, but the research clinician जो है ना, the clinician, they will look beyond the parameter. They may not be able to explain what parameter, but they may look beyond the parameter, and they will improve the patient, and they will reduce the mortality and hospitalization.
Thank you very much, sir.
Thank you, Dr. Arunima Yadav ma'am. It was a fantastic presentation with some new insights. And now we move on to our next presenter, Dr. Surbhi Sharma. Dr. Surbhi Sharma, I'm going to spotlight you now, and be prepared as I introduce you. In front of all, Dr. Surbhi Sharma belongs to Arera Colony Clinic, Bhopal, and she is going to present a very nice topic, role of Vincol Churna as well as Mirilep in ischemic heart disease patients. Yes, Dr. Surbhi.
Myself, Dr. Kirti Sharma. I am a compliance doctor in Panchakarma Clinic, Bhopal. Today's my topic is role of Exclusion as well as Medemy and Ischemic heart disease.
Madam, there is some problem with your headphones. There is a disturbance over there. Yes, Rahul sir. Thank you. Dr. Surbi, if you can remove the headphones. Yes, ma'am.
Sir, audible?
Yes,
yes, yes.
Sir, आवाज आ रही?
Perfectly audible.
Good evening. Thank you, sir. Good evening. Myself, Dr. Surbi Sharma. I'm the compliance medical doctor in Arera Colony, Bhopal. Today's my topic is role of Winkle Chun as well as Medemy in ischemic heart disease. Ischemic reversal program is designed for improving the blood flow to heart. Lack of blood supply to the heart can often cause of heart attack and is common in people with a high blood pressure. IRP aim to reduce the risk of heart attack and increase exercise tolerance level to improve the quality of life. IRP treatment is associated with significant improvement in Duke treadmill score and VO2 max, therefore leading to betterment of prognosis in IST patient. The dependency on conventional medicines was decreased by IRP. Next, sir. Next. Patient medical history. Patient age is 64, gender is male, occupation is retired Ayush medical officer, location is Bhopal. History is DM and HTN. Complaint is dyspnea on exertion in chest pain. Next, sir. Past history. HTN 2003 से था, CABG उनका 2003 में हुआ, PTCA उनका 2016 में हुआ, DM उनको 2020 में हुआ. 2021 में patient again advised CABG because of reoccurrence of chest pain and heaviness in chest. After this, patient decided to come Madhavbaug for treatment. Next. In clinic on examination on stress test before treatment, there are ischemic changes on 8 minutes. After treatment, there is no ischemic changes on stress test on modified Bruce protocol. Allopathic medicine, patient is nitroglycerin 2.6 PD, Seloken L25 OD, Pentosed D BD, Ecosprin 75, Pelvis 75, Rosavel 10, Nicorin 5 BD, Rancard 500 BD, Amaryl M2 BD, Glipan 20, Revotril 5. Presently, patient is on hold all medicine of allopathic. Next, sir. Line of treatment, we advise oral medication is Vincolchun, GHA, ACE, ARJ Kada, Anulix powder and Glido. Diet box is reverse diet box, Panchakarma therapies twice a week in first month, then weekly. Regular monitoring MIB pulse. Last one, sir. Last slide, sir. Last one. Line of treatment.
This one.
Thank you, sir. Regular exercise and walking are advised. The patient are prescribed Vincolchun 3 grams to be taken twice daily for a period of 90 days along with the conventional treatment. Patients were motivated to modify their lifestyle and dietary habitry. Medemy is indicated for local application in stable angina. The assessment of Vincolchun as well as Medemy was done with the help of VO2 max, lipid profile, weight, BMI, heart rate, abdominal girth, and systolic blood pressure and diastolic blood pressure. Next, sir. Therapy for IRP, Snehan, massage and external oilation, sesame oil plus lavender oil, 30 to 35 minutes. Sweden is specific heat therapy, Dashmol, Basti per rectal drug administration, lukewarm GHA decushion, 100 ml. Next, sir. विंकोलचूर्ण विंकोलचूर्ण का ग्रंथ में सुश्रुत उत्तर तंत्र चैप्टर 42 में उल्लेख है दाणेमादि घृत के नाम से. विंकोलचूर्ण is comprised of various herbs improving metabolism. It is prepared with the curd and ghee that help improve HDL and reduce LDL triglycerides. Vincochurn is rich in antioxidant. It protects heart and endothelium from oxidized damage, improve endothelial function and elasticity of coronary vessel. It improves liver function, digestion and fat metabolism. Bhil Chitrak Hingu Kalonchi Jira. Okay. Miri Vacha Chave Amlavetas Punanava Miri Lake. Miri is a vasodilator, anti-inflammatory, analgesic, stimulant of removal metabolic waste from the site and promotes natural healing process. Marich is pramathi dravya. Miri lep is for the lepan chikitsa. आफ्टर हम लोगों ने जब देखा कि पेशेंट को चेस्ट पेन का कंप्लेंट हमारे ट्रीटमेंट और सब चीजों को देने के बाद जब थोड़ा बहुत रह रहा था तो हम लोगों ने उनको लेपन चिकित्सा के लिए मेरी लेप एडवाइस किया. जब प्रमाथि द्रव हमारे अपने गुणों उष्ण तीक्ष्ण वीर्य से सूक्ष्म अति सूक्ष्म स्रोतस में जाकर दोष संचय जो अपने गुणों को बाहर निकाल देते हैं वो प्रमाथि द्रव्य होते हैं. रिजल्ट्स थे हमारे बिफोर ट्रीटमेंट पेशेंट का वेट था 66.9, आफ्टर ट्रीटमेंट इज 47.6, BMI is 25.4, 18.14 is after treatment, abdominal girth is 107.77, systolic blood pressure is 124, 105, diastolic blood pressure is 74, after treatment is 69, VO2 is 15.4 to 36, PA1 is 8 and after treatment is 6.3. Duke treadmill score is -2 to 0. Lipid profile में total cholesterol is 100. After treatment is 156. HDL is 25. After treatment is 31. LDL 156. After treatment is 116. Triglyceride is 210. 144. Heart rate after before treatment is 90. After treatment is 78. Next sir. डिस्कशन वाई हम लोग विंकोलचूर्ण क्यों बोल रहे हैं यहाँ पे क्योंकि वाई टू मैनेज एलडीएल. हम लोग अगर सेलुलर लेवल पे देखेंगे तो ऑक्सीडेशन स्ट्रेस हो जाता है एलडीएल के साथ तो वो ऑक्सीडाइज एलडीएल होता है जो जाकर एंडोथेलियल डिसफंक्शन क्रिएट करता है. वहां पर अगर हम देखेंगे तो अगर ऑक्सीडेशन हो जाता है एलडीएल का तो इससे हमारा इम्यून सिस्टम एक्टिवेट हो जाता है तो वो मोनोसाइट्स जो होते हैं वो इनकल्फ करने लगते हैं इन्फ्लामेशन क्रिएट होकर तो जिसके कारण से सेलुलर डिस्ट्रक्शन होता है जिसके कारण से डिमांड ऑफ कोलेस्ट्रॉल बढ़ने लगता है जिससे एलडीएल्स के काउंट्स बढ़ते हैं तो वो एलडीएल्स नॉर्मल नहीं रहते वो ऑक्सीडाइज एलडीएल रहते हैं जिसके कारण से और वो एंडोथेलियल डिसफंक्शन क्रिएट करने लगते हैं जिसके कारण प्रोग्रेसिव डेवलपमेंट ऑफ एरिथमा फॉर्मेशन होने लगता है. यहाँ पे the oxidation process is stopped with the potent of antioxidant medication is vincochurn and the cease of formation of erythema. Use of potential antioxidant medication can be effective in reducing demand of LDL, which can be observed by reduction in LDL number. Next, sir. Vincol is different from statin. Vincol reduced the LDL demand. High ORAC with the cellular penetration, lower oxidative stress and inflammation. Demand of cholesterol and LDL reduces. Statin stop LDL production. Enter lipoprotein production site, reduces the HMG CoA reductase enzyme. Irrespective of demand, LDL production reduces. Conclusion. The Vincol and the Mirilap in improving endothelial lining, reducing erythema, increase elasticity of blood vessels, thus helpful in reducing blockages and helpful in reducing ischemic changes along with the controlling blood pressure and reducing the dose of conventional medicine. Thank you, sir. Next slide. Our team, Dr. Shraddha Chobe ma'am is clinic head. Thank you, sir.
Fantastic presentation, Dr. Surbhi. Rahul sir, your views on this, please.
Yes, Dr. Surbhi, very strongly you made your point how your treatment of vincochurn and other Panchakarma therapy can be helpful in a chronic condition like coronary artery disease, dyslipidemia, diabetes. But here I have a question. आपके patient में weight loss इतना हुआ है कि his weight is now 41 kg.
47.
47 kg.
Yes,
right.
sir. 18 BMI.
So how is his bulk? So is he feeling good or?
Sir, around 300 days completed with Madhavbaug. He is well good right now.
Okay, so have you advised him for some Balya Chikitsa?
Yes, sir. Balli protein advices.
You have already advised. Very good. Nice. Keep
Yes,
it up.
Thank
Yes,
you.
Ranjit sir.
Yes, super presentation, Dr. Surbi ma'am. You are working very well. As we know that in the MP, you are also young as a doctor, dynamic doctor. You are working. One thing I want to suggest here, as this patient is towards the lower BMI, so we have to work on this patient as a Rasan and keep continue monitoring for his lipids level as well as monitoring on the other vitals parameters.
Yes, sir.
Okay, so keep it up. All the best.
For the
Thank you, sir.
doctors outside Madhavbaug, can you just elaborate what is Vincol Churna?
विंकोल चूर्ण से जो मेनली हम लोग देखते हैं वो बिल्व चित्रक हिंगू मेनली उसका जो ग्रथ और दही है दही उसमें कंपोनेंट है वो सुश्रुत उत्तर तंत्र चैप्टर 42 में दाणेमादी ग्रथ के उसमें उल्लेख किया गया है वहां से रेफरेंस.
Thank you, Dr.
Yes.
Surbi. It
Yes,
was
sir.
a fantastic presentation. Now, doctors, we are moving on to our next presenter. Our next presenter is Dr. Preeti Goswami from Mahadev Totla Nagar Bengali Clinic, Indore, and her presentation topic is long-term DM, diabetes reversal, a case study. So we are now moving on to Dr. Preeti Goswami. Doctor, I'm going to spotlight you now. And kindly start your screen sharing. Best of luck. You
Yes,
have 8
sir.
minutes of time.
Okay, sir. Thank you. Good evening, all. Myself, Dr. Preeti Bharati Goswami, and आज का मेरा जो है वो सिंगल केस स्टडी जो है मैं प्रेजेंटेशन देने वाली हूँ. मेरे जो रिसर्च का टॉपिक है वो है क्या डायबिटीज टाइप 2 रिवर्सल लॉन्ग टर्म तक पॉसिबल होता है. इसके लिए जो मैं केस स्टडी प्रेजेंट कर रही हूँ वो एक ऐसे मेल पेशेंट का है जिन्हें जस्ट 23 की एज में ही डायबिटीज टाइप 2 डायग्नोज हो गया था. मार्च 2018 में उन्होंने जो है वो एलोपैथी ट्रीटमेंट स्टार्ट कर दिया था और नवंबर 2018 में उन्होंने जो है अपना फर्स्ट टाइम क्लिनिक विजिट किया था और ट्रीटमेंट जो है पेशेंट को कंसल्ट करने के बाद में स्टार्ट हो गया था नवंबर में ही. और ट्रीटमेंट स्टार्ट करने के जस्ट 2 महीने बाद ही दो महीने बाद ही जनवरी 2019 में उनका फर्स्ट टाइम जीटीटी जो है वह हमने अटेम्प्ट किया और जीटीटी जो है वो नेगेटिव आया था जस्ट 2 महीने के ट्रीटमेंट के बाद ही. और उस समय उनकी जो पोस्ट पेंडियल रीडिंग थी वो आई थी 121. उसके बाद जब पेशेंट से मैंने काउंसलिंग की और मैंने कहा कि क्यों जस्ट एक ही बात, क्यों ना हम हर साल जो है जीटीटी अटेम्प्ट करें. और पेशेंट जो है वो कन्विंस हुए और अक्टूबर 2020 में उनका सेकंड टाइम जीटीटी जो है वो हमने अटेम्प्ट किया और उस समय जो उनकी पोस्ट पेंडियल रीडिंग जस्ट 82 आई थी. फिर थर्ड टाइम जीटीटी जो हमने किया 2021 अक्टूबर में और ये जो है इस समय उनकी पोस्ट पेंडियल रीडिंग जो थी वो जस्ट 114 आई थी. अक्टूबर हमने इसलिए चूज किया क्योंकि पेशेंट का बर्थडे रहता है तो मेरी एक रिक्वेस्ट थी आप खुद को बर्थडे गिफ्ट दो अपनी हेल्थ को लेकर कि आप हेल्दी रहोगे तो वही आपके लिए खुद का बर्थडे गिफ्ट होगा. तो जीटीटी नेगेटिव है 3 साल से. सबसे बड़ी बात ये थी कि इनकी फैमिली में किसी को भी डायबिटीज हार्ट डिसीज या फिर हाइपरटेंशन की हिस्ट्री नहीं थी और इनकी केवल एक ही कंप्लेंट थी सीवियर फटीग. ये जब हमारे पास आए तो उनके पास केवल एक ही रीडिंग थी फास्टिंग 205 और पोस्ट पेंडियल 278. तो फिर हमने इनका HbA1c किया जो कि 7.2 आया और बिकॉज 30 ईयर की एज के पहले ही इन्हें डायबिटीज हो गया था तो सी पेप्टाइड इन्हें एडवाइस किया गया था जो कि 2.71 आया था जो कि बहुत खुशी की बात थी कि पेशेंट टाइप 2 डायबिटिक थे ना कि टाइप 1. फिर हमने जो एबीपीएम प्लान किया और उसमें जो हाइट हाइपरटेंशन जो है उनका पता चला था. स्ट्रेस टेस्ट हमने कंडक्ट किया जिसमें वो 12 मिनट 48 सेकंड चले थे और मैट वैल्यू 7.6 आई थी. VO2 max 26.6 ml पर kg पर मिनट आया था. यहाँ देखने वाली बात ये थी कि इनका जो ब्लड प्रेशर था वो 170/102 तक जो है वो पहुंच गया था. तो ओवरऑल डायग्नोसिस बना था डायबिटीज टाइप 2, हाइपरटेंशन, हाइपरलिपिडीमिया और ओबेसिटी का. जो ये ट्रीटमेंट ऑलरेडी ले रहे थे वो था पायोग्लिटाजॉन एंड मेटफॉर्मिन का कॉम्बिनेशन, ग्लाइमिपाराइड एंड मेटफॉर्मिन का कॉम्बिनेशन, टेल्मिसार्टन 40 एंड रोजुवेस्टेटिन 10. यहाँ मैं एक इन्फॉर्मेशन शेयर करना चाहूंगी कि पेशेंट को लगता था कि ये सारी दवाइयां सिर्फ डायबिटीज के लिए चल रही है. तो यहाँ पे जो है वो पेशेंट को इन्फॉर्मेशन नहीं दी गई थी कि डायबिटीज के अलावा भी उनको जो है वो हाइपरटेंशन या फिर कोलेस्ट्रॉल के लिए दवाइयां दी जा रही है. इन्हें टेपर करने के लिए और बंद करने के लिए जो हमने ओरल मेडिसिन चूज की थी मैं उन पे हाईलाइट करना चाहूंगी. उनका मेन डायबिटीज को लेकर क्या काम था. मेषशृंगी जो हमने चूज की वो रीजनरेशन ऑफ आइसोलेट सेल और इंक्रीज करती है सिक्रीशन ऑफ इंसुलिन. गुडुची इंप्रूव्स फंक्शन ऑफ लीवर एंड पैंक्रियास. इट रिड्यूसेस ऑक्सीडेटिव डैमेज टू टिश्यू. दारू हरिद्रा रिड्यूस इंसुलिन रेजिस्टेंस एंड इट इज हाइपोलिपिडेमिक. Amlaki increases sensitivity or of peripheral tissue to insulin and it prevents lysis of insulin. Haridra prevents micro and macrovascular complications and it reduces polyphagia and polydipsia. Shunthi purifies रस रक्त धातु and it reduces stress. वचा जो है यहाँ पे बहुत ही अच्छा काम करती है because वचा is nephroprotective and neuroprotective, ताकि in future patient को जो है वो कोई complication ना आए, इसलिए हमने वचा को चूज किया था. इसके साथ साथ जो सपोर्टिव मेडिसिनल ड्रग्स थी वो थी अपामार्ग बिकॉज इट रिड्यूसेस यकृत स्तोत्रोध, पारिजात रिड्यूसेस रक्त दुष्टि, कुटकी पेसिफाइंग आम एंड साम दोष ऑफ रस धातु, गुनिम एंड रोहितकार यकृत उत्तेजक, पिपली इज धातु पुष्टिकर. यहाँ पे मैं अर्जुन को हाईलाइट करना चाहूंगी क्योंकि हमें पता है कि अर्जुन कार्डियो प्रोटेक्टिव होता है, लेकिन अर्जुन डायबिटीज पे भी बहुत ही अच्छा काम करता है. अर्जुन क्लियर क्लेद फ्रॉम रसवह एंड मूत्रवह स्रोतस, और विभितक जो है ये प्योरीफाई करता है रस रक्त धातु को. इसके अलावा हमने उनको जो डाइट पे शिफ्ट किया था वो था 800 किलो कैलोरी का डाइट कंसेप्ट, जो कि लो कार्ब डाइट थी और मॉडरेट फैट और प्रोटीन डाइट थी. इसके अलावा जो हमने उन्हें ओट्स, बार्ली, स्प्राउट, व्हीट ब्रान, फ्रूट सलाद, स्मूदी और सूप पे जो है वो शिफ्ट किया था. पंचकर्म में हमने उन्हें सेंट्रीपिटल ओलिएशन, थर्मल वेसोडाइलेशन, पर रेक्टल ड्रग एडमिनिस्ट्रेशन और शिरोधारा जो है वो एडवाइस किया था. डायबिटीज के लिए टोटल 20 पंचकर्मा एडवाइस किए गए थे, जिनमें जो है केवल 8 थेरेपीज के बाद ही उनका फर्स्ट जीटीटी नेगेटिव हो चुका था. और इसमें जो स्नेहन हमने किया था वो नीम और तिल तेल से किया था, क्योंकि इट रिड्यूस इंट्रामायोसेलुलर फैट डिपोजिशन एंड इंसुलिन रेजिस्टेंस. स्वेदन बाय दशमूल काढ़ा बिकॉज इट इंप्रूव्स एंडोथेलियल डिसफंक्शन. पीआरडीए बाय जीडी वायकवात, गुड़मार, दारू हरिद्रा और यष्टि मधु का कॉम्बिनेशन हमने बस्ती के रूप में यूज किया था बिकॉज इट प्रमोट रीजनरेशन ऑफ आइसोलेट सेल्स. कंप्लायंस में अगर हम देखें तो क्योंकि वाइटकोट हाइपरटेंशन डायग्नोज हुआ था, इसलिए उनके लिए जो है वो कुछ हाइपरटेंशन के लिए भी थेरेपीज प्लान की गई थी, जिसमें स्नेहन रोज और तिल तेल से किया गया था, स्वेदन दशमूल काढ़े से किया गया था और शिरोधारा के लिए जटामासी काढ़ा इस्तेमाल में लाया गया था. टोटल जो पंचकर्म की थेरेपीज थी वो उन्हें स्टार्टिंग के 2 मंथ तक जो है वीकली दी गई और फिर जो है वो मंथली थेरेपीज लेते हैं. और डाइट में जो है हमने उन्हें 2 महीने के लिए 800 किलो कैलोरी डाइट किट पे रखा था और उसके बाद में एक्सपेक्टेड वेट लॉस 26 बीएमआई से 23 बीएमआई उनका हो गया था, इसलिए हमने उन्हें 1000 to 1200 किलो कैलोरी पर जो है वो शिफ्ट कर दिया था. मेडिसिन जो है मैंने जो कॉम्बिनेशन बताए हैं वो अलग अलग मेडिसिन के कॉम्बिनेशन जो है हमने उनकी कंडीशन को देखते हुए दिए था, क्योंकि उनको केवल फटीग का कंप्लेंट थी और कोई कंप्लेंट नहीं थी, बट इन फ्यूचर कोई कॉम्प्लिकेशन ना आए इसलिए मेडिसिन जो है वो चूज की गई थी. इसके अलावा हमने उनको 10,000 फुट स्टेप्स का डेली का टारगेट दिया था, जो वो आज भी मेंटेन किए हुए हैं. और साथ ही साथ वेट लॉस होने के बाद में हमने उन्हें जो है मस्कुलर एक्सरसाइज पे शिफ्ट किया था विद वॉक. इन्वेस्टिगेशन में पेशेंट ने मेरी बहुत ही हेल्प की थी. वो वीकली ट्वाइस मुझे सेल्फ मॉनिटरिंग ब्लड ग्लूकोज और ब्लड शुगर की रीडिंग प्रोवाइड करवाते थे, जिससे कि मैं उनकी एलोपैथी के साथ साथ अपनी जो आयुर्वेदिक मेडिसिन थी उसको भी टैपर करते हुए बंद कर सकी. और 6 महीने बाद उनकी सारी दवाइयां जो है वो बंद हो चुकी थी. हमारे स्टार्टिंग में जो है वो टारगेट था HbA1c मंथली करने का, और अब हम जो है हर 3 महीने में HbA1c जो है रिपीट करते हैं. और लिपिड प्रोफाइल जब जब HbA1c थोड़ा भी बढ़ा हुआ दिखता है तब उन्हें जो लिपिड एडवाइस किया जाता है, क्योंकि देखने में आया है उन पेशेंट में कि लिपिड प्रोफाइल में अगर थोड़ा भी वेरिएशन आया तो उनका HbA1c जो है वो बढ़ के आता है, लेकिन अभी तक का हाईएस्ट HbA1c उनका 6.6 ही गया है. इसमें अगर हम देखें तो डायबिटीज टाइप 2 जो है वो मेनली लाइफ स्टाइल डिसऑर्डर है, जिसकी वजह से वेट गेन होता है और BMI बढ़ता है, और एब्डोमिनल गर्थ बढ़ने की वजह से इंट्रामायोलर सेलुलर फैट जो है वो एक्यूमुलेट होती है, और इससे जो है वो इंसुलिन रेजिस्टेंस जो है वो क्रिएट होता है. तो इन सबको जो हमें पैथोलॉजी को ब्रेक करने के लिए 5 मेन पॉइंट जो है हम यूज करते हैं. इनमें से पंचकर्म की थेरेपी यूज करते हैं टू मेंटेन वैस्कुलर हेल्थ एंड प्रॉपर इंसुलिन सिक्रीशन, डाइट फॉर नेगेटिव कैलोरी बैलेंस, exercise for muscle health, meditation for mental health and medicine for healthy system function. अगर ओवरऑल हम कंक्लूजन देखें तो डायबिटीज टाइप 2 डेफिनेटली लॉन्ग टर्म तक जो है वो रिवर्सिबल हो सकता है, अगर आयुर्वेद में बताई गई दिनचर्या, रात्रिचर्या या लाइफ स्टाइल जो हम बोलते हैं उसको फॉलो किया जाए. इसके साथ ही मैं एक और एग्जांपल देना चाहूंगी. 53 एज में ऐसे व्यक्ति जिनके डायबिटीज के साथ साथ TMT भी पॉजिटिव आया था, विद इन 1 मंथ उन्होंने जो है अपने डायबिटीज को तो रिवर्स किया, लेकिन उनका जो है वो TMT भी नेगेटिव हो गया, और लगातार 3 साल से वो पेशेंट भी अपना GTT नेगेटिव बना रहे हैं और TMT भी उनका नेगेटिव ही है. मतलब अगर डायबिटीज को रिवर्स किया तो हार्ट डिसीज भी रिवर्स हो जाती है और हार्ट जो है वो स्ट्रांग हो जाता है. टेक अवे मैसेज में यही देना चाहूंगी कि लाइफ स्टाइल को फॉलो करें, लो कार्ब डाइट लें, एक्सरसाइज करें, मेडिटेशन करें और साथ ही साथ जो डॉक्टर इन्वेस्टिगेशन बोलते हैं वो करें और उनके साथ रिपोर्ट जो है वो शेयर करें, ताकि डॉक्टर जो है आपको प्रॉपर फॉलोअप में रख सके। और ये सारे केस के लिए मैं एक ही चीज कहना चाहूंगी, कर यकीन तो हासिल है मंजिल, कर यकीन तो मुमकिन है जीत। हार तब नहीं जब किसी से हार जाओ, हार तब है जब खुद से हार जाओ, और इसीलिए ठान लिया तो मंजिल पाना तय है। थैंक यू एवरीवन।
क्या बात है, काबिले तारीफ डॉक्टर प्रीति। कैन वी हैव अ राउंड ऑफ अप्लॉज फॉर डॉक्टर प्रीति? Superb, confident way of presenting. Rahul sir, your views on this, please.
Yes, very, as rightly said, very confident presentation, very motivating. और मुझे लगा कि मैंने अभी स्टार्ट करना चाहिए एक्सरसाइज, रनिंग वगैरह, प्राणायाम, मेडिटेशन, यहीं पे मैं स्टार्ट कर दूं। और डेफिनेटली सुपर्ब कंपाइलेशन ऑफ नॉलेज, और उसके साथ आपका प्रेजेंटेशन स्किल तो ऑलरेडी इज वेरी गुड, and keep it up. All the best for your future.
Thank you, sir.
Yes, Ranjit sir.
Yes, डॉक्टर प्रीति गोस्वामी मैम, इनकी एक क्वालिटी रही है, हमेशा एक चीज के पीछे पढ़ते हैं तो पढ़ ही जाते हैं जब तक वो मिल नहीं जाता। सेम लाइक दैट, कभी डिस्कशन होता है तो इतना डिस्कशन होता है कि जब तक आंसर नहीं मिलता। तो सेम लाइक दैट, पेशेंट के पीछे मैडम भी ऐसे ही पढ़ते हैं कि जब तक उनका फॉलोअप मिल नहीं जाता तब तक उनका अच्छा कंप्लाइंस लगाता रहता है। तो कीप इट अप मैम, जैसे 3 साल तक आपने ये लॉन्ग टर्म फॉलोअप दिया है, ऐसे ही आगे भी आप अपने को फॉलोअप लेना है। ऑल द बेस्ट।
थैंक यू सर।
Yes, thank you. And we are now moving to our next presentation, Dr. Amita Tripathi from Jawahar Chowk, Bhopal, and her topic of presentation is preventive aspects towards angioplasty.
Dr. Yes. Amita Tripathi is not presenting.
She is presenting, sir. She is come up with a presentation, and that's been confirmed. So yes, we are going to see her presentation now, and her topic is preventive aspects towards angioplasty having comorbidities. So I am going to, just a minute, there is a screen sharing. Dr. Amita, you have already shared your screen. Okay, let me spotlight you. Dr. Amita, you have to present your presentation, share your presentation. Thanks for promoting the MIB Pulse app. It's a fantastic monitoring app which we are using for all our patients, doctors who are joined with us in this symposium. This is the app wherein we are closely monitoring our patients. Dr. Amita, once you, yes, you can share your presentation, ma'am. Yes, ma'am.
Am I audible, sir?
Yes, ma'am. You need to share your screen with your presentation.
Yes, sir.
Ranjit sir, if you can help her.
So, sir, if we are having technical problem, we should move to the next presenter.
Fine. No worries, sir. We'll move on to our next presenter, Dr. Avnish Thakkar from Bhopal, Gujarat, and his topic of presentation is effect of IRP treatment in IHD patients. So, Dr. Avnish, I'm going to spotlight you now. Be prepared and kindly share your screen on presentation mode. Yes, Dr. Avnish.
Young guns from the Gujarat.
Yes.
Yes.
Good evening, everyone. Sir, I am audible.
Perfectly audible, sir.
Yes, sir. Good evening, everyone. Myself, Dr. Avnish Thakkar, a clinic head, Madhavbaug, Bhopal branch. Today, I am going to present one of our successful case study, the treatment of ischemic heart disease associated with the hypertension under the ischemia reversal program. Let's quickly move on to patient's medical history.
the 45-year-old female patient with a history of hypertension since 1 year came to our clinic, Bhopal, Ahmedabad. She had a complaint of heaviness in the chest, dyspnea on exertion, and palpitation. She had a TMT report with her, and she was positive in that case in just 2 minutes and 30 seconds. Apart from that, she had one 2D echo report. Overall, the 2D echo report was good, with one comment of reduced compliance, and her ejection fraction was 68%. And if we talk about the vitals, her BMI was 30%. Her BMI was 30. BP is 126 by 77. Her abdominal girth is 104 centimeter, and her pulse rate was 65 beats per minute. So we advise fresh ECG, fresh lipid profile, and complete blood count to check her hemoglobin levels. As we see in the slide, calcium channel blocker, beta blocker, and statins were present in her prescription. So on the basis of her complaint and her TMT report, we started her treatment under the Ischemia reversal program. Majorly, we divided our treatment into 3 portions: Ahar, Aushad, and Panchakarma. For dietary modification, we restrict her diet into 800 kilocalorie diet, which is potassium rich. Apart from that, the carbs and fat were lower side as compared to proteins and fibers. If we talk about the Panchakarma, for centripetal oleation, that is a Snehana, we use the medicated til, and for thermal vasodilation, that is a Swedana, we use the decoction of a Dashmul. For per rectal drug administration, we administered the decoction which is made up of Gokshur, Haridra, and Amlaki. We administered 21 Panchakarma on a twice a week basis. Later on, another 5 Panchakarma which is administered on a monthly basis. In that Panchakarma, we replace the per rectal drug administration with the Shirodara, and for Shirodara, we use Jatamansi Kwat. Gokshur, Haridra, and Amlaki also administered through a oral medication. Along with that, we plan one decoction which is made up of Arjun, Punarnava, and Vacha. Apart from that, one tablet which is made up of Sunthi and Brahmi. So why this medication? So if we talk about the polyherbal formulation of the Gokshur, which is Tribras terrestrial, which gives the anti-hypertensive, anti-spasmodic, hypolipidic, and cardioprotective action. If we talk about the Haridra, which is Curcuma longa, which gives the hypotensive, anticoagulant, and antioxidant effect, and Amlaki, which is Ambelica officinale, which is rich source of vitamin C, which gives antioxidant, hypolipidemic, and cardioprotective action. Along with this polyherbal formulation, we plan one vehicle medication, which we can say Anupana, which is made up of Arjun, Punarnava, and Vacha. These 2 are the primary medication for the ischemic heart disease, and we continue it for 90 days of period. For hypertension, we introduce another polyherbal formulation which is made up of Brahmi and Sunthi. Brahmi, which is Bacopa moneri, which gives the anti-hypertensive, neuroprotective, and anti-inflammatory action, and Sunthi, which is strengthen the heart muscles. And both the herbs combinedly have calcium channel blocking activity as well as the nitric oxide mediated vasodilator activity. And with this formulation, we associated one liquid named Alluri. The major content of Alluri is Kumari. Why Alluri? Because it helps in reduction of the metabolic syndromes like obesity and dyslipidemia. Certain points need to be discussed. We plan such a formulation. So what is the purpose behind that? So if we talk about the purposes, firstly, it helps in rectifying the mismatch between the oxygen demand and supply of the heart. Secondly, it gives the hypolipidemic and antioxidant effect. And lastly, it reduces the blood pressure. If we talk about the Panchakarma, we plan this 3-step Panchakarma in the form of Snehan, Svedan, and Basti. Reduction in the sympathetic overactivity via anxiolytic action of the Svedan, reduction of the myocardial oxygen demand via reduction of the sodium and water load by Svedan, and Basti helps in the release of the nitric oxide from the vascular endothelium. and which is coronary vasodilator, anti-inflammatory, and antioxidant. So what is the how we can calculate our progress? So so we continue, we monitor our progress on a TMT belt, and the parameter is VO2 max. We plan this on a monthly basis, and her, in particular this case, her VO2 max gradually increases and reaches up to 36%. And 800 kilocalorie diet plays an important role. Approximately she reduces 13 kg of weight loss, and she reached a 25 BMI from 30. And these are the improvement in the VO2 max. And in the last TMT test, she completed 15 minutes of his TMT test. And the best part is, at that time she was not in a single allopathic medication. And these are the improvement of the parameters. So all in all, we can say ischemia reversal program is an effective management of the ischemic heart disease and the patient with the history of the hypertension. It gives us triple benefits: anti-ischemic effect, reduction in the blood pressure, and reduction in the dependency of the conventional medication. And thank you. I would like to thank all the mentors who created such a system, and special mention for our respected ZMH sir, Dr. Sadiq Khan sir, who is behind this right from the first day. Thank you so much.
Thank you so much, Dr. Avnish. Superb presentation. We'll like to hear the comments of Rahul sir. Rahul sir, yes. Unmute. Yeah.
Avnish, as I said, young gun of Ayurveda, and you fired very well. Superb presentation, and you remind me my first presentation, and definitely your future is very bright with Madhavbaug. You are doing very wonderful work, and congratulations and all the best for your future work.
Thank you so much, sir.
Yes, Ranjit sir, your comments on this, please.
So very nice, Dr. Avnish sir. You have presented very nicely with confidently. And the first thing, IST at the starting of the journey in Madhavbaug, and you have taken the cardiac cases and you have presented very well. That shows very optimistic. That means you are a superstar of upcoming time. All the best.
Thank you so much, sir. And that was my first case in Madhavbaug, sir.
Okay, that's superb. Very nice.
Thank you.
Thank you, Dr. Avnish. And we are moving on to one more young gun of Bhopal, and that is Dr. Amita Tripathi. And Ranjit sir, kindly share the screen.
Yes.
Yes, Dr. Amita, you can unmute and start with your presentation once Ranjit sir shares his screen.
Yes, sir. Good evening, all. Am I audible?
Yes, ma'am.
Yes, sir. First of all, congratulations to all my seniors. Actually, they are doing a fantastic job, and I am learning. Like, मैंने जब से भी माधवबाग ज्वाइन किया है, हर डे मुझे कुछ ना कुछ सीखने को मिला है. और अभी भी जो मैं केस रिप्रेजेंट करने वाली हूँ, एक्चुअली इट वाज माय फर्स्ट हार्ड केस, एंड आई वाज लाइक, मुझे थोड़ा सा डर भी लगता था कि मैं सच में क्या हार्ड केस हैंडल कर पाऊंगी क्या. लेकिन thanks to all my mentors who supported me so much. And as you can see, my topic is role of Sampurna Hridaya Shuddhikaran in chest pain and ischemic heart disease. So next, please. My objective was like we are seeing हमारे भारत में स्टार्टिंग से लेके अभी तक, मतलब जब से हमारा भारत देश बना हुआ है, तो छोटी छोटी बीमारियां मतलब इतना बड़ा रूप ले लेंगी कि सीधा जाकर के हार्ट पे इफेक्ट करेंगी. जैसे हाइपरटेंशन, डायबिटीज, ओबेसिटी, थायराइड डिसफंक्शनिंग और अदर लाइफस्टाइल डिसऑर्डर्स है, सारी भी जाकर के हमारे हार्ट को ही सीधा मतलब बूम करती है कि लो अभी हार्ट में है ये, अभी क्या. सर नेक्स्ट स्लाइड प्लीज. इसी में आगे बढ़ते हुए मैंने एक केस रिप्रेजेंट करने की कोशिश की है. मेरा एक केस मैं रिप्रेजेंट कर रही हूँ यहाँ पे. Medical history of patient, like age is 48 and gender male है ये. इनका हिस्ट्री एक्चुअली हाइपरटेंशन इनको था, उसके बाद TMT पॉजिटिव ये 2021 में आए. उसके बाद इनको चेस्ट पेन हुआ और एंजियोग्राफी और 2D को इनका साथ में 2021 में किया गया. इसके बाद में इनकी मेडिसिन स्टार्ट हुई, और जब ये हमारे पास में 2022 में आए तो हमने इनका स्ट्रेस टेस्ट फिर से लिया. तो इनका TMT निगेटिव आया हुआ था, बट डिस्निया काफी ज्यादा था, बहुत ज्यादा था, और हमको इनका स्ट्रेस जो है टर्मिनेट करना पड़ गया था। नेक्स्ट स्लाइड प्लीज सर। इनका ये जो कंप्लेंट्स लेकर के हमारे पास में आई थी, एक्चुअली जो केस का डिस्क्रिप्शन मैं बताने वाली हूँ आपको, कि इनका कंप्लेंट मेनली था कि उनको चेस्ट पेन बहुत ज्यादा होता था, वो आधा किलोमीटर भी नहीं चल पाते थे, लाइक डिस्निया, फटीग एंड माइल्ड एसिडिटी कॉज ऑफ एलोपैथिक मेडिसिन। तो हमने इनको इन्वेस्टिगेशन स्टार्टिंग में जो एडवाइस किए थे वो स्ट्रेस ABPM, लिपिड प्रोफाइल एंड HbA1c। HbA1c इन्वेस्टिगेट करने का मेरा एक मोटिव था कि एंडोथेलियल डिसफंक्शन मेनली, लाइक क्या अदर पैरामीटर्स में रिस्क फैक्टर से बचने के लिए उनको इन्वेस्टिगेशन के लिए मैंने HbA1c भी उनका एक बार किया कि कहीं ये भी तो इनको ये नहीं है। नेक्स्ट स्लाइड प्लीज सर। So my diagnosis was ischemic heart disease with hypertension and diabetes. Sir, next slide please. मैंने जो उनको ट्रीटमेंट स्टार्ट किया, सबसे पहला तो उनका लाइफस्टाइल मॉडिफिकेशन था, जो हम सारे भी डॉक्टर्स अभी कर रहे हैं कि दिनचर्या, दिनचर्या किंवा दिनानाम दिनचर्या, दैट इज द बिग रोल। मतलब हम लोग जो चीज सुधार रहे हैं ना, कि दिनचर्या अगर सही है तो कोई भी बीमारी आपको छू नहीं सकती है, लेकिन अगर दिनचर्या खराब है तो आपको भर भर के सारी बीमारियां भी हो जाती है। सेकंड पॉइंट मेरा था उनको डाइट का, कि उनका डाइट मॉड्यूल कैसा होना चाहिए, तो हमने इनको लो कार्ब हाई फाइबर प्री पैक डाइट दिया था। पंचकर्मा थेरेपीज में अगर आऊँ तो सेंट्रीपिटलोलेशन, थर्मल वैसोडाइलेशन एंड पर रेक्टर ड्रैग एडमिनिस्ट्रेशन एंड शिरोधारा इनका हमने प्लान किया। इनको ओरल मेडिसिन जो हमने दी वो पॉलीहर्बल फॉर्मुलेशन ऑफ गोक्षुर हरिद्रा एंड डिकॉक्शन ऑफ अर्जुन पुनर्नवा एंड बचा, इनका ओरल मेडिसिन कंटिन्यू रखा। नेक्स्ट स्लाइड प्लीज सर। अब मैं डिस्कशंस में अगर बात करूं तो सबसे पहला जो एक होता है कि सेडेंटरी लाइफस्टाइल इज द बिग कॉज ऑफ ऑल द डिजीज। तो हमने इनका सबसे पहले दिनचर्या एक पैटर्न बनाया कि शुरू से इनको सुबह से करना क्या है, सुबह से रात तक का किस टाइम पे इनको उठना है, किस टाइम पे मतलब कितना योगा या एक्सरसाइज जो हमने प्लान किए। इनको वॉकिंग कैपेसिटी बताई कि आपको सर इतना चलना है, पहले थोड़ा सा चलना है, फिर थोड़ा थोड़ा करके इंक्रीज करना है, इस तरह से इनको हमने गाइड किया सारे ही सिटिंग्स में। इसके बाद में अगर मैं मेडिसिन की बात करूँ तो मेडिसिन में इनका जो पॉलीहर्बल फॉर्मुलेशन था वो गोक्षुर हरिद्रा अमल की अर्जुन नवा और बचा का था। जैसे कि हम जानते हैं गोक्षुर हरिद्रा और अमल की ये तीनों भी हार्ट पे मतलब ऐसा काम करते हैं कि जो इस्कीमिया मतलब आने भी वाला है वो भी रोक देते हैं। तो मैं अगर गोक्षुर में देखूं तो डायरेटिक, एनाल्जेसिक, एंटीस्पास्मोटिक एंड वेसोडाइलेटिंग प्रॉपर्टी है। हरिद्रा एंटी इन्फ्लेमेटरी, एंटीऑक्सीडेंट। अमल की रिड्यूसेस ऑक्सीडेटिव डैमेज, जैसा कि डॉक्टर सुरभि मैम ने भी स्टार्टिंग में बोला ऑक्सीडेटिव डैमेज ऑफ टिश्यूज, एक्सप्लेन बहुत अच्छे से किया। अर्जुन अगर बोलूं मैं तो अर्जुन हृदय होती है, हृदय बोला ही जाता है अर्जुन को। इट्स अ कार्डियोटॉनिक एंड एनहांसेस योर मायोकार्डियल फंक्शन। तो एक मतलब पॉलीहर्बल फॉर्मुलेशन हमने बनाकर के इनको टैबलेट के फॉर्म में, और अर्जुन पुनर्नवा और बचा का एक हमने डिकॉक्शन लिया था। पुनर्नवा का ऐसा बोला जाता है कि जहां जहां शोथ वहां वहां पुनर्नवा, हम ऐसा बोलते हैं। तो जो इन्फ्लामेशन होता है ब्लड वेसल्स में, पुनर्नवा उसमें बहुत ही कारगर हुआ। वचा का अगर मैं बोलूँ तो वैसोडाइलेटर और कोरोनरी फ्लो को इंक्रीज करता है, जिससे इनका हार्ट का जो पंपिंग और का कोरोनरी जो सर्कुलेशन हुआ वो इम्प्रूव हुआ। डाइट में अगर मैं बात करूँ तो इनका डाइट लो कार्ब एंड फैट एंड हाई प्रोटीन एंड फाइबर विथ लो सोडियम एंड हाई पोटेशियम, नेम्ड एज गो बीपी, हमारा एक डाइट बॉक्स है। उसको हमने इनको कंटिन्यू किया, जिससे कि इनको HbA1c भी इनका हाई आया हुआ था, जबकि उनको डायबिटीज का कोई भी हिस्ट्री नहीं था। डे 1 पे जब हमारे पास में आए थे तो 6.7 इनका HbA1c था, लेकिन ये डाइट लेते लेते 5.2 विद इन अ मंथ, इवन 12 to 13 सिटिंग्स में इनका HbA1c भी नॉर्मल आ गया। सर नेक्स्ट स्लाइड प्लीज था। अगर मैं पंचकर्मा की तरफ बढ़ती हूँ,
कम टू कंक्लूजन, यू ऑलरेडी 7 मिनट्स हो चुके हैं आपके।
यस सर। सर एक पॉइंट मैं बताना चाहूंगी, एक्चुअली हृदरोग में सबसे ज्यादा इंपॉर्टेंट जो होता है संप्राप्ति विघटन का, जो मैंने उस पेशेंट में पाया कि मुझे संप्राप्ति विघटन करना था, इसलिए मैंने स्टार्टिंग से लेकर के जो एंड तक का मुझे करना था कि हाँ ये मैं मतलब मैंने किया जो भी पॉलीहर्बल फॉर्मुलेशन और पंचकर्मा थेरेपीज थे। सर नेक्स्ट स्लाइड प्लीज सर। मैंने इनके कुछ पैरामीटर्स लिए हैं बिकॉज ऑफ शॉर्टेज ऑफ टाइम, मेरे पास कम वाइटल्स और कम चीजें थी, इसलिए मैंने जितने पैरामीटर्स इकट्ठे करने थे मैंने उनको लेकर के एक बिफोर ट्रीटमेंट एंड आफ्टर ट्रीटमेंट का बनाया। से आप देख सकते हैं VO2 max has increased from 19.95 to 24.85, ejection fraction is increased from 55% to 63%, fractional shortening 36 to 34, NLR ratio 2.53 to 1.6, and HbA1c already I have told 6.7 to 5.2. Sir, next slide please, sir. This is comparative study of medicine, like patient is now stopped from antihypertensive medicine and visit goal was multivitamin, and induced 30 OD was like cardio medicine and 75 is tapered, and now one medicine is continued with. The next slide please, sir. Now I have concluded that yes, ischemic heart disease can be reversed with proper diet medications, Panchakarma and lifestyle modification as our patient did. And now he can walk 7 kilometers without any fatigue and dyspnea, as he was unable to walk even a half kilometer. Patient is having a normal blood pressure without any medicine, even not on Ayurvedic hypertensive medicine. So thank you so much, sir, for representing myself here. Thank you.
Thank you so much, Dr. Amita. Your confidence. The last statement which you gave, 7 किलोमीटर आज चल रहा है, पहले आधे किलोमीटर भी नहीं चल पा रहा था. That's big hats off to you. Rahul sir, your comments on this.
Yes, the confidence of Dr. Amita is awesome. Definitely, we have to work out on so many points. I'll not enlist those points right now here. Yes, we will discuss definitely, but fantastic, because see many of doctors, बाकी बहुत सारे लोग ऐसे होंगे जो सोचते होंगे यार ये तो मैं भी कर सकता था, जो आज डॉक्टर अमिता is doing here, and she is confidently presenting her case. Lekin they are not presenting anything. Dr. Amita is presenting here, and what this is why Dr. Amita is here and why they are not here is the courage. Who is actually the courage that you are having is actually making you apart from the other doctors, and congratulations. Keep your courage mode on, and because see जब तक हम लोग courage नहीं करेंगे, कुछ चीजें सीखने का नहीं try करेंगे, we will never do that in the future. So definitely good start, confident start है, और भी करने हैं, इससे भी बेहतर करना है. All the best.
Thank you so much, sir.
Yes, Ranjit sir.
Superb, Amita ma'am. As you say that whatever it takes, finally आपने ये करके ही दिखाया presentation at the end कैसे भी. So that's a good thing. जैसे आपने आज किया है कि कुछ भी हो जैसे कुछ भी hurdles आए और आपने ये presentation किया, वैसे ही आगे भी जो ये patients के regarding complaints आती है, definitely I am confident कि आपका confident देख के आप इन सबको recover कर लेंगे और आप सबको reversal journey की तरफ ले जाएंगे. All the best. Superb.
Fantastic presentation, Dr. Amita. Now we move on to our next presenter, Dr. Jinal Thakkar from Vastrapur Clinic, Ahmedabad, and her topic of presentation is role of Basti Chikitsa and herbal medicines in reduction of thyroxine dosage and TSH values in known case of hypothyroidism. A fantastic topic to be taken. Dr. Jinal, I am going to spotlight you now. Yes, doctor. So now you can start with your presentation. You have only 8 minutes left.
Yes, sir. Am I audible? Am I audible to everyone?
Perfectly audible, ma'am.
Good evening, everybody. First of all, I'd like to thank Dr. Rahul sir for giving us such a good platform to share what work we have done over the past years. Today, my topic is going to be treating hypothyroid with Ayurveda. There has been a lot of work being done in this field, and today I'm going to present a case of 10 of my such patients.
Yes, ma'am.
Yeah. The objective was to study the role of Basti Chikitsa and polyherbal medications in reduction of dosage of thyroxine and still maintaining the TSH values under normal range in known cases of hypothyroidism. So the background to this study was formed. Basically, 1 in every 10 adults in India are today suffering from hypothyroidism. And something that is worth noticing is that 1 in 3 diabetic patients could have underlying thyroid disorders, which is why it needs a lot of work. Hypothyroid is directly related to increasing your cardiovascular morbidities. It affects your heart rate, causes bradycardia, which in the long term might lead to congestive cardiac failure or left ventricular hypertrophy. It also increases CAD and increases endothelial dysfunction, leading to increased vascular thrombosis. The sample size was 13. Initially, I had 13 patients enrolled, out of which 3 patients dropped out in the first month of treatment itself due to some personal reasons. There was no adverse event noted during the course of study. So the final sample size of the patients is going to be 10, out of which 1 patient was male, 9 were female, and 1 patient was not on medication. The other 9 were already taking Tyronome. The oral medications given in this particular cases were Kanchanar Gugul, Ashwagandha, and Manduk Parni. Navak Gugul was used in cases with BMI greater than 26. Diet was an 800 kilocalorie diet, which is low carb and antioxidant rich diet. Panchakarma was whole body snehans with rose infused til oil and Swedan with Dashmul Kadha. Per rectal drug administration was done with Manduk Parni, Kanchanar bark, and Shuddha Gugul extract, 100 ml decoction. This therapy was given for 8 to 12 weeks, 1 per week. In selected cases, Nasya was also used. So these are the results. Thyroxine, I successfully tapered 100% thyroxine from 6 of the patients, whereas 50% tapering of medicines was done for the rest of the 4 patients. TSH reduced from before the treatment, it was 8.2, to after the treatment, it was 7.4. The p-value is statistically significant. A parametric improvement, as we can all see, the weight reduced by 10 kgs almost, p-value being highly significant, and thyroxine also, the dosage reduction was highly statistically significant. So as we all know, there has been a lot of correlation between Galaganda and hypothyroidism. But when the patients came to me, this was my point of view of their pathophysiology. Overall, there was decreased basal metabolic rate, which led to decreased oxygen and substrate consumption, which led to weight gain and increased LDL and triglycerides. There was decreased sympathetic activity, which caused symptoms like constipation, bradycardia, dry skin, decreased sweating, CNS apathy, and slowed cognition. There was also accumulation of glycose aminoglycans and hyaluronic acid, which led to water retention and non-pitting edema. So if we correlate this with our traditional symptoms, these all mimic Kapha Srotasavarodh. We can observe Dhatwagni Mandya and Medovritti. We can observe Vatakshay and Shoth. So as I said, there has been a sort of a correlation between Galaganda and hypothyroid. We can very well see that Jatharagni Mandya as well as Dhatwagni Mandya is seen, especially Rasa and Medo Dhatwagni Mandya is seen in such cases. So if we look at the oral medications and their actions, Kanchanar and Gugul both, Bhavprakash has mentioned in Galaganda Adhikar. It has Kanchanar has selective property for protective property for thyroid cells, and Gugul has anti-inflammatory effect. It reduces thyroid dysfunction and endothelial dysfunction both. Apart from that, Trikatu Twakpatra Ela also improve the basal metabolic rate and help reduce the weight, relieve the symptoms of hypothyroidism. Mandukparni has been in various studies found to improve T3, T4 count and reduce TSH levels. It also acts as an anxiolytic. Ashwagandha is again a potent anxiolytic, normalizes cortisol levels and stress-induced thyroid dysfunction. It is antioxidant, prevents oxidative damage to the thyroid gland. Other medicines that were used were Mednox and Artil in certain cases. So if we look at the Panchakarma, centripetal oleation with sesame-enriched rose essence, it calms the hyperactivated sympathetic nervous system. It improves circulation, relieves dryness and coarseness of the skin. Thermal vasodilation with steam of Dashmul decoction softens the skin, dilates the blood vessels, improves peripheral circulation, reduces congestion, excretes out metabolic waste and toxins through sweat, and reduces edema. Per rectal drug administration of the decoction made of Kanchnar, Mandukparni and Gugul improve the thyroid function, protects thyroid cells from damage, improves the BMR, helps to excrete out the accumulation of glycosaminoglycans, reducing edema in interstitial tissues of heart, muscles, skin, etc. It palliates stress and improves production of T3, T4, thereby reduces TSH. While the treatment was going on for my patients, in certain cases, I did observe that after tapering of thyronome completely, the TSH values increased in certain patients. Upon a lot of thinking and discussion between me and Zedemet sir, we decided to go ahead with Nasya for these patients. Since Nasya already is said to be used in Udra Jatragat Vyadhi, it improves the hypothalamic pituitary thyroid axis function, and hence I saw a significant reduction in TSH levels, and they came back to the normal range. So the conclusions was Ayurvedic treatment, especially Basti Chikitsa with proper diet planning and lifestyle modification, is an effective management for hypothyroidism, and it can very well be replaced or also reduce thyroxine supplement dependency successfully. These are the references. This is my team, without the help of whom nothing more is possible. And I would like to especially thank our Zedemet, Dr. Sadiq sir, for his constant guidance and motivation. Thank you.
Thank you, Dr. Genial. Very promising results in hypothyroidism. And I think this was one of the best cases in discussion of hypothyroidism till now. So I will like to ask the views of Rahul sir now. Rahul sir.
Original, excellent presentation, nice way of data compilation. I have one query that the mean of day 1 TSH is near about 8, was near about 8, right, before starting the treatment. So can't we call it as a subclinical hypothyroidism?
Sir, actually, what was observed was in certain cases, the TSH levels were even below normal. They were like around 0.2, 0.3, because the patient was under heavy thyronome dosages. So I started with tapering then and there itself. And in some cases, since the patient was not on medication at all, the TSH level was very high. So the mean sort of came out to be into this range. Hence, I haven't termed it as subclinical. They were all clinically.
Yeah. Any patient who was naive to thyroxine and you started your treatment and his or her TSH levels came down without taking any help of a thyroxine?
Yes, sir. The case that I told you about, the patient who was not on medication previously, she had been advised by a doctor to take thyroxine, but after taking thyroxine, she was feeling gastric effects, side effects of the taking thyroxine, and hence she stopped that, and she came to me via reference of a patient to get the treatment done, and I saw very good results in her. Weight reduction was also good. She reduced around 8 kilos of weight during the tenure of treatment, and we didn't need to start thyroxine for her. Her TSH levels came back to normal. So there was just one notable observation. Like I said, in certain cases, initially I had to look up why TSH was increasing after tapering of thyroxine, whereas T3, T4 remained normal. And I saw that the patient's history was so that they were under some sort of stress also. So I used Nasya oil, and after that, in the rest of the patients, I used Nasya.
Which oil?
Sorry.
Which oil?
Nasya oil.
Vacha.
Yeah, vacha tel siddha nasya oil, and from there on, I started that as an add-on therapy initially from the initial part of treatment, which helped a lot with managing TSH.
Super. So, you give me a good feed to work on. Definitely, I'll work upon that aspect of because hypothyroidism is having a higher prevalence than any other risk factor of heart disease, and it is not included as a risk factor of heart disease, but it could be the risk factor of heart disease because it is also a upadrava parasadato agni. So definitely, it must be having some or other kind of a correlation with the heart disease. And superb work, keep it up. And all the
So
best.
next year I'll come back with a larger sample size for the same study. I promise.
Fantastic promise, doctor.
Yes, superb, ma'am. Yes, superb, ma'am. 2 queries are here. In any case, TPO was performed?
Yes, sir. In one of the cases, ATPO and ATG both were performed and both were high, very high rather. But the patient's BMI was also over 50, very close to 55 in fact. Hence, I didn't exclude her from treatment. I included her and the therapies were carried on as normal. And there was a significant level improvement in the ATG and ATPO levels also in that patient after treatment.
Okay, that's great. That's great. And the next one thing more, how long history all the patients were having of hypothyroidism?
So one of the patients was newly diagnosed, the one who was not taking any medication for hypothyroid. Rest all the patients had history of 5 years to 7 years.
Superb, superb, awesome. This was a unique case again in the last 3 to 4 days, and this is again on the presentation of hypothyroidism, and here is some good results. So keep it up, ma'am. Next time we will meet again with higher sample size. Okay, superb. All the best.
So now I move on to the next presenter. Thank you, Dr. Jinal. We are moving on to Dr. Dikshita from Baroda, and I will request Sadik sir to kindly share a presentation. Yes, Dr. Dikshita.
Am I audible, sir?
Yes.
Hello.
Yes, ma'am.
Hello.
You're audible, ma'am.
Okay. Hello, everyone. I'm Dr. Dikshita Zala, and today I'm going to present a single case study. Sir, can you please share my slide?
Yes, Sadik sir is sharing the screen.
Sadik is trying to share your presentation.
So we are at the latter stages of this cardiology symposium. Just a minute, and then we'll be starting with this fantastic presentation. Just 3 more presenters left after this presentation. So guys, please hold on, and we are going to see some fantastic case presentations to be done. Yes, we can see some fantastic comments and feedbacks in the chat box. One of the best presentation, Dr. Jinal. Dr. Manisha Singh has appreciated your presentation.
As expected, Dr. Omkar, this young generation doctors from the Madhya Pradesh and Gujarat, they are giving their best, and they are sharing a new aspect of management in clinical cardiology. So it's really wonderful and made me happy.
And the young brigade of Karnataka is all set to present after this presentation. Waiting since ages now.
If there is some technical problem, can we move on to the next presenter while to Sadik and
no worries. Dr. Dikshita, we'll move on after, and we'll take you after the next presenter. So meanwhile,
okay,
I'll have to mute you. And Sadik sir, can you please hold this screen sharing? There seems to be some problem. Yeah. Okay, so now we'll move on to our next presenter from Karnataka, Dr. Nishita. Basappa, who is from Banashankari, Bangalore, and the topic of presentation is role of weight management on blood pressure in obese patients, a comparative study. So Dr. Nishita, I'm going to spotlight you. Yes, ma'am.
A very good evening to each one of you present in the symposium. So first and foremost, I just want to make a small correction. One is I have changed the title of my presentation actually. So it is role of obesity. It's just a single case study which I'm presenting today. So I'll just share my. Is it visible?
You need to share the screen, ma'am. There's a button at the bottom of Zoom. Share screen. You need to click.
Visible now?
No.
No. It says you are screen sharing.
Rahul sir, if you have the presentation with you, can you please help Dr. Nishita?
There are small edits that have done post that actually. So I'll retry.
So what we can do, Dr. Nishita, you send me your presentation, new presentation across while if the next presenter is ready, we will move on to the next presenter. You just send me across your presentation.
Okay.
No worries. We are moving on to our next presenter, Dr. Sangeeta Khanje ma'am from Belgaum and Hari Mandir Clinic, Belgaum, and her topic of presentation is effectiveness of low carb diet and reversal of diabetes and chronic kidney disease. Very nice topic. Sangeeta ma'am, I'm going to spotlight you.
Good evening, sir.
Good evening, ma'am. You need to start your screen sharing and that too on presentation mode.
Okay. Share. Visible, sir?
Yes, ma'am. You just have to start the slideshow.
Slideshow. Visible, sir? Audible, sir?
Yes, ma'am.
Myself, Dr. Sangeeta Khanje. Good evening to all. I am working as a clinic head in Hari Mandir Clinic, Belgaum since 3 years. My today's research topic is effectiveness of low carb dieting, reversal of diabetes and chronic kidney diseases. 81 years patient came with known case of DM, HTN, obesity, CKD, and BPH. DM since 1 year, HTN since 5 years, obesity since 20 years, CKD, grade renal, medical renal disease, and BPH diagnosed by his nephrologist since 6 months. Mechanism of obesity and pathogenesis of diabetes related to kidney disease. थोड़ा सा मैंने ये इलाबरेट किया है. ओबेसिटी में सब इन्फ्लामेटरी मार्कर्स बढ़ने के वजह से सिस्टमेटिक इन्फ्लामेशन, रास एक्टिवेशन और सिंपैथेटिक एक्टिवेशन बढ़ने के वजह से इंसुलिन रेजिस्टेंस और लेप्टिन रेजिस्टेंस बढ़ जाता है और उसके वजह से एंडोथेलियल डिसफंक्शन के होने के बाद ऑक्सीडेटिव स्ट्रेस भी बढ़ जाता है और हाइपरग्लाइसेमिया, हाइपरटेंशन होने के कारण ग्लोमेरुलर हाइपर इन्फिल्ट्रेशन होने के बाद ओबेसिटी और डायबिटीज रिलेटेड नेफ्रोपैथीज में पेशेंट लैंड अप इनटू एंड स्टेज रीनल डिसीज, जिसमें उसका यूरिन आउटपुट और जीएफआर भी लो हो जाता है और सिस्टमेटिक कॉम्प्लिकेशन भी दिखने लगते हैं. मेरे पास जब पेशेंट आया तो बहुत सारे सिम्टम लेके आया था क्योंकि एल्डरली पेशेंट था. तो मेन इनका कंसर्न था डिस्निया ऑन एक्सर्शन, वेट गेन बहुत ज्यादा था और पीटिंग इडिमा बहुत ज्यादा था और जो मिक्सचुरेशन से रिलेटेड इश्यूज थे, अर्जेंसी मिक्सचुरेशन, ड्रिबलिंग और एक कॉन्स्टिपेशन और ये डाइजेशन इश्यू भी थे और सीवियर नी पेन. ये मेन सिम्टम्स के साथ मेरे पास पेशेंट आए थे. तो मैंने पहले डिफरेंशियल डायग्नोसिस करने के क्योंकि सभी लक्षण CHF और CKD दोनों के मिक्स लग रहे थे, तो मैंने सभी इन्वेस्टिगेशंस किए। डे 1 की रिपोर्ट्स HbA1c 6% था, टोटल कोलेस्ट्रॉल 194, ट्राइग्लिसराइड 125, LDL HDL विद इन नॉर्मल लिमिट्स, सीरम क्रिएट 2.1 था और BUN 14.48, यूरिक एसिड 8.1, EGFR 60 था और थायराइड प्रोफाइल, LFT, सीरम इलेक्ट्रोलाइट ए रिपोर्ट नॉर्मल थे। फिर भी मैंने उनके 2D इको किए, तो 2D इको का रिपोर्ट एब्सोल्युटली नॉर्मल आया और USG एब्डो का रिपोर्ट स्मॉल राइट रीनल कैल्कुला, BPH और माइल्ड फैटी लिवर इस तरह से आया। तो ये सब देखने के बाद मुझे पहले ऐसे लगा कि प्रमेह और ओबेसिटी और HDN ये तीनों का कॉम्प्लिकेशन बढ़ के वो CKD में लैंड अप हुआ था। तो मेरा पहला प्रमेय का हेतु था जो क्लेद है, तो पहले मुझे क्लेद कम करना था, तो मैंने ये अपतर्पण करने के लिए सोचा और मैंने ट्रीटमेंट हमारी कॉम्प्रिहेंसिव डायबिटिक केयर थी उन्हें सजेस्ट की। उसमें 20 एडवांस्ड पंचकर्मा थेरेपीज आते हैं और 3 प्रमेय डाइट किट आते हैं। 3 प्रमेय डाइट का रोल था कि मुझे लो कार्ब डाइट देना था जो रिसर्च बेस्ड है, जो उसके प्रोटीन पे भी कंट्रोल लाए और उसे किडनी को भी अफेक्ट ना करे। तो मैंने सजेस्ट किया उनके लिए 3 प्रमेय डाइट किट्स और स्नेहन के लिए जो हमारे वेजो प्रोटेक्टिव ट्रीटमेंट है पंचकर्मा की, उसकी वजह से जो वेजो प्रोटेक्शन मतलब वेस्कुलर टोन बढ़ जाता है और सिंपैथेटिक एक्टिवेशन कम होके मेनली मसल इन्फ्लामेशन कम होने की वजह से ग्लूकोज अपटेक बढ़ने में मदद हो जाती है। उसके बाद मैंने स्वेदन के लिए दशमूल काढ़ा यूज किया जो उनके किडनी का लोड कम करे, जो फ्लूइड रिटेंशन और एक्सेस फ्लूइड रिटेंशन और सॉल्ट रिटेंशन था वो कम करे। और उसके बाद बस्ती जिसमें गुड़मार, दारू हृदय, यष्टि मधु था जो सभी बीटा सेल एक्टिवेशन कर रहे थे और इंसुलिन सेंसिटिविटी बढ़ाने में हेल्प कर रहे थे। जब मैंने ये सभी ट्रीटमेंट पंचकर्मा और ये किए तो उसमें काउंसलिंग का बहुत बड़ा रोल था, क्योंकि एल्डरली पेशेंट था तो फैमिली काउंसलिंग का मेन रोल था, क्योंकि फैमिली एंगेजमेंट थ्रू आउट द ट्रीटमेंट मुझे नेसेसरी था, क्योंकि ब्लड डाइट कंप्लायंस और पंचकर्मा कंप्लायंस भी उतना ही जरूरी था। इसलिए मैंने रिपीटेडली फैमिली का काउंसलिंग किया। उसकी वजह से डाइट और थोड़े से एक्सरसाइज में एज की वजह से थोड़े मैंने जैसे उनकी फ्लेक्सिबिलिटी बढ़ी, वेट लॉस हुआ, तब थोड़ा एक्सरसाइज में चेंजेस करती गई। ये आफ्टर 90 फर्स्ट डे और 90 डेज में इंप्रूवमेंट्स ऐसे दिखे। फर्स्ट डे उनका वेट 82 kg था जो 5.1 हुआ, जो अप्रोक्सीमेटली 17 kg वेट लॉस था। जो BMI में 30.8 था जो 24.5 तक गया और एब्डोमिनल गर्थ था 114 to 94 गया, जो मेरे GTT पास करने में, जो एब्डोमिनल ओबेसिटी थी या विसरल फैट कम करने में एक बहुत कारगर साबित हुआ और विद इन 90 डेज में उन पेशेंट की GTT निगेटिव आई, पास हुआ। आफ्टर 90 डेज मैंने उनके फिर से रिपोर्ट किए। पहले दिन का BP में थोड़े ज्यादा था 147/68, आफ्टर 90 डेज 118/67, HbA1c 5.1 हुआ, कोलेस्ट्रॉल लेवल सभी नॉर्मल थे। सीरम क्रिएट में ड्रास्टिकली चेंजेस दिखे, 2.1 से 0.95 में गया, यूरिक एसिड भी कम हो गया और EGFR में 60 to 74 गया। तो ये मेरे डिसीज का प्रोग्रेशन कम करने में बहुत मदद हुई। उन्हें पहले एलोपैथी मेडिसिन स्टैटिन पे थे, लैसिक्स था, सिनारजिन, फ्राजोसिन, टैमिसोलाइन, ये सब रिगार्डिंग टू नेफ्रोलॉजिस्ट ने सजेस्ट किए हुए ड्रग्स थे। तो डायबिटिक ड्रग था उनका GP1 जिसमें ग्लिमिपिराइड और मेटफॉर्मिन था, वो पूरा कम हुआ। प्राजोसिन का डोज पहले BD था, स्पाइरोलैक्टिन का भी डोज BD था, वो भी रिड्यूस कंप्लीटली बंद हो गया। अभी वो सिनारजिन, प्राजोसिन और टामिसोलिन पे ले रहे हैं अभी। मेरे सभी ट्रीटमेंट का मेन फोकस था कि पॉलीहल्बर मेडिसिन, ये मेरे स्टार्ट प्रोडक्ट थे, उनमें उनकी जो पैथोलॉजी रिवर्स करने में बहुत मदद हुई, क्योंकि प्रमेद में क्लेद है और जो मेददुष्टि थी और आयुर्वेदा में बताया है कि रक्त और मेद का प्रसादभूत अंग ही मेद से वृक्क की निर्मित होती है। तो मुझे वृक्क दोष मूत्र स्रोतस पे काम करना है तो पहले मेदोदुष्टि कम करनी पड़ेगी। तो उसमें मैंने शुगर के लिए BAH दिया था जिसमें बनामा, हरिद्रा, अमल की जो इंसुलिन सेंसिटिविटी बढ़ाने में और एंटी इन्फ्लामेटरी मार्कर्स, एंटी इन्फ्लामेटरी काम उसका बहुत अच्छा था। मेरा स्टार प्रोडक्ट था एनकेजी चूर्ण, जो क्लेद कम करने में और मूत्र पाचन करने में बहुत हेल्पफुल हुआ। और दूसरा अमारी ऑयल का मैंने हफ्ते में एक बार 50 ml का विरेचन दिया था और डेली 5 ml रात को उनको लेने के लिए बोला था। इसके लिए मुझे हिपेटिक क्लियरेंस भी अच्छा हुआ और जो फ्लूइड लोड था उनके किडनी पर सा तो वो भी कम हुआ। पुनूरा और एचेट का रोल, एचेट मतलब हिंगवाष्टक चूर्ण, मुझे इस पेशेंट में दीपन पाचन करना बहुत जरूरी था, इसलिए मैंने, और वो मूत्र स्रोतस पे भी अच्छा काम करता है, इसलिए मैंने एचेट हिंगवाष्टक चूर्ण मेरा ड्रग ऑफ चॉइस था। और पुनूरा मूत्र पाचन और डायरेक्ट जैसे दोनों कर्म में मुझे हेल्पगर साबित हो। तो इस पूरे स्टडी में मेरा कंक्लूजन था, while obesity may promote CKD through hypertension and type 2 diabetes, it may also contribute to CKD by stimulating renal hyperfiltration, glomerular hypertrophy, and systemic inflammation. To determine the effect of low carbohydrate diet restriction in addition to standard low protein diet in patients with underlying diabetic kidney disease, the intervention was safe with significant improvements in glycemic control, anthropometric measurements, including abdominal adiposity and interleukin-6. Renal outcomes were not affected. This would further support of the effectiveness of low carbohydrate diet is an important part of the management of type 2 diabetes. Therefore, managing obesity could help prevent or manage CKD. उसके रिजल्ट्स ऐसे दिखने लगे मुझे कि सीकेडी और डायबिटीज हमें पता है कि प्रोग्रेसिव डिसीज है, तो उनका 17 kg वेट लॉस होना और एब्डोमिनल गर्थ में 20 सेंटीमीटर से लॉस होना, यही मेरे विसरल फैट कम करने के लिए और वो जो हमारे मेद धातु की दुष्टि कम करने में जो हेल्प हुई, उसके वजह से सीकेडी का प्रोग्रेशन स्टॉप हुआ और उसका जो एल्डरली एज की वजह से फिजिकल डिपेंडेंसी थी फैमिली पे वो भी कम हुई और फाइनेंशियल स्ट्रेस भी कम हुआ। इसके लिए मैंने ये सभी रेफरेंसेस यूज किए थे। थैंक यू टू रोहित सर, अमीन सर, प्रवीण सर, स्पेशल थैंक्स टू नीलेश सर, राहुल सर, ओंकार सर एंड माय टीम। थैंक यू सर।
Thank you so much, Sangeeta ma'am. It was a fantastic presentation. Over to you, Rahul sir.
I'll request Dr. Nilesh to especially comment here because Dr. Sangeeta, you have treated this patient with all the courage. Patient was CKD, patient was having the diabetes, and yet you given a very wonderful result, and this really needs expert support. So I think Dr. Nilesh, you are the best person who should comment on this presentation.
Yes, sir. Frankly to speak, Sangeeta madam's stringent monitoring was the most key. With every follow-up, we had to discuss about how should we manage for further, and timely investigation was one of the most important thing, because whenever we are treating patients with chronic kidney disease, it is highly important to look after EGFR or serum creatinine or urea levels, which gives us the idea in what way we should proceed. And that was very promptly done by Dr. Sangeeta madam. Being one of the most experienced doctor, she had hands-on on handling the critical patient. So congratulations, Sangeeta madam, and continue your best work.
Thank you, sir, for your guidance.
So Ranjit sir, your comments on this, please.
Yes, it's again a new case, preventive as well as curative aspect. So weight management is the key of all these CKD and diabetes. So this is a unique case again, ma'am. Congratulations and keep going on. Thank you. All the best.
Thank you. Thank you, sir.
Thank you. And now we move on to our next presenter, Dr. Nishita. Yes, Dr. Nishita, if you can share your screen.
Yes, Dr. Nilesh is very kind. He's doing that for me.
Yes, Nilesh sir. Okay, 1 minute. Fine. Yes, thank you, sir. Yes, ma'am.
Yes, again, welcoming all of you for this cardiology symposium, and my hearty welcome to the two chairpersons of today, Dr. Rahul Mandole sir and Dr. Ranjan Naran sir, and our host for the past 4 days, Dr. Omkar sir, and my zonal medical head, Dr. Nilesh sir, all of you for being so supportive. Before I start off with my presentation, being an experience of just 1.5 years with my clinic, having newly started in Bangalore, I do definitely have a very few data collection, and with whatever knowledge I have, and I want to confess here today, and I'm taking this opportunity to do that. Well, today's topic is role of weight reduction in the management of hypertension. It's just a case study. And next slide, please.
Nilesh, next slide, please.
So we all know that hypertension has definitely become a big stress, in fact, for the medical fraternity to handle hypertension, because it's booming and it's early onset, even as in 20 years we are noticing today. So according to the statistics, it says about 33% of the urban and 25% of the rural Indians are hypertensive. And in that, if we look, okay, in that 65% to 75% of the essential hypertension is because of obesity. So considering this, so weight reduction becomes a major prime factor that we have to concentrate in hypertensive patients. So with prolonged obesity, we also know that it leads to different organ damages, and hypertension is one of it. And hypertension, again, in future can lead to many complications. So to avoid all the complications from hypertension, it is very essential to take charge and control hypertension. And unfortunately, the modern system do not have very great anti-obesity drugs developed by them. They do not have any methodology except lifestyle corrections with them, or it is the bariatric surgery that they can insist on. Apart from that, they do not have a very safe methodology to handle obesity and also to prevent other diseases caused by obesity. Next slide, please. So, and also the major adverse effects these antihypertensive drugs that can create on one person for using it for years together. And today, Dr. Rohit Sani sir was also making the point that once a person is considered as hypertensive, he has to live with that title forever in his life. So this can be changed, and that is how we are going to see in this present presentation. And here, these are the many complications or adverse effects that can happen by taking antihypertensive drugs. So it's essential to avoid these. It is important to, cut down on this hypertension disease rate in the society. Next slide, please. So the main objective is that to evaluate the effect of Madhavbaug's anti-obesity treatment in the management of hypertension through a case study. So the patient details is that he's a man, elderly man or middle-aged man of 44 years, and his location is from Bangalore, and he had no addictions. He had a very good lifestyle. He had history of hypertension since 8 years, and he was on medication Telma 40 on an OD dose. And his main concern of approaching Madhavbaug was to lose weight, which was gradually gained over the years. So the treatment given, as usual, the anti-obesity treatment of Madhavbaug was chosen here. That is, centripetal oleation was done through neem oil, and then Swedana Karma or vasodilation was done through Dashamula Kada, and enema or PRDA was done through NKG Kwata, which consists of Nagavali Kulatta and Gudmar. And oral intervention that was done was 800 calorie diet was maintained. That was Swastiam diet box was given for 3 months, because it is a 800 calorie diet and a proven high fiber diet. And capsule Golek was given in a dose of 2 BD for 3 months, and Aluri liquid was given 10 ml BD for 3 months, and Amari Churna was given 3 grams BD for 3 months. So this was the results that we observed in him. In a span of 3 months, he lost almost nearly 16 kgs of his weight, and his BMI dipped from 31.97 to 26.09, and his heart rate in office, anytime when he visited our clinic, it was around 87 to 90, and later it dipped anywhere between 63 to 70. And his abdominal girth from 115 centimeter, he dipped it to 95 centimeters, and total cholesterol, which was before starting the treatment 182 mg per DL came down to the normal ratio of 132, and total triglycerides, which was 160 mg before the treatment, came down to its normal value of 98. HDL from 40, it went up to 47, which was a good improvement. And then his LDL, it was 110 and came below 100, and it was 65. And his HbA1c, this was actually noted later after we got the blood investigation done, that he was in a pre-diabetic range. His HbA1c was 6%, but after our therapy, it came down to 5.1%. And his blood pressure with the medication, it was 130/80 in office. Whenever he came here, this was his average reading when we took, but later it had dipped to 120/80 or even below that, as he has recorded at his home. And now he is on no medication and Telma has been completely stopped. Next slide, sir. So these are his reports. Next slide. So now the question arises here is that I haven't managed anything except managing his obesity. So once it is hypertension, we always tend to manage their stress. We tend to manage, pranayama. We do definitely advise to calm down, to reduce on their anxiety, and all of these factors is involved. But I specifically chose this case to present here because we do see these changes in a cardiac patient also after we putting them on reverse diet kit or putting them on Prameha diet kit. We definitely see these blood pressure changes. But there we generally also tend to add some Arudhya drugs or vasodilating drugs, or we also may choose some medications like Kunura, which can help as a diuretic. But here it is purely anti-obesity treatment that has been given without choosing any medication which in any way can act on the cardiovascular system or on the renal system. So that is why this case has been chosen. So here I want to highlight what is this relation between obesity and hypertension. Why is it so important? Well, the major thing is that, as we all know, it definitely increases the stress on the cardiac output when a person is obese. So the venous overload increases. That way, again, there is arterial pressure which is building up. So this is one concept. The other thing is that we are noticing only the subcutaneous fat in this person. We tend to forget the visceral fat in many of them. So today we also know about a concept of TOFI, where we say thin outside, fat inside. So there is a lot of visceral adiposity in a person. So even in thin patients, I think we need to work on their visceral fat to understand why their hypertension is increasing. So considering that, here it says that there are researchers which say that the fat around the kidneys and on the kidney is actually putting excess pressure on the kidneys and impairing the renal pressure natriuresis. So there is reabsorption of sodium. So even if we put a patient on low sodium diet, with whatever little sodium he's taking, the body is again reabsorbing that sodium. So and giving them high potassium diet will not make much of a difference.
Request you to come to the conclusion.
So with this, there is also leptin resistance in this person, which is leading to building up of endothelial dysfunction and various factors in the body. Next slide, please. So major metabolic disorders are involved in an obese patient. So it is actually in a state of inflammation. So obese patient is having inflammation in him, and reducing this inflammation itself can take care of many of the factors that is going on in him. Next slide, please. So how has our therapy helped? Now this becomes a big question mark. You've just treated obesity, and how did the hypertension come to control? So that becomes a big question mark. If you see all our diet, therapy, and the exercise which was suggested to him, which is 45 minutes of walk, which we consider as Niragni Svedana, everything is targeted towards Medo Hara Chikitsa. Everything is helping him improving his Medo Dhatvagni, Deepana, Pachana has been done in this 3 good whole month. Next slide, please. So if we look into this concept of Vrukka, what does Vrukka, Mula of Vrukka says that Rakta Medaha Prasadat Vrukkaho. So if the Medo Dhatu and Rakta Dhatu is well nourished, then only it can nourish organ kidney.
Extremely sorry. We can understand you have so much things to say, but we have to stick to the timeline. It's 8 minutes and we are already completed the timeline of 8 minutes. You have to come to the conclusion slide and you have to sum up your presentation. I'm extremely sorry.
Yes, sir. So Vrukka Mula also we know it is Medo Vahedve Tayor Mulaha Vrukkaha. So basically managing Medo Dhatu here is correcting the underlying problem, and it is also helping in improving the renal vasculature, renal function, and also improving the kidneys, which is considered to be the main organ in maintaining the hypertension according to modern theory. So targeting only Medo Dhatu itself can give us wonderful results. So maintaining BMI between 24-26, and also in patients who have actually undergone, who are lean built, even in them looking into their visceral fat and targeting that will help in controlling hypertension. Thank you so much.
Super and fabulous style of presentation, Dr. Nishita. There was so much to be discussed in this case, and you really nailed the head. So fantastic, fantastic presentation. Rahul sir, your comments on this.
Actually, Dr. Nishita, sorry to interrupt you in between, but because you was discussing very important part, but we have to stick to the time. The most good part what I felt is you reduce down the weight of your patient and you manage the blood pressure, right? The first thing, and with help of the leptin resistance that you have reduced. My question is, what kind of obesity was that?
It is the first stage of obesity. So like according to modern concept, if we say more than 30 is when they consider it as stage 1 obesity, BMI. Until then it's like overweight.
Yes. I'm not asking about the grade of BMI. It's the type of obesity. That means this was, I guess it was a centralized obesity.
No, sir. He was actually overall obese, but centrally more. Yeah.
So basically, the pressure increases if there is a fat accumulation in a central trunk part. If many obese patients you must have been seeing, their blood pressure is absolutely normal. They are very obese, but their blood pressure is absolutely normal because the fat is equally distributed inside in their body. But when the fat is not equally distributed and it is centrally located, at that point the pressure increases. So that part only, what type of obesity has to be mentioned. This was my suggestion, not a query, this is a suggestion. But overall, a superb presentation, and I think we should keep your one separate session about your thought process, and definitely Dr. Omkar will do that. But all the best for your future presentation and practice.
Yes, sir. So just to make a small note there, I think it is more about visceral obesity. So even if it is centralized obesity or peripheral distribution of the fat, it is more of subcutaneous fat that we are talking about. But we fail to analyze what extent it would have impacted on their viscera. The visceral adiposity is what we have to more so observe, is what I personally feel.
Could be.
Dr. Nishita should start some communication classes for all the doctors. It will be of great help to improve the soft skills, ma'am.
Thank you, sir.
Excellent presentation, Dr. Nishita, ma'am. Keep it up. All the best.
Thank you, sir.
Nilesh, sir.
And the selection of the case was quite right, because she was in the dilemma which case to take. So fantastic, madam. Excellent.
Thank you, sir.
Thank you. And now we'll move on to our next presenter. Our next presenter is Dr. Vidya from College Road, Belgaum. And her topic of presentation is effect of counseling on blood pressure control and HbA1c. So I'll be giving the spotlight to Dr. Vidya. Just a minute. Is Dr. Vidya?
Yes, sir.
And you can start with your screen sharing now.
Yes, sir.
Guys, please hold on. Last two presenters, Dr. Vidya and Dr. Dikshita, left, and we want all of you to attend till the end. Dr. Vidya, we have 8 minutes for you. Please click on the presentation mode. Yes, perfect.
Good evening, sir. Myself, Dr. Vidya VR. आज मेरा टॉपिक है effect of counseling on hypertension and diabetes, single case study. Introduction. Hypertension is one of the most important public health problems and considered as the leading risk factor for global mortality. Hypertension is currently responsible for 13% of deaths worldwide and is a major risk factor in developing cardiovascular disease affecting 25% of adults. And Ayurveda has a potential to treat stress, diabetes, and hypertension. So that the present study was conducted to evaluate the role of Ayurvedic-based hypertension management with the help of diet and exercise. Aim and objective: to reduce blood pressure and sugar levels of the patient and to rectify the complaints. Here I took a case of 40 years male. His complaints was diabetes था उनको और dyspnea grade 1, fatigue, depression और dyslipidemia था, indigestion, insomnia और obesity, palpitation, burning soul, raised blood sugar levels. इन्वेस्टिगेशन मैंने एडवाइस किया था शुरू में एबीपीएम और स्ट्रेस टेस्ट, और ब्लड इन्वेस्टिगेशंस में उनको इलेक्ट्रोलाइट्स एडवाइस किया था जो नॉर्मल थे, क्रिएटिनिन जो एडवाइस किया था वो भी नॉर्मल था, एंड लिपिड प्रोफाइल एंड HbA1c, एंड उनका सब ब्लड रिपोर्ट्स लेके मैंने ऐसे कंक्लूजन किया था कि डायग्नोसिस में हाइपरटेंशन विद अनकंट्रोल्ड शुगर लेवल्स एंड दस ट्रीटेड बाय हाइपरटेंशन मैनेजमेंट. सो इधर मैंने पेशेंट जब आए थे 3-4 दिन पहले, तब मैंने उनका बीपी वगैरह शुगर वगैरह चेक किया था. शुगर लेवल्स आर हाई एंड अलोंग विद दैट बीपी रीडिंग्स आर आल्सो हाई. सो दैट मैंने एबीपीएम टेस्ट के लिए एडवाइस किया था, तो एबीपीएम लगाए थे हम लोग. So using ABPM, we can confirm that the diagnosis of hypertension, whether it is true hypertension, white coat hypertension, or masked hypertension. Blood pressure is a dynamic parameter and varies depending on physical activity or mental status. During ABPM, repeated BP readings are recorded for 24 hours. During daytime, it records BP after 30 minutes, and during sleep time, it records hourly. And many other methodology with confirmation of diagnosis, hypertension management started as snehana centripetal oleation, आरभ्यंग ऑयल से किया था. 30 to 35 minutes उनका स्नेहन हुआ था. Can be useful for reducing sympathetic overstimulation and improving vascular tone. स्वेदना thermovasodilatation दशमूल खाड़ा से किया था और 15 to 20 minutes था. Swedana can be reduce the water and sodium retention and thus reduces stress on vascular endothelium and viscosity of blood. Shirodara जटामांसी वात से किया था. 15 to 20 minutes शिरोधारा किया था उनको. The treatment directly and immediately calms and relaxes and has a cleansing effect on mind and nerves. 21 therapies उनको हर हफ्ते के हिसाब से हमने किया था सर. Intervention इधर ऐसा था कि education with counseling about knowledge, motivation and trust and family support is effective in increasing compliance. The counseling session was conducted for the patient on daily basis in the clinic for 20 minutes. Twice a day. During the 20-minute session, meditation and cardio session were undergone by patient. The patient was advised to do meditation and pranayama, anulom vilom, twice a day. Also took the follow-up of patient through MIB Pulse app, which comprises of exercise, yoga, meditation, and diet. Diet counseling were done for 2 months. माधवबाग मेडिसिन इधर मैंने यूज किया था. GHA आफ्टर फूड, गोक्षुर, हरिद्र, आमलकी इसका कंटेंट है. आर्टिल, ब्राह्मी और शुंठी इसका कंटेंट है. और सेरेना, ब्राह्मी, शंखपुष्पी, जटामांसी, अजवाइन इसका कंटेंट है. और गोघृत का स्नेहपाना किया था और विरेचन के लिए ना. पहले जब वो शुरू किए थे सर ट्रीटमेंट, तब GHA, आर्टिल, सेरेना था. अभी उनको सिर्फ GHA और आर्टिल चालू है. और डाइट एडवाइस किया था उनको. 3 गो बीपी का डाइट बॉक्स दिया था मैंने. हाई फाइबर फूड एडवाइस किया था. लो इन सोडियम, हाई पोटेशियम, हाई प्रोटीन पाउडर और लो कार्बोहाइड्रेट फूड एंड यूज ऑफ सेलरी सॉल्ट. reduce intake of oily, salty sour and spicy food items. एक्सरसाइज मैंने एडवाइस किया था उनको 40 मिनट्स ब्रिस्क वॉक, स्ट्रेंथ ट्रेनिंग एक्सरसाइजेस विथ डंबल्स फॉर 20 मिनट्स, योगासन में ताड़ासन, वज्रासन, भुजंगासन, मकरासन, शवासन, गोमुखासन एंड 12 साइकिल्स ऑफ सूर्य नमस्कार कंपल्सरी किया था उनको. और प्राणायाम, ब्राह्मरी भस्त्रिका, अनुलोम विलोम एडवाइस किया था. गुड क्वांटिटी ऑफ फैट्स, ध्यान सुबह, दोपहर को और शाम को कंपल्सरी किया था. और रिजल्ट्स ऐसे है कि वाइटल्स में उनका जब एनरोल हुए थे सर तब वेट उनका ऐसे था कि 86.3, अभी का 27/12 में 74 था. और BMI 29.86, BMI after 26.64, abdominal girth was 109, now it is actually 93. BP जब पहले आए थे तब 140/90 था, अभी 126/76. अभी HbA1c उनका फर्स्ट टाइम जब किए थे हम लोग फर्स्ट मंथ में जब एनरोल हो रहे थे तब 7.6 था. 1 month आफ्टर डाइट बॉक्स एंड एक्सरसाइज सेशंस उनका 5.7 आया था. उनका GTT कंडक्ट किया था तो GTT नेगेटिव आया था. लिपिड प्रोफाइल था 24/8 को.
Last 2 minutes, please.
Yes, sir. Triglyceride levels 177. Sorry, total cholesterol levels 177. Triglyceride levels 262. HDL levels 31 and LDL level 94. And 8 month के बाद हमने फिर से लिपिड चेक किया. टोटल कोलेस्ट्रॉल 154, ट्राइग्लिसराइड 106, HDL 32 एंड LDL 104. और TMT भी कराया था सर मैंने उनको जब एनरोल हुए थे. टाइम जब 10 मिनट 13 सेकंड ही चले थे. और उनका VO2 max था 19.6 और BP था 140/90. और 27/12 को किया हमने तो 15 मिनट चले थे. VO2 max इज अभी भी 15 मिनट ही चलते 36 एंड अभी BP 130/90. और ECG नॉर्मल था सर, स्ट्रेस ECG भी. और उनका ABPM रिपोर्ट था 38/21 को. ऑल डे एवरेज था 137/85, डे एवरेज था 137/87, नाइट एवरेज था 138/87. हाइपरटेंशन स्टेज था स्टेज 1. व्हाइट कोट इफेक्ट था प्रेजेंट. डिपिंग स्टेटस इनएडिक्वेट. मॉर्निंग सर्ज एब्सेंट. 23/10 को किया हमने. ऑल डे BP एवरेज 112/75, डे एवरेज 115/75, 115/78, नाइट एवरेज 97/63. और हाइपरटेंशन स्टेज नील था. व्हाइट कोट इफेक्ट एब्सेंट एंड डिपिंग स्टेटस एडिक्वेट एंड मॉर्निंग सर्ज एब्सेंट. अभी ये रिपोर्ट है सर ABPM का. Reasons for improvement: strict monitoring of blood sugar levels and BP readings with the help of MIB app, MIB Pulse app. Timely investigations. Timely investigations में मैंने लिपिड कराया था सर उनका और स्ट्रेस टेस्ट भी कराया था, क्रिएट भी कराया था. लाइफस्टाइल मॉडिफिकेशंस किए थे. पंचकर्मा मैनेजमेंट, काउंसलिंग एंड मॉरल सपोर्ट, टाइमली स्लीपिंग एंड अवेकनिंग, हेल्दी हैबिट्स. और कंक्लूजन, with the help of above observation, it can be concluded that Panchakarma diet and counseling and exercises help in the reduction of blood pressures, HbA1c, and also helps in stress management. मेरा स्पेशल थैंक यू मैं कहना चाहूँगी मेरे ZMH को, नीलेश सर, थैंक यू सो मच. एंड ऑल्सो रोहित साने सर, गुरुदत्त सर, राहुल मंडोले सर, एंड ओमकार सर, एंड माई टीम. Thank you, sir.
Fantastic presentation.
Thank you, sir.
Fantastic results, Dr. Sangeeta. Directly coming on to Dr. Rahul, your views on this, please.
Omkar sir, your name was not there in the list.
मैं बोलने वाला था, but that's fine. She mentioned it.
Sorry, sir. वो actually सुबह ही इधर आने के बाद मैंने ऐड किया.
Yes, sir.
Okay. Anyways, Dr. Vidya, excellent presentation, and you are showing the results with help of a most advanced investigation tool, and that is ambulatory blood pressure. So
Yes.
average day BP compared to the before and after, and it's superb change. It's very rarely people can see such change in the ambulatory blood pressure. And the patient who was a white coat hypertension, and after that that change is not seen, that means your counseling was very effective, that the patient has forget that this is not a clinic now. For
Yes,
him, this is something that he is going and meeting his friend or someone very near one, and this is what a clinician should be, and this is how practice should be done. So excellent. Your title was superb, and it resembles with the results you achieved in your ambulatory blood pressure. So excellent, Dr. Vidya, and all the best.
थैंक यू सर। तो ये सब मेरे ZMX के थ्रू ही पॉसिबल हुआ है।
अनम्यूट कर रहा हूँ। यस नीलेश सर।
कभी आए हैं क्या आपके यहाँ पे बेलगांव?
यस सर, 3 बार अभी आज।
यस नीलेश सर।
Really one of the sincere doctor, and she is really dedicated. As we have seen, NYV person patient का time to time counseling. So she counsels that patient की counseling दिन में 2 बार बुला के किया है. That is a big part, because generally what we see in our practice is that we are unable to give ample of time to our patient. But Dr. Vidya has sincerely given it. RTS, congratulations, madam, and keep up the good work.
Thank you, sir.
Yes, Ranjit sir.
Yes, super presentation, ma'am. With the help of ABPM and with guidance of Nilesh, you have given us such a fantastic case presentation. All the best. Keep it up.
Thank you, sir. Thank you so much.
So guys, we are now moving to the last presentation of this first National Ayurveda Cardiology Symposium powered by Medemy and Knowledge Partners MUHS and MIPC. Our last presenter of this symposium is Dr. Dikshita, and her topic is very interesting. I will like all to please stay till the end. The topic is treating uncontrolled hypothyroid induced muscular dystrophy with Panchakarma. One of the very niche segments. We haven't learned about muscular dystrophy in last 4 days. Now something new is going to come in front of you. So please stay till the end. Yes, Dr. Dikshita, I'm going to spotlight you now. Be prepared and best wishes. Yes, ma'am.
Am I audible, sir?
Perfectly audible.
Hello, everyone. And I would like to thank you, Dr. Rohit Sane, sir, for starting such an amazing organization for all of us. And I would like to thank you all the core team members for giving me this platform. So today I am going to present a single case study, and my objective is treating uncontrolled hypothyroidism induced muscular dystrophy with Panchakarma. Why I particularly choose this case study? I have 2 reasons. First is it's a very unique case, and second, I was shocked at first when this patient came to consultation. I was literally shocked by seeing his CPK levels and thyroid levels, and I had no clue. Okay, what should I do? So I directly called Dr. Praveen sir, and then we started treatment. So next slide, please. Here is the medical history of patient. 65-year-old male patient with the DM, HTN, thyroid dysfunction, and sinus tachycardia from Vadodara. DM and HTN was diagnosed in 2010. Hypothyroidism diagnosed in 2017. And this CPK level and uncontrolled TSH was found in 2019. Next slide, please. So here is the full description of case. 65-year-old male patient Dinesh Ram Khedkar, history of DMHT and hypothyroidism, and complaint of patient was muscular weakness, instability while walking. He cannot even walk. He had no anything else, any problem, and instability to climb stair. Patient के पीछे किसी को रहना पड़ता था. अगर उनको सीढ़ी चढ़नी है, वो अपना पैर खुद नहीं उठा सकते थे. ये उनका मेन कंप्लेंट था. दूसरा था constipation and palpitation. So my assessment of patient musculoskeletal assessment shows reduced tone and power of the muscle. Patient को ये सब क्यों हुआ? उसका एक note है. The patient was not taking any medicine to treat the hypothyroidism. Due to this, his TSH was 300 mLu per liter, and because of high TSH and low T3, T4 level over the 2 years of time period, muscular wasting happened. A patient was very, he was neglecting his TSH level. So this condition happened and it gave rise to CPK levels. So investigation was done, CPK was 1500 and the normal value of CPK is 10 to 120 only. So we suggest first complete thyroid profile. And next slide, please. So my diagnosis was thyrotoxicosis induced muscular dystrophy. Next slide, please. Okay. In a treatment, we divided the treatment in 3 parts: oral medication, diet, and Panchakarma. My main treatment was Panchakarma, in specific Shashti, Shali, Pindashwed, and Niruh and Anuvasan Basti. Diet, I have suggested patient a diet of protein in breakfast and rest normal, because I do not want to reduce the weight of patient. उनको लंघन या कुछ भी नहीं करवाना था, सिर्फ वेट मैनेज करना था, क्योंकि बहुत ज्यादा वात बढ़ गया था थायराइड डिसफंक्शन की वजह से. एंड डेयरी प्रोडक्ट्स मैंने पर्टिकुलरली बंद किए थे जस्ट बिकॉज ऑफ डायबिटीज एंड हाइपरटेंशन. ऑरल मेडिकेशन में सबसे ज्यादा मैंने जो यूज किया था वो अश्वगंधा एक्सट्रैक्ट था एंड एरंडमूल तेल विद द त्रिफला. सो रेस्ट ऑफ मेडिकेशंस दारू हरिद्रा, आमल की हरिद्रा, मुस्ता त्रिकटु एंड कॉम्बिनेशन ऑफ सतावरी, शारीवा, अर्जुन, कामला and combination of Shallaki, Kalmeg and Kumari Asav is been used. Next slide, please. First, I would like to share this. When I called Dr. Praveen sir, he asked me, what is your diagnosis? So I directly told him that it's a muscular dystrophy. So he asked me, and are you an Ayurveda doctor or allopathy? So that sentence really hit me so hard. So then we go on, like I said कि it's a वात व्याधि, muscular dystrophy है, तो maybe वात relation है. फिर सारा ट्रीटमेंट हमने इस तरह से प्लान किया जो वात पे इफेक्ट करे. So initially Ayurveda diagnosis was मांसगत वात. So मांस को हमें अगर वर्धन करना है तो क्या करना है, हमें मांस की पुष्टि कैसे करनी है, तो इसलिए डाइट में हमने प्रोटीन दिया और पंचकर्म में षष्टिशाली, क्योंकि ये मांस को बढ़ाएगा. और साथ में मैंने बस्ती इज अर्ध चिकित्सा, एज अवर आचार्य चरक टोल्ड, कि अगर वात है तो बस्ती है ही, इसलिए मैंने उनको निरूह एंड अनुवासन बस्ती का कॉम्बिनेशन दिया. इनिशियली आई स्टार्टेड विद द ओनली सहचर बस्ती, देन आई एडेड निरूह बस्ती कॉम्बिनेशन ऑफ दशमूल एंड वातारी ऑयल along with the 10 ml of hello sir, am I audible?
Yes ma'am, you're audible.
Okay. Along with the 10 ml of gomutra. So diet was low carbs and high protein diet. Medications I have listed here, and my main, I told star drug is ashwagandha extract, as it is a muscular dystrophy and manshagatavat. Panchkarma and later on I have added the in follow-up changes, I have added the Niru Basti. In exercise I have added the aerobic exercise and strength training, because the tone and the strength of muscle was not so good. And in medication to treat the DEM and palpitation, I have added few medications like Arjun, Shatavari, Shariva and Kamala, and Daru Haridra plus Amalki. In a follow-up monitoring, what we have shown is a muscular skeleton assessment shows the significant improvement in the gait, muscle tone and strength. CPK level was reduced down to 1500 to 400, and that was beyond my imagination. मैंने imagine भी नहीं किया था कि इतना down आएगा. And heart rate was reduced down to 110 to 90. And why this happened? Because it is said कि अपना जो thyroid hormone है वो directly metabolism के साथ तो related है ही, but it's also अपने muscular skeleton system के साथ involved है in each and every muscles अपने body के. तो it also include the heart muscles. Because of that उनका हार्ट अच्छे से पंप नहीं कर रहा था, और शायद उसकी वजह से हार्ट रेट ज्यादा होगा, तभी हमने 2D को नहीं करवाया था, बट दिस वाज माय assumption, एंड मैंने उसके लिए और कुछ नहीं किया था, जस्ट मेडिकेशन ऐड किया था, बट इट केम डाउन टू 90 and TSH was reduced down to 300 to 49, and it was an achievement for me and my patient also. And when it came to 49, we reduced down the dose of thyronome to 175 mg to 150 mg. Next slide, please. Next slide, please, sir.
Sadik sir, next slide, please.
So, sir, at present, there is no treatment known in any system of medicine which has any evident impact on muscular dystrophy. A variety of treatment like the corticosteroid help to manage the symptom of the disease, to improve the standard of living, and to increase the life expectancy. But long-term use of corticosteroid is associated with the significant side effect. The intention of this study is to improve the standard of living and ultimately find the way to treat it. In Ayurveda, muscular dystrophy is a parallel to Vat Vyadhi. Muscular dystrophy can be associated with the Kshayaj Vat Vyadhi with particular condition of Manchagat Vat. Hence, Shashtishali Pinda Swed and Basti Chikitsa is expanded in the condition afflicted by the Vat. In our Shastra, Basti is called as Ardha Chikitsa. Shashtishali Pinda Shved works as a Brahman and a Balya. It provides the Dhatu portion and specify the Vat dosh. Hereby, the purpose of the study to show the probable effect of Shashtishali Pinda Shved helps in slowing down the rate of deterioration. Combination of Niru and Anuvashan was along with the Shashtishali Pinda Shved to treat the disease condition and subside the Vat dosha. Ashwagandha extract is being used to enhance the muscle strength, and Trikatu Musta deals with the metabolic disturbance caused by the hypothyroidism. Next, please. Erindmul is the best Vat dosha shamak dravya, as our Shastra says. So, Erindmul oil is being used to treat the Vata Vyadhi along with the Trifala to specify the Sharva dosh. And combination of Shatavari and Arjun and everything is to treat the sinus tachycardia and Hridaygat Vat. Combination of Kalmeg and Shallaki extract been used because of its hypolipidemic activity and to treat the inflammatory condition. Combination of Daru Haridra and Amalki and Kumari Asav is to be used to treat the metabolic disturbance and Pramay. All of these medicines are selected based on the dosh and Vyadhi condition. Next, please. So the conceptual study shows the better management of muscular dystrophy by the effect of Shashtishali Pindashved and Basti. Although it has poor prognosis, but in the Ayurveda, there is a hope for superior control and slow down the progression of the disease and approach on appropriate outcome. Shashtishali Pindashved and Basti helps increase the efficiency of muscle action and enhance the blood supply, increase the muscle tone and muscle strength, and a proper nourishment of the dhatu. And now this patient is able to walk without any support and climb the stairs. And in a Basti, I have used 10 ml of Go Mutra to treat the or to enhance the Mans Dhatugat Agni. उनका मांस धातु की अग्नि बढ़ाने के लिए ही मैंने गोमूत्र एक्स्ट्रा से डाला था, just 10 ml. And here I conclude my session, my presentation, and thank you very much. Thank you so much, everyone. I'm very this is my very first presentation, so I'm very nervous. Sorry for all the mistakes. And here is my team, and I would like to thank you, Sadik sir, for encouraging me all the time, and all the core team members for your support. Thank you so much.
Thank you so much, Dr. Dikshita. Fantastic presentation, and you have actually ended this the fourth day of this first National Ayurveda Cardiology Symposium with great style. Over to Dr. Rahul Mandole, sir.
Dr. Dikshita, congratulations.
Thank you,
Actually,
sir.
I'm literally speechless when you show all the results. And what I have felt, I don't have any suggestions or any thing to say about your presentation, but what I feel from your presentation, I think many of the Ayurveda physicians, they are treating the patient with the same kind of a philosophy, and they are doing the Shishtishali Pindasvit and Niruha Basti and normal Basti Chikitsa. But they could not able to procure any evidences out of it, and you did it.
Thank you,
And
sir.
this made this this is what is making this presentation very exceptionally special.
Thank you so much, sir.
So we have to we should not leave this methodology ever. Whatever treatment, whatever disease we are treating, try to collect more and more evidences from it, and that because these evidences will make your treatment popular, and what is popularity is you are giving benefit to more patients, right? So there must be so many patients sitting outside Madhavbaug, outside your clinic. They are waiting to get treatment for such and this kind of a treatment, but only you can do that, and because you have all the evidences. So congratulations once again, and keep it up.
Yes, one.
Thank you, sir. Sir, I just would like to share one thing कि अगर हम किसी भी disease को treat कर रहे हैं, definitely we should use modern parameters and everything. It's a technology that we can use, but हमारा diagnosis and हमारा treatment always Ayurveda based होना चाहिए, ताकि हमें exact and accurate result मिल पाए. क्योंकि when we diagnose something like muscular dystrophy, so it's a very limited thing. But when we diagnose it as a Vata Vyadhi or Manshagat Vat particularly, then we have a broad spectrum कि जहाँ पे हम काम कर सकते.
Yes, doctor. Thanks a lot, and we'll like to hear from Dr. Sadiq Khan, sir.
Hello. Yes. So, Dr. Dikshita, such a magical results. I have been. I had the honor of seeing the progress of the patient while the patient was getting treated, and I know how magical it was. So when you first called me to say which case should I present, I think this was the case I remembered, right?
Yes, sir.
Whatever you said, just in these cases, it is another departure from the concept of the entire symposium. A little difference that we had in this case, the treatment was purely based on the Ayurveda. No modern diagnosis was, or actually CPK was just done out of the curiosity, just to mark how much of the change is there. But no further investigation in the diagnostic value was done in the initial phase, so as to not distract or discourage us, right? And we just went ahead with our Ayurvedic treatment, right?
Yes, sir.
And so that is very good approach, which obviously might not work every time, but in this one it worked. And this also bears testimony to one very great factor. This really young doctors that we have seen today, in last 4 days, lot of doctors we have seen, when faced with a challenge which many people would say is impossible to do, they start thinking in a different direction and try to find a way. That was the biggest challenge. I mean, even before another doctor, Dr. Avnish, who had presented, it was his 3rd month in Madhavbaug. That was his first case, and the patient just had an MI about 20-30 days back. Anybody would have got scared to handle that kind of a patient, but he took up the challenge. He called me up to say, what can we do about it? Same with Dikshita. She called up Dr. Praveen sir just to find a way and not run away from the challenge. That is the biggest takeaway from these young people that we can take, to not run away from the challenge and try to just find a way. Ayurveda has a lot of options, and yeah, we can become a first line of treatment if we continue with this thought. Best of luck, Dr. Dikshita.
Thank you so much, sir.
Ranjit sir, your views on this?
Yes, awesome presentation, ma'am. This was such of the unique case in the 4 days. Many times it happens when this is some different kind of case happens or comes to our clinic. We confuse should we take or not. But this is the unique approach and unique management of this case. So super, keep it up, ma'am. All the best.
Thank you so much, sir.
Nilesh sir, your views, please.
Yes, that was a unique case because monitoring on CPK, generally these investigations are not done, and you have monitored it very well. So congratulations for the future.
So team, thanks a lot. And now we come to the ending ceremony of this 4th day of this first National Ayurveda Cardiology Symposium. And I am going to come back again to Dr. Rahul Mandole sir to understand his vision and his upcoming mission regarding some upcoming future events. Rahul sir, over to you.
Yes, Dr. Omkar, I'm humbled with all the appreciation I'm getting since last 4 days. Actually, this appreciation is something like everyone has the potential, and the potential needs some platform to show the world that they have something which they deserve, and actually. The thought of this National Ayurveda Cardiology Symposium came in my mind in last month only, and after that we started preparing how one case study should be, and we took so many of workshops, so many of session of what should be the research question, and how should be the presentation, and then I'm thankful to all of the doctors who responded me. Who responded to the call of a scientific cardiology symposium. I'm happy and very overwhelmed with their response. I'm happy that I blessed with the team, and the team of Dr. Omkar, Dr. Aman sir, Dr. Praveen sir, all the ZMH, including my coordinator Pallavi Mohe, my coordinator Harshita. They are not on the screen, but they are working continuously behind the screen. They are doing all the listing, wo presentation, PPTs, rows ka. I am thankful to Mr. Saurabh. I'm thankful to our Clifford, Yogesh sir, because all they are working behind the screen, and they are working continuously, and their efforts actually help to make this event very successful. And the good thing that I would like to share you again, that this was a National Ayurveda Cardiology Symposium, and with the success of this National Ayurveda Cardiology Symposium, we are planning the first Ayurveda Diabetology Symposium in the month of November. So as we are celebrating the World Diabetes Day in the month of November, so I request you all to prepare with your best cohort, best case studies, best case series of diabetes and diabetes complications, because we are going to present these case studies on the platform of National Ayurvedic Diabetology Symposium in the month of November. And I think this time, as I am thankful to actually MIPC Madhavbaug Institute of Preventive Cardiology, which is the chair of Maharashtra University of Health Science, for becoming the knowledge partner and taking the knowledge of whatever the knowledge what we have shared, this knowledge to across all the practitioners and all, and especially what we are planning, that maybe this symposium, this conference what we are planning to conduct on month of November will be in partner with all 2 different knowledge partners. But at the end, I'm happy and I'm very what I'll say speechless now almost. And thank you everyone. Keep it up and keep good clinical practice on. Keep collecting evidences. Keep focusing. And because if we want to flourish, if you want to take Ayurveda with the first line treatment option, याद रखिएगा अगले 10 सालों के बाद जब बच्चे नीट NEET क्रैक करेंगे तो उनके दिमाग में सबसे पहले आना चाहिए द आयुर्वेदा का सीट ले, और वो हमारे हाथों में है। to make a future change, right? जब तक हम प्रेजेंट में कुछ नहीं करेंगे तो फ्यूचर चेंज नहीं होने वाला. And we are a young generation and we are capable of doing this. So let's take वो कि यहाँ पे हम लोग ये करके ही रहेंगे. In next 10 years, Madhavbaug and Ayurveda will be the first line treatment option. So thank you everyone. Thank you, Dr. Omkar sir.
Thank you, and Jai Hind, Jai Ayurved. So bye-bye and take care, and keep studying, keep learning. We have a bright future in our hands. Bye-bye, take care. Thank you all for being participants of this fantastic first National Ayurveda Cardiology.
The recordings will be available on Medemy.in, who is actually the organizer of this event. And Medemy.in, I think आपको जो mail आएगा with a certificate, वहाँ पे भी link होगा. आपको वहाँ पे जाके you can see all the recording of your presentation as well. You can share those presentation and you can study those presentations.
Yes, thanks a lot, sir. Thank you and bye-bye. Take care.